Twin Health. Rohit, if you can shift to this side, in front of your photograph. Yeah, you take this seat. Sana, you take the last seat. Yeah, Ankit, please take this seat. Yes, thank you. He was there only. Mr. Vivek Srivastava, please. Over to you.
Thank you, Ankit. Good morning, everyone. It's my privilege and honor to be here to moderate this very important session on a very interesting topic, role of technology in bridging gaps and building community, which is something very crucial to the future of healthcare. My name is Rohit Singh. I'm Managing Director of Feedback Medical, a UK headquartered company, and we are into producing healthcare connectivity solutions. As we all know, today healthcare in India faces numerous challenges, whether it is about availability, accessibility, or affordability, especially when you talk about the rural and the underserved communities and the areas. However, technology has shown quite an immense potential in terms of bridging a lot of these gaps and connecting communities to better health outcomes. So today we have four esteemed speakers who are going to talk about in this important topic, wealth of knowledge and experience to this discussion. So allow me to introduce them. Dr. Kuldeep Singh Sachdeva, President and Chief Medical Officer at Mole Biodiagnostic. His company is pioneer in providing point-of-care micro PCR diagnostic system that can enable sample to result molecular diagnostic capability in resource-limited settings. Mr. Vivek Srivastava, co-founder and CEO of Healthcare at Home in India. His company is a leading healthcare services at home and transient care provider company in India. They are present in 70 plus cities across India and have treated 4 million plus patients so far. Mr. Ankit Modi, founding member and chief product officer at Cure AI. His company is a leading artificial intelligence solution provider that enable automated interpretation of radiology images like X-rays, CTs, and ultrasound scans and all. And then we have Professor Dr. Bipin Batra, chairperson of Assessment Panel and Internal Quality Assurance at BAPIO Training Academy. BAPIO Training Academy has been at the forefront of medical education and professional development of our healthcare professionals. Over the years, BTA has grown into renowned institutions known for its structured residency program, innovative training matters, and dedicated support for medical professionals. And we also have Sana Khan, Director Growth Twin Health with us. Welcome, ma'am. Thank you all for joining us today. Let's dive into discussion. So let's kick things off by uh, by having each of yours opinion about what you think about from healthcare CSR projects context, the role of technology over the last 10 years, how this has been evolved, how you see that the landscape emerging out over the last 10 years. If I start with Dr. Kuldeep.
Thank you, Rohit. I think everybody in this audience probably feels now that technology has sort of been at the forefront of medical science in particular, but in general in all aspects of life. Even in medical science, I come from a company which has a diagnostic background, and based on my other previous experiences, we have seen more and more diagnostic modalities are getting better and better. We have now tests which are more sensitive, more specific, and if we say you are negative for a particular test, you can be pretty sure that you don't have that disease. Having said that, we are also seeing what is known as especially our company's movement away from facility-based diagnosis. So we bring diagnosis closer to your home, your community, or to the most difficult places. And the one of the innovation which our company did was miniaturization of polymerase chain reaction, as they call it technically PCR, and you now can do a PCR practically in a very small cartridge. It's more microfluidics, and you get up test results within an hour, and you don't need practically an operator or a technician to do those things. Just have to load up a sample within the machine. Having said that, my other colleague sitting here also sort of let you know that even technology in besides diagnostics, in radiology, other areas, and even in intervention with the medical science has gained a great momentum. Most the solutions, the overall health outcomes are improving because of the technology. The even the surgery and other things are becoming easier, much easier to do because of the technology which we have today. Uh, I think stop here and give a chance to other speakers to delve on this. Thank you.
Thank you, Dr. Kuldeep. What your company is doing, that's a fantastic job in terms of from a diagnostic standpoint, things those were centered to a bigger infrastructure, diagnostic center, and how these PCR diagnostic kit is connecting to the rural settings and also great. So now I come to Mr. Vivek. Would you like to share your opening remarks on this?
Sure. Thank you. Thank you for inviting me over here. I think it's technology has transformed over the last 10, 15 years since the time we started the company. And basically, what does our company do? It's into rehabilitation and recovery. We have centers which does rehabilitation of people in 30 to 45 days they spend in our centers. Then we do home healthcare, which is self-explanatory, and we have chronic disease management. And like you said, we are present now in 100 plus districts across the country. And when we think of impact creation in the society itself, and especially in healthcare, the problems which you talked about was access and affordability, right? And then standard outcomes, because you'll be doing the same thing in Delhi and you'll be doing the same thing in, let's say, Bihar, and there will be a difference in the outcomes itself. So even if you have access, you can afford it, still the outcomes would be different. All the three get significantly impacted by the use of technology. Because in healthcare, you have health and care. Care requires the human element, but the scale can come through technologies in the health side of things, like Sir talked about, especially in the diagnostic side, because there, if you invest in awareness, screening, etc., and using technology without dependence on human operators, that scale could be humongous. And then because we have limited number of people available for certain doctors or paramedics, etc., using technology you can still dumb down the requirement of skilled people to deliver outcome, right? Something like that has happened in other industries like McDonald's, right? You wouldn't have needed a chef to make a burger, but now you can get it done with a 12th class pass, and you have all the processes and technologies involved in a different setting, giving a standard outcome at a cost which is reasonable, and it's accessible to around the globe actually. And the same thing you can do in healthcare also, where you're able to get, using technology, people assessed where you could not earlier, people diagnosed where you could not, people treated remotely, which you could not earlier. And hence it's a huge thing in my view. And from an impact perspective, and from a perspective of people who are investing in CSR, using those opportunities, you can change so many people who would probably not have got access, or or maybe affordability in this.
Thank you. Thank you. Very important points. And in fact, uh, the business where you operate, the healthcare at home, I also see that, the way you talked about how technology can enable less skilled people all to also deliver probably, the higher skilled healthcare interventions, which in a way can also take care of, the capacity crunch in the tertiary hospitals in the acute care and those areas, because this transient care is ultimately going to help, and that's where technology is playing a role. So thank you, Mr. Ankit. uh, uh, Sorry, Mr. Vivek. So if I go to now Mr. Ankit, Mr. Ankit, would you like to share your perspective?
Hello. Thank you, Rohit. Thank you, Heal team, for the invitation. When we started the company in 2016, all of the founding members of the company, we had graduated in computer science and we had done our masters in artificial intelligence. And the germ of the idea was that, this is such a great technology and we cannot keep working on getting people to click more ads through AI, right? It can do much more than that. And we thought that, if Facebook can recognize faces from your photos and suggest that, do you want to tag your friend? And this is like back in 2016. We thought, we can use the same technology to read X-rays and CT scans and tag certain kinds of diseases. Uh, when we started out on chest X-rays, especially on a perspective with tuberculosis. Uh, our assumption back then was that the more developed countries will adopt AI faster, which is usually the case with any new technology. For example, if you look at today at say something like an Oculus or a virtual reality tools, the developed countries are sort of adopting it first, and then it would percolate to the more developing countries of the world. But in healthcare, it was the exact opposite, and that was a great learning for us. That in the more developed countries, you can increase the efficiency of a doctor or a radiologist by 20-30%. But in the more developing countries, you can actually bring expertise where there is no expertise at all. For example, like US might have around one radiologist per 10,000 people. For India, that number is 100,000. And then there are entire African countries like Lesotho where there is just one radiologist for the entire country. So there are just not enough radiologists to read these scans. And from a CSR perspective, what happened was that we saw a lot of uh, NGOs, companies donating X-ray machines, tools to combat TB. But if you actually follow up that, like these X-ray machines are taking X-rays, but there is no radiologist to read them, right? So that's when we started understanding how to also get funding towards AI for TB, so that there is actually radiology expertise and we are not like just done with donating X-ray machines and be okay with it, because ultimately it has to be used then and there. uh, and that was a great learning for us. We ultimately became a company who are using AI in now more than 100 countries. But it was all countries where you wouldn't imagine will be the first adopters of AI. And the learning was that, the necessity is actually a bigger pull than just having some cool technology. So yeah, that was some of the biggest learnings that we had in the last 8 years of scaling Cure.ai.
Thank you, Shrankit. Very important points. In fact, QRAI have been pioneer in this area in India and globally as well. And especially you talked about tuberculosis screening, and I think for the presumptive screening, how quickly this AI can interpret the X-rays, and at the very first stage, the initial diagnosis can be done. That is a game changer thing. Now I move to Professor Dr. Bipin Batra. If you can kindly share your opening remarks.
Yeah, thank you. In the last 10 years, we have seen the successive progression from technology-enabled projects to technology-driven projects. In fact, today, healthcare is the second largest consumer of CSR. And within healthcare, almost all the projects, they are primarily being led by technology. I'll give few examples before actually coming to what exactly we have done. If you see the world's largest retinopathy screening program, that is purely technology driven, implemented over the course of last 15 years from India. Some of the best tele-ICU and telemedicine projects have emerged out of India at a global scale. India's free diagnostics program running as part of the National Health Mission, the radiology part of it, is currently nearly 100% driven by technology. It is 100% driven by teleradiology. Very few centers where we have complete coverage of radiologists from end to end time. Moving on to education. In education, the model which we have set up, eminent consultants and clinicians working in NHS UK are training doctors in India. We have touched the lives of 259 doctors in the last 3.5 years when we started this project. We started, and our parent organization is a charitable organization. It is a British charity. And with a grant from them, we started this program, which is entirely technology driven, hybrid program. Much of the clinical training takes place on ground, but supplemented by the well-established models of the NHS and the NHS England. In the next few years, we are likely to see the emergence of CXOs, or the chief technical officers, being there driving the projects, rather than stray combination of teams of few programmers and IT application specialists. And much of the attention already is going now for capacity building in all the workforce which is working on these projects for their technical empowerment.
Thank you. Thank you. Very important and useful comments, Dr. Vipin. I'll come back to you again. Ms. Sana, from Twin Health perspective, how do you see the this technology playing the role in the CSR side of the things? This Twin Health, as I understand, I think it's a very advanced and unique concept. So please.
Correct. I'm going to share more about Twin Health in just a bit, and I need everybody to listen to me with rapt attention because this is very important. And I'll make my answer, my comment very short and crisp.
Yeah,
right?
that I would request everyone, because I have many questions
Yeah,
and I'm also
yeah.
mindful of time that we need to
Yeah,
cover up.
absolutely.
So
So, Dr.
request.
Kuldeep, Vivek, Ankit, and Dr. Batra, privileged to be a part of this panel with all of you. So, when we talk about CSR, we're talking about numbers. In a country like India, we are talking about impacting millions of people once, right, in a certain amount of time period to achieve results. And how do we do that? I think technology has a very, very crucial role to play. It is, in fact, the future of the country when it comes to sectors like education and healthcare, right? All of you have an example of how technology is helping us. If I'm sitting here, I want to order a locked door for my room, let's say. I'll just order it online, pay via UPI, and ask a porter to deliver it to my place, right? Our house helps are using Paytm, UPI, all these transactions. So life has become very simple. A couple of years ago, this was not the case. So just look at the impact of technology and how we can now, sitting here, be a part of a live concert in America or any part of the world. So that kind of impact, I think, is what we need in a country like India. And when it comes to CSR and artificial intelligence technology, I'm going to list out some bullet points which I feel are the way forward. For instance, big data. We are using data in today's time, and data is so much more powerful. We can utilize that data and make an impact. With that, we can look at scalability in a country like India, right? We can scale any small project to a very big project, something which is unfathomable by a group of people, let's say a healthcare project. The moment technology comes into it, you can scale it. Then you can have measurable impacts. You can actually quantify the impacts that you are creating, right? That is possible only if you have data. Then you can bridge gaps, you can empower. People say when technology comes in, our jobs will be taken away. But I feel that the human touch, no technology can replace that. So in a sense, if we are creating a tool for radiology or other imaging, and trying to provide solutions for that, in a way we are empowering our doctors, because we always complain there are not enough doctors, there are not enough nurses in the hospitals for people. And then you can have personalized and very, very sort of precision treatment. That is the need of the hour. We won't waste time on figuring out what could be the solution, but using this data we could have that solution ready made. Twin Health is into this. We basically use data, and we use that data to give our members a very, very personalized and precision treatment to cure to get them, eliminate their medication for all chronic metabolic conditions. For instance, type 2 diabetes, obesity, fatty liver, PCOD, hypertension. Imagine if we can have these kind of solutions and scale this to a country like India. We're talking about curing millions of lives, helping people recover and live healthier and happier lives. Thank you.
Thank you, Ms. Anna. I'll certainly come back to you because you raised some of the very important points. Those were related to the data, and so I'll come back to you. But I think after hearing all the esteemed panelists, one common theme was certainly coming out that technology has started playing an important role in the healthcare space. And during this conversation, I'll try to get some more insights from the panelists around how we can link it up with the community initiative, CSR initiative, and how we can bring the partners together to leverage these technologies. So let me ask Dr. Kuldeep. Dr. Kuldeep, could you throw some light on different technology that Mole Biodiagnostic you are focusing upon in bridging gaps in diagnosis for patients and in communities? If you can, please.
Again, thank you, Rohit. So I'll divide. There are existing technologies and there are those in the pipeline. So I'll leave for the present what is in the pipeline. But existing, the most popular platform is called TrueNat. Again, it's a point of care diagnostic test. It can do about cartridge-based PSCR, turns around the test results in 40 minutes. And you can do tests for about 40 different odd diseases. Uh, TB, HIV, hepatitis, syphilis, other sexually transmitted infections, sickle cell disease, and so on and so forth. So 50 different type of diseases, the test results is turnaround time is 40 minutes and it's fully automated. You don't need a sort of an operator, a qualified operator or technician to do that. That's one most popular platform which is being used. The other is called an ultra portable or a handheld X-ray. Again, it's a point of care. You can take it to any place. Again, very friendly to do that. It can do X-ray, which and on top of that, if you load an artificial intelligence software, which Cure was referring to, you also have the interpretation of those images. So that's another technology which is readily available. Third, a separate sickle cell device that's already available. And these are all point of care and address the question of accessibility. You can take them to any place. They are battery operated. You don't need an electricity to do that. So you're not dependent on electricity, even in the most rural areas of the any part of the world or most difficult terrains. And you can also mount them. We also then sort of put these things on an either a SUV or an ambulance kind of a thing. So you can also take them anywhere you like and do it. Yeah.
Thank you, Dr. Guldeep. Unfortunately, I have been reminded again that we don't have much time. So what I'm going to do that I'll probably just quickly combine few of the questions and then each of you can, in maybe a minute or two, just try to address that because it's important just to key insights get to the audience. Mr. Vivek, if I come to your organization, so just quickly, if you can talk about how you are using technology for improving access and the affordability, and especially some work that you are doing into the CSR and the social sector. So that will be great.
Sure. So we have multiple projects which we do with the social sector or CSR, right? The first one is around screening and diagnostic, where we are doing programs which are like 50,000 people to 100,000 people being screened for liver diseases across the country using remote or using point of care devices, right? And that leads to a lot of early diagnosis, which leads to less mortality later. And similar things we are doing in liver, metabolic diseases, etc., and very, very large scale. And this is funded through CSR. The second type is when we have worked with PHCs, again sponsored by CSR, where we've done large scale adoption of PHCs and then doing doctor consults, because you don't have doctors there, consulting doctors, so telemedicine in that. And then we are using a lot of technology to enable people, like I said, people who will probably not be very well uh, trained stroke educated, but using technology, uh, telling them exactly what to do, much like what happens in a McDonald's, so that you're able to deliver service in off locations at a price which is much more reasonable, because you're not getting super specialist or super specialized infrastructure. All of that is available centrally, and hence you're able to deliver outcome in far flung at lower cost. And then the fourth thing which we are doing is improving human capital, right? So just using technology, which is generally just video technology itself, to train people from far flung locations so that they become capable to become employed.
Thank you. Thank you. So many important points, but unfortunately, I will not be able to build upon on that due to paucity of time. Mr. Ankit, I'll just combine two things here. First, how you are using Cure AI solution to improve patient outcomes in the remote settings, and from a collaboration standpoint, how your organization is fostering collaboration between healthcare providers, government, and NGOs, again from a CSR standpoint.
Got it. Uh, yeah. So how we are bridging gaps there? I will give you an example of a project, right? So in Philippines, from their capital city Manila, there is a van with an X-ray machine that used to go to different villages from Monday to Friday, collect X-rays of probable patients of TB, and then it will come back to the city where radiologists will read those X-rays for 2 weeks, and then in the fourth week it will again go back to those cities with a TrueNAT test and the medicines for TB, and if they are confirmed, then hand out those medicines. It was a 4 week cycle, and after 4 weeks, a lot of those patients will not come back to the hospital because these are daily wage workers who will not want to lose one more day of their wages, and you lose a lot of TB patients because of that, which results in more propagation of TB among the community. With AI, what happened was we actually optimized our AI algorithms to fit into that X-ray van, where as soon as the X-ray is taken, within 30 seconds, you get an AI diagnosis. And right then and there, then you can do a TrueNAT test. And right after that, you can hand over the medicines to the patient. So no patient is lost, so because of that technology, we proved that a lot more TB patients can be identified, which in result means that a lot of propagation of TB can be controlled, and which also means that a lot of TrueNAT tests were being saved. So we did recently a study with ICMR where we proved that using chest X-ray AI is actually reducing the cost of identifying one TB patient by 10,000 rupees per TB patient, right? So that was something that we saw in the community. About the second question, building communities, right? So to run a screening program for TB, right? See how many technologies have to come together. There is AI for cough sounds, where multiple companies, where the patient has to just cough on their phone, and then the AI will detect signs of TB. If there is something found out, then they will give a chest X-ray. The chest X-ray I will do a screening over that, and then some a mall bio kit would be present there, where you will finally do the microbiological test, and all of this has to be funded by an NGO or CSR initiatives, and then governments are running these screening programs. So all of this is like sort of a lot of stakeholders are involved in running this program, and we have been trying to build a platform where all of this can come together, right? So on our platform we can host AI for not just chest X-rays, but any other AI company can come to the platform. We can host them and be that platform which provides those solutions. We build really detailed dashboards that governments can monitor and officials can monitor, where which screening programs are working out well and not well. And then similarly, we collaborate with, I think there are a lot of sites where Cure and Molbio are present together, where these technologies are helping screen patients better and in a more efficient way.
Thank you, Mr. Ankit. Sorry, I had to interrupt, but very important points and great to hear fantastic work that your organization is doing. Professor Dr. Bipin, I'll just combine two things quickly, and if you can just quickly comment on that. First, from a academic research standpoint, how do you see the healthcare innovations that can be adopted to the healthcare CSR project, just to ensure that their impact goes to the last mile, the community and all, and the sustainability aspect, and how technology can enable the CSR projects to be more sustainable and scalable. Sorry, just few words on that.
See, the answer of both the queries lies in capacity building, and we have to address that from the very beginning. Today, a greater part of the grassroots healthcare delivery, whether it is CSR or public health network or even corporate public health and CSR projects, is being delivered by non-doctors, health workers, and possibly allied health workers. They need to be technology empowered with use of technology from the very beginning, with the use of computer-aided diagnostics, data surveillance, data analytics. I think it is important that we start building up knowledge about these tools, practical applications right in their curriculum, so that when they are hitting the market, they are working on the projects after attaining their requisite degrees, diplomas, they are ready for that environment, rather than spending another 2 or 3 years and more investment to make them technologically enabled.
Thank you, thank you. I think this was a very important point. When you do this at from a training academic level itself, then it becomes easy to implement it as people go into the profession. So now, very quickly, I refer to the data point. So just very quickly, what's your comment on so many data is now floating around, and the technology intervention, especially in the healthcare space, and when the CSR aspect comes into the picture, how you look into the data privacy, patients' data safety, and all? Your quick comments on that.
Yeah. So there are laws that are very, very specific that one needs to follow, because data privacy is indeed a huge concern. And it's not just about the quantity of data. At the end of the day, it's about the integrity and the quality of the data as well. So if, say, I am tracking my or I'm tracking my heartbeat or my body fat percentage, I must be very mindful about the trackers that I'm using, right? They must be accurate or as close to accurate as possible. So all these things I think, to continuously work on. And in a country like India, there is huge potential, because if you talk about any AI player in the world right now, for them, India is a gold mine, right? Because of the sheer numbers. And we have that advantage to ourselves. So we must take the lead, and we can be the world leaders if we take the right steps right now and set an example for the world to follow. So we can make a huge difference. And like I said earlier, in healthcare, education, all these social sectors, technology is the only way forward. Thank you.
Thank you so much. Important, relevant comments for everyone. Just to add, even from our standpoint as well, we are deploying technology on community TB screening from a digital pathway standpoint. So I think the common thing from this panel is technology is going to be the key enabler, key driver in terms of scalability, transparency, and sustainability of the future CSR projects. What we all have to think it, how we can foster up good partnerships among each other, so that the wider stakeholders and the benefit could pass on to the communities. So thank you very much for esteemed panelists and the wonderful audience. Thank you so much.
Thank you, Mr. Rohit. Now I would request Mr. Adarsh Sharma, our media advertising partner, to please come forward and present token of appreciation to our panelist and moderator. Dr. Kuldeep Singh Sachdeva, President and Chief Medical Officer, Mole Biodiagnostics. Mr. Vivek Srivastava, Co-founder and CEO, Healthcare at Home India. Mr. Ankit Modi, Founding Member and Chief Product Officer, Q.ai. Dr. Professor Bipin Batra, Chairman, Assessment Panel, Internal Quality Assurance, BTA. Ms. Sana Khan, Director, Growth, Twin Health. And last but not the least, our moderator, Mr. Rohit Singh, Managing Director, Feedback Medical India Private Limited. Now I would request all the panelists and moderator please come forward for a group photographs. Thank you so much. With this, I move on to our next session, which is about the girl power. So the session name is Her Influence, Inspiring Stories and Strategies. The session would be moderated by Miss Misha Dange, Board Member, Heal Foundation. Miss Misha, if you can please join us. Panelists for the sessions would be Dr. Rajvi Joshipura, Senior Coordinator, Self-Employment Women's Association, SEVA. Dr. Sampa Banerjee, Executive Director, World Association for Small and Medium Enterprises. Dr. Anita Sabharwal, President, Forum of Obstetric and Gynecologists of South Delhi. Dr. Sonia Lal Gupta, Director, Metro Group of Hospitals. Ms. Medha Gandhi, Founder and Principal Consultant, Counterpoint Impact Advisory. And Dr. Smita Singh, Head Industry Division, Yamuna Authority. If all of you can please take seat in front of your photographs. Thank you. Over to you, Ms. Misha.
Well, it really looks like women power on the stage now, so kudos to it. Good morning, everyone. And we really welcome to this Healthcare CSR ChangeMakers Summit conducted by Heal Foundation. I am Misha Dange. Um, I'm the founder of Optimize. We do skill development and employment generation program for the youth. So far, we have touched upon more than a lakh of youth lives by making them employable in different states. So here we have very interesting panel. We have Dr. Rajvi, who is senior coordinator at SEVA. We have Dr. Sampa Banerjee from VASMI. We have Dr. Anita Sabharwal, who is president of Forum of Obstetricians and Gynecologists of South Delhi. We have Dr. Sonia Lal Gupta, who is director with Metro Group of Hospitals. We have Ms. Medha Gandhi, who is founder and principal consultant with Counterpoint Impact Advisory. We have Dr. Smita Singh, who is head of industry division of Yamuna Authority. So having such distinguished guests, I'm sure you would all like to know about their life journey, how they really have made, because they're all achieved a lot in their lives. And before we start the journey, I just want to add that women in leadership is like we all know that they are really going places. There's nothing left from astrology to astronomy where they haven't made their mark. And if we talk about, we generally say that it's not only their diverse perspective, problem solving areas, or innovative approach that we count on them, it's also the high EQ we really bent on, which is really, really essential part and ingredient of any social programs. I think in earlier forums we were discussing that it's very important not only as a society but also as an individual that we should be giving, we should be caring for the people, for the environment in which we are living. So CSR also is a natural tendency towards it, where we want to incorporate if we are having some privileged professional lives or some industrial forums. I would just like to add, to lead, you must first listen with an understanding heart and then act with a decisive mind. And if you have the combination of both, which we have, I think all of us, with the ladies sitting over here, so I don't think so there is anything which can stop us from achieving our goals and also simultaneously contributing toward the society. Start with, I would like to start with you, Dr. Rajvi. I think except for one or two, everybody else is doctor over here. Me and Medha, we are the only one who are non-doctors. Oh, okay. Not a issue, but still we have done our research, right? So, Dr. Rajvi, if I know, Seva is one of the biggest organization which is doing a lot of work, and they currently employ more than 2.9 million workers in 18 states, and which has been very, very instrumental in doing a lot of grassroots root level for the community. So I just want to know that what exactly is the type of work which is connecting you with the healthcare issues at the community level, and what are the challenges, if any, you have faced so far, and also if you can give us some example that how you have implemented, that would be really helpful for all of us.
Uh, to begin with, uh, in order to deal with the community, the key to have is the trust base. So, if the community trusts you, they'll be open, they'll be vocal, and approach you to ensure that any given healthcare intervention at Seva basically has four pillars. One of them is the cadre of healthcare ambassadors that we have. So, they are representatives from the community who interact with us and bring out the problems that they are facing. And they receive education, awareness, capacity building, trainings from the cadre of in house doctors that sit at the office. So they are trained on various topics, which include climate change, non communicable diseases, and in non communicable diseases, they will be equipped with point of care devices so that the major problem that grassroots communities face about accessibility and affordability gets addressed there and there itself. Then there'll be any given topic which includes routine immunization, exclusive breastfeeding. So, with women as center, the whole family is considered as a unit, and then these SHAs, who we call the Seva Healthcare Ambassadors, will go address them, we'll talk to them, address the hesitancy, address the knowledge gap, and act as a bridge. The second pillar we have is the data integrated approach. So we have equipped them with an application which helps record all the basic parameters, which include their blood pressure, height, weight, their basic chief complaints, and their random blood glucose. Because they have those point of care testing devices, they can approach those members. That data comes to us on a regular basis, we analyze them, and then it leads to sequential tracking. Another key component of this program, when we club data and SHAs, is the regular follow up. So in order to ensure adherence to the treatment, the key is regular follow up. Because after a while we have observed that women, they keep others as their top priorities because of their intrinsic caregiving nature, and their health often takes a backseat. Hence regular follow-ups are mandatory. The third and the most important pillar is the holistic and the integrated approach, that it is not only health, but there are various determinants that might impact their health. Point one being livelihood. It is, or health is their asset. So if any given day they are not able to go work, it'll directly impact their livelihood. They don't have enough savings to spend on healthcare. So if they have to spend out of pocket, that will push them into the vicious cycle of medical bankruptcy. Hence the need to have the holistic approach, wherein it is not only health but their livelihoods, education, food security, income security, and clothing and housing gets involved. So these are the key focuses with which Seva addresses any given intervention, any given health intervention that we have.
Can you also tell us some example where you have focused on women healthcare specific, maybe to their hygiene issues or stuff like that with any community?
Yes. So women's hygiene, women's nutrition, these are the key topics, key public health issues that are prevalent in the community. But when we have focus group discussions with them, they often highlight that there's a taboo, there's a hesitancy. They don't want to open up and talk to us about it. So, in order to address that, we have had several training sessions, education, awareness, capacity building, wherein we sit with them, talk to them if required one on one, and have topics covered like menstrual hygiene, the wash habits, the nutrition requirement, which are age specific. And as I said, that with climate change being an additional burden to them is causing a disproportionate impact. So, going down the lane, Seva plans to focus more on tampons, which will address their hygiene issue as well. But the key barrier to that is accessibility and affordability. Like most of the women who are in a hand to mouth situation cannot go and afford the upfront cost of a menstrual cup. So, these are the small issues that we want to address. And
Thank you, Dr. Radvi. That was very, very insightful to know about what you have been doing, program at such an extensive level, because looking at the sheer size of the workers that you have, I'm sure you guys have really done a true work. So now to move to enterprises, SMEs, which means a lot. Nowadays, everybody talks about SMEs. And I myself keep getting calls from a lot of women entrepreneurs who are talking about how do they get funding from SMEs and how they can set up their own entrepreneurships. But here we are talking about uh, WASME, which is a very instrumental association in supporting small and medium enterprises. And Dr. Samba Banerjee, she is the executive director with them. So to start with, what makes you get associated with these CSR programs, especially in healthcare, and what you have been doing as an association, and where you have been talking about the benchmarks, so that SMEs are also inspired to do something, because generally they have constraints about the resources. We all know, that is the scale that they operate on. So please share your insights, Dr. Sampa.
Thank you very much. So, congratulations to all of us ladies here. So we are a leading MSME organization. Let me give an intro of our organization, then I'll come to your question. So we have members, associates, and offices in more than 112 countries of the world. So we are dealing with different MSMEs, different SMEs. But now, like now means post-COVID, we have started focusing on health. MSME is dealing with healthcare activities, health instruments, health technology. So now I'm coming to your question, how we are dealing with this, like in a CSR. Okay, so yeah, of course, I mean CSR has a focus, and every year they have their own subject, own topic, and with a fixed decided amount, they give it to the NGOs. So WASME being an NGO, of course, we have that leverage to avail the fund, but it's not adequate, I must say, because when we are saying MSME, and MSME is, I mean, in any country, 40% of the MSMEs contributes in the economy, 40%. So it's huge, and we cannot, yeah, it's quite a lot, and we cannot, depend only on CSR activities. So we do have different strategies of, raising fund. That's a different segment, but of course we are getting CSR fund, and through different CSR activities, not only in India, we do have approaches, connects in different parts of the world. So through African Union, through UNESCO, through different united bodies, we get fund, and we help health MSMEs, prospective entrepreneurs, to set up their units. And when specifically companies dealing with AI now. So this year we are focusing on AI technology. Then like big apex institutes like NABARD was our member, SIDBI was our member. Now this membership pattern has changed, but definitely we are the nodal agency of SIDBI. So anyone who is interested to set up their MSME, set up their unit in India, any part of India, please do connect us, please call us. We are there to help you. So there are different schemes through SIDBI. I'll not, it will take a lot of time if I go into all the detail, micro detail. Yeah. So please search our website and SIDBI's website. You will get all the detail, and we are happy to, help you, support you. And of course, through CSR activities, we are doing a lot of activities, and MSME support, entrepreneurship support through different bank loan scheme. Thank you.
Thank you, Dr. Sampa, for sharing all these useful tips, what SME is doing and how we can get funding also from SIDBI or through your organizations, and what all work you have done so far. That has been really very inspiring. Now, let me come to Dr. Anita Sabharwal, who is president of Forum of Obstetricians and Gynecologists of South Delhi. And I think you are the person who is directly impacting the lives of women, right? So we would really like to know that what exactly are the pressing issues with women in today's scenario, and how you are dealing with it, and also how you are correlating it with CSR forums with other organizations or with other industrial bodies. Over to you.
Thank you so much, Misha ji. And also thank you to the Heal Foundation for giving me the opportunity to be here amongst all of you on a very, very special day. Because all of you and all of us, we all have mothers, the women, and who are our best teachers. So today happens to be Teachers' Day. So happy Teachers' Day to all. And as my friend just said, she made us all clap for the women because women, you know, your own mother, we all admire them. So I'll just say a few words for these women, you know, when you all start walking with these women, you know. So you're walking with the dreamers, the believers, the courageous, the planners, the cheerful, the successful women with their heads in the clouds and feet on the ground. And definitely their spirits would ignite fire amongst you if you really start walking with all these great women, and your world will be really much, much beautiful and wonderful. What it would be without them. So women are really, they have very important part in any society. So, but it's very sad to know that, you know, women are suffering from so many diseases which can be very easily be prevented. See, all of you sitting here, I don't know how many of you know about cervical cancer. You know, almost 1.5 lakh women are dying because of this in our country every year. Every 8 minutes, one woman is dying because of the cervical cancer. And most of the people don't even know what is cervical cancer. This is the mouth of the uterus. This is the mouth of that pious place from where we all have come out. That is called bachedani, you know, in general people know. So we don't take care of it. We can easily prevent it by giving vaccination to the girls right from the age of 9 years till the age of 20 years. If you give even one vaccine now, though we have to give two, we can prevent so many of these deaths. So this is what we are trying to do. I also represent the Federation of Obstetrical and Gynecological Societies of India. We are 45,000 members, 275 societies all over India. So we are doing a lot of public awareness. We are trying to give this kind of public awareness. What is cervical cancer? So if you just give, now WHO wants to eradicate it by the year 2030, but so much is happening here. So we all have to be together in this. Now you all are sitting here, we all should create lots of awareness and make all these girls take this vaccine, which is easily available. Government is also now coming up, maybe they'll put it in the curriculum, but till then, at least we should promote it. We should help those who cannot afford it so that they can be prevented from this disease. Also, we have screening for these people, as we just talked about the technology. So we have this cervical cancer screening by the pap smear test, which is very popular, and the HPV test, that is the human papilloma virus. Like COVID was so popular, we could eradicate it. So this virus also, HPV virus, also can be tested. So these two things, if we really follow, so we will prevent all those deaths. The last part is treatment, but I'm here to tell you about the prevention, and then first, before that, awareness. And second thing I want to touch upon all of you is anemia. Are these women, are these teachers, our mothers, all our women, they are suffering from anemia. You know, almost 60 to 70% ladies are having anemia. We don't even know how much our hemoglobin should be. It should be 12 gram for all women. Although in pregnancy we say, okay, it should be 11 gram plus. But all those women, no, adult women, if their hemoglobin is even 11 gram, they are anemic. But we feel when they're very sick, when they'll have breathing problems, they will not be able to work at all. That is the time we'll label it as anemia and then take them to hospital and take treatment. So it's not that. Now our government is also doing anemia Mukt Bharat, but it will become only then Mukt Bharat, because if all of us work together and get rid of it. And you know, we are all working on this anemia for the last more than 50 years. So many schemes are coming since 70s, but still we are all anemic. So if women are anemic, how are we going to progress? So these are the two things. So we at our levels, we are really trying to give lot of public awareness throughout the country. Even cervical cancer screening we did for all CRPF women all over India. So which we are trying, but we have to continuously go on with this. So this is what I wanted to tell.
Thank you so much, Dr. Sabharwal, for your insights. And basically, all the issues which you have touched upon, whether it's cervical cancer or it's anemia, and which we all face in our daily lives. And if we are talking about how WHO has been eradicated polio, from India, maybe these things can also be eradicated by 2030, which can be SDG goals. And we
Actually,
can
one thing
holding.
more I wanted
Yeah,
to
please,
just
please
touch,
share.
because this is very important, because people hesitate to talk about it. You know, that is menstrual hygiene. Menstrual hygiene also has a role to play in giving us cancers also.
Very important role.
So menstrual hygiene, people don't even talk, and they say, oh, that man is there, our husband is there, don't talk in front of him, or father is there, don't talk in front of him. Why? Because we are a society, and all the men have also come from that uh, same place, uterus. That is the most pious place, you know. So the menstrual hygiene, I always advise people, like, you know, they have to change their pads. People think we can save money on this, so why to change pads? So we don't bleed so much, why to change the pads? So they have to minimum change 4 to 5 times in a day, whether they have more bleeding or less bleeding or whatever. Then the last third day, fourth day, they have hardly very little bleeding. Then also they think, okay, we can manage with one pad. So if all these simple things, you know, they are inculcated in them, we will really have a real good life, and lot of morbidity and mortality would be prevented. Thank you.
Yes, I think that's very important, the awareness of all these hygiene things. And thankfully, in the society, we are having that awareness now. There has been this movie by the name of Centipede also. So I think we should be coming out of that enigma soon. So now, going in the same line, ultimate, what you call last mile delivery are the hospitals, right? Where we can check the deliverables, what exactly is happening, what is the efficacy of so-called CSR programs, which so many forums, industries, companies, they are implementing. So now I would like to ask Dr. Sonia Lal, who is from Metro, that now you are at the helm of affairs, you are on board with Metro, and which is such a prestigious brand. So, what do you think is the main focus areas of CSR, and how it has been impacting the patients? Because we all talk about it, but ultimately the patient is coming to you. So, how you are actually implementing it and how it's affecting their lives?
Firstly, thank you so much. Good afternoon, everyone. Thank you so much for having me. Such a privilege to be with such an esteemed panel. And thank you, Heal Connect, for thinking about me. So when it comes to, hospitals, of course, we are that end delivery point where people uh, come in when they are sick. And whenever anybody thinks of hospital, they think, okay, if I'm sick, I will go in. And on the note that Dr. Sabharwal said, the only time people come in heavy are probably when they're coming to deliver a baby. Otherwise, usually they're not happy when they come into the hospital. So it's a place where empathy is, I think, key. And as a hospital, uh, it's very important to provide that, because there's nothing compared to giving good patient care, and I think that's the most important thing. Now, coming from a family of cardiologists and me being a neurologist myself, preventive healthcare I think is extremely important, and that's where CSR comes in. Because of course, once somebody walks in, they're coming in with a heart attack or they're coming in with a stroke, we are doing what needs to be done to treat it. But how do we even prevent that from happening is important. And I think that's where hospitals can play a big role in bringing awareness as well as in screening. So, as we know, we all, like we at Metro as well, we do a lot of health camps where, even when you're checking something as a random blood sugar, that is so small. Like you might would say, what is a random blood sugar? They're just pricking and they're checking the sugar, but that can help us detect diabetes at a very quick level. Checking their blood pressure. People don't take these things seriously even now, and that's where I think the problem is. People think, okay, it's okay, I have blood pressure, I will exercise, but they have to understand it's you have to exercise. But blood pressure and diabetes are two things you cannot play around with. They are our biggest risk factors for cardiovascular disease. Nowadays, when everybody's very scared after COVID, you keep on reading in the newspaper, this person suddenly collapsed and that person suddenly collapsed, and people come in so scared. What are we supposed to do? This person was running around, they were healthy. What is happening? I think key is you have to also look at your risk factors. Look at your family histories. Look at how you are eating. There's how you are exercising, what are your blood sugars. A lot of people don't even get their blood test done till they have a problem. And a lot of times I tell people, simple annual blood tests should be done after the age of 30 for Indians. I'm a big believer. We are desi people. Our genes overtake us. Our food habits overtake us even more. The samosas and the puris and the halwas, we just can't help it. When we see it, we get too happy. That key little 2% of people who say we eat healthy, but majority of people who come in love their food and they love to eat. So I think hospitals, like we, of course, doing health camps, bringing awareness and detecting it early and then treating it. I think that is the key. And then spreading awareness on, yes, you have to get it treated. And now government has a lot of programs when it comes to medicines. And I think the other problem is, Misha, that people don't even know about these programs. We as healthcare providers don't know about these healthcare programs. And so it's, I think, very important that healthcare providers also get educated on how they can provide those facilities to their patients so that money is not an issue and at least they get good care. So I think that is extremely important. Another thing I wanted to touch upon, a topic very close to my heart. I'm a headache specialist more so. I specialize in that. So I see a lot of mental health issues, anxiety, depression. It is still so underrated. We talk about menstrual hygiene. I think when we talk about mental health, it again is that issue. People come to me not wanting to go to a psychologist or a psychiatrist, that log kya kahenge, that taboo. And I will just take 1 minute, if you don't mind, just explaining, right? So, when we talk about diabetes, what is diabetes? High blood sugar. Why does it happen? Simple terms, insulin. Somewhere your body is insulin is not regulating itself. That's why it's you're getting diabetes, right? Blood pressure. Ideally, most people, your body should be regulating your blood pressure. आपका जो body है वो आपके blood pressure को control करना चाहिए, but बहुत लोगों में नहीं करता है. क्यों नहीं करता है? Again, a chemical issue. Now let's come to mental health disease, anxiety, depression. Why do we take that as a taboo? That is also a chemical issue. That is also a neurochemical issue that can be treated, that can be managed. Why do we take that in a negative connotation? We accept everybody with blood pressure, we accept everybody with diabetes, but we do not accept people with anxiety. Having anxiety is normal. If you don't have anxiety, there's a problem. I think so we have to understand that. एग्जाम देने जा रहे हो, एंग्जाइटी होगी. स्टेज पे आ रहे हो, एंग्जाइटी होगी. कुछ नया होने वाला एंग्जाइटी होगी. कभी कभी मूड भी लो होगा. So these are normal phenomena your body undergoes. Happiness, sadness, jealousy. These are normal things. But when they get to a point where you cannot manage those emotions, you need to get help. And it's just a call out to everybody. Please take help. There are so many online resources now available, where if you're shy and if you're still taking it as a taboo, please reach out, and it will make such a big difference, especially when it's coming to children. I think nowadays it's also extremely important. So I just wanted to kind of touch on these, some important things that are very important. Yeah. Thank you.
Thank you, Dr. Sonia. In fact, this is also a topic which is very close to my heart. So far, we are all talking about depressions, feeling low, lying low, hormonal issues, and they are all very hush hush things. People don't come out in the open, and they are not so aware also whether to seek proper treatment, because this is, as you rightly said, neurological chemical issues which can be actually made right by having the right pills and proper medication. But still, so many of us, even the youth and even the old age population, they are not getting the help at the proper time. I think we should really take care. And also what you said is about the healthcare programs. They should also, there has to be certain awareness which needs to be generated even for doctors and hospitals to implement them, which is not there at the moment. So I'm moving now next to Medha, who has been a healthcare consultant, and she has worked with most reputed international organizations, NGOs, forums for, I think, more than quarter of a century. And she has worked, well, that's not revealing your age. And you have worked very closely with the health sector so far, and I believe you are very, very passionate about women productivity, gender causes. So, Medha, can you just tell us about your programs, what you have been doing, and how it has been effective, and if any challenges you have come across in your journey so far? Thank you. Thank you, Medha.
Thanks, Misha. Um, so yes, for 20, almost 25 years, yeah, I've been working on an area which is called sexual and reproductive health and rights. And the reason why I'm using these words is because a lot of people get very uncomfortable. And the groups that I'm usually used to working with and engaging with, there it's very normal to use this language. But on purpose, I wanted to use the words here because it's a diverse audience. And the panelists before me have already sort of alluded to the fact that we shy away from addressing a lot of these issues. Majority of my work has been in rural India, working on increasing access to contraceptive choices, strengthening respectful maternity care, working on increasing access to safe abortion services. All of these issues are so critical, and the groups that are working on this are Indian and international non-government organizations. In the morning, I was hearing a session where we were talking about trust. We've got Seva here that has been working so extensively, and there's so many NGOs that work, and I think it's two different worlds. We don't know a lot about the NGOs. Like, I don't know a lot about what the corporate world does and the deliverables that you have. There's a vast world out there that's making a lot of changes. And in my 2.5 decades, I have seen maternal mortality decline so significantly. I have seen infant mortality decline so significantly. What that means is now lesser women are dying in childbirth. No woman should need to die in childbirth. No child should die in infancy, right? But there are still so many deaths that happen, and if I go into morbidity, there's really no count of it. So what we truly need is a partnership, and I now work with so many smaller NGOs which are looking for CSR funding, but they really don't know where to go, and how to get that fund. There are great programs that are there. The government runs a range of public health programs, but there are also a lot of education initiatives, to the point that, ma'am, you were making around SMEs. There are so many women self-help groups that exist that are doing such great work, but there's just no way for them to get that funding, to get that capital. These are all women-led initiatives which are doing great work. They have small units, whether they're making dals or they're making sanitary napkins, but there's nobody investing in them. You talked about health camps, right? But there's a world out there that is needing services. How does that linkage happen? So I think we need to be open and trusting, and we need to be more forthright and believe that there's good that's happening. And once that happens, we're able to bridge that gap and reach out to people who are actually working very hard to make a difference. And there's a whole sector there which you call NGOs, but that's an impact sector that is making a difference in people's lives at an individual, at a mass level. So I think this gap needs to be bridged, and I think more such conversations between the sectors need to happen. I'll pause there. Thanks.
Thank you so much, Medha, for your insights. And yes, it's very much needed. We need that bridge. We need that linkage programs where NGOs and all these social workers, they know how to connect with the right bodies, how to avail of the CSR funds, whether it's from the PSUs or the corporates or industry bodies. I think that's very important because people who are working at the ground level, grassroots level, they should be aware. Otherwise, what is the point of the entire exercise? So lastly, and but not the least, we are talking about the industries. Industries or working in the companies is not only about profits, but is also about giving away to the society. So we have from Yamuna Authorities, Dr. Singh, who is going to discuss with us what Yamuna Authority is going to do or is doing for CSI initiatives and how you have focused it on healthcare and women-centric issues. Dr. Singh.
सबको नमस्ते। पहली चीज़ तो आई एम अ नॉन डॉक्टर ऑफ कोर्स। हम लोग ईटा गारा खड़ंजा आप लोगों ने ये सुना नहीं होगा बिकॉज दिस इज़ अ मेडिकल फ्रेटर्निटी के स्पेशलिस्ट हैं यहाँ पे। पर एक चीज़ कहना चाहेंगे कि आई टुक ऑफ फ्रॉम डॉक्टर सबरवाल, आप बहुत अच्छा काम कर रहे हैं। मैम आपकी बातें सुनी और आप तो हमारे एंड उसमें हैं। at the basic of all these activities, of all these discussions is the single unit human. Human being या human body की बात होती है और शारीरिक के साथ साथ मानसिक अवस्था की बात भी आपने करी। अथॉरिटी के लेवल की बात तो हम अलग से करेंगे क्योंकि वो एक CSR और इंडस्ट्री रिलेटेड बातें होती हैं। बट पहली चीज़ क्या है व्हाट आई वुड लाइक टू शेयर हियर, बेसिकली आई एम अ कैंसर सर्वाइवर और ये काफ़ी पहले की बात है, लेकिन आपको बता दें कि उस समय जब डॉक्टर ने ये बात कही थी, तो पहली चीज़ तो आई ब्लैंक्ड आउट। फर्स्ट थिंग वाज़ आई ब्लैंक्ड आउट इन स्पाइट ऑफ ऑल माय एजुकेशन और एवरीथिंग, ऑल माय एक्सपोज़र। पहली चीज़ ये थी कि आई वाज़ ब्लैंक, मुझे कुछ समझ में नहीं आया। तो इफ़ एन एक्सपोज़ पर्सन जो पढ़ाई लिखाई भी करके आ चुका है, उसको अगर ऐसा वर्ड यूज़ करा जाता है उसके सामने और वो क्लूलेस हो जाता है, सो यू कैन अंडरस्टैंड कि जो हमारे रूरल पार्ट के लोग हैं, जो हमारे नॉन एजुकेटेड हैं या नॉन एक्सपोज्ड लोग हैं, उनके मानसिक स्तर पर या आपका फाइनेंशियल स्तर, हर चीज़ पे ही एक बहुत बड़ा झटका लगता है। हम CSR कर रहे हैं, इसके पहले वाला सेशन भी हमने सुना, उसमें वी हैड अ लॉट ऑफ मेडिकल एडवांसमेंट डिस्कशंस। हम बहुत आगे जा रहे हैं, लेकिन हम बहुत आगे जा रहे हैं किसके लिए जा रहे हैं? द पर्सन, द बेसिक यूनिट ऑफ ऑल व्हाट वी आर डिस्कसिंग हियर। सो फर्स्ट वी हैव टू फोकस ऑन द पर्सन। पहली चीज़ जो डॉक्टर साहब आपसे रिक्वेस्ट करूँगी कि या जहाँ पे भी मेडिकल ऑर्गेनाइजेशंस हैं, हॉस्पिटल्स हैं, कि हम एक डायग्नोसिस या आपका जो भी मेडिकल रूम है, उसके साथ-साथ हर हॉस्पिटल में मैंने देखा है एक पूजा घर भी होता है। एक कामिंग रूम भी बनवा लिया जाए और हमारे जो आपके सोशल वर्कर्स हैं, काउंसलर्स हैं, पहले हम उनको एजुकेट करें क्योंकि डॉक्टर के पास पहुँचने के बाद जो लैंग्वेज बताई जाती है, वो हमारे लिए जार्गन होती है। फॉर अ कॉमन पेशेंट इट इज़ जस्ट मेडिकल जार्गन। उसको नहीं समझ में आएगा कि उनके प्लेटलेट्स यहाँ से यहाँ पहुँचे या ये वाले पैरामीटर्स ठीक नहीं है, ये यहाँ डिविएशन है, यहाँ वेरिएशन है, इसका इम्पैक्ट ये है। देयर हैज़ टू बी समबडी इन सपोर्ट जो डॉक्टर से डिस्कशन के बाद उस व्यक्ति को ये समझा सके, हाँ, एक समस्या आई है, लेकिन वील होल्ड हैंड्स एंड गेट ओवर विद इट। You need that softer, that calming part also in whatever facility you are providing. एक व्यक्ति ऐसा या एक ग्रुप ऑफ लोग ऐसे होने चाहिए। इवन काउंसलर्स को मैं आपको बताऊंगी डॉक्टर साहब, वो भी बहुत क्लिनिकल भाषा का इस्तेमाल करते हैं। ये है, ये। मैम आपके लिए भी रिक्वेस्ट है कि आप इतना बड़ा काम कर रही हैं सेवा वाला, तो आपके जो काउंसलर्स हैं, पहली चीज़ तो ये बहुत ज़रूरी है, लाइक इफ़ वी स्टार्ट मूविंग फ्रॉम दिल्ली, Delhi to Eastern UP to, you can say, Bihar or Northeast states. वहां पर आप किसी काबिल व्यक्ति को काउंसलर बना के आप भेज सकते हैं, बट डज ही और शी relates to the person, to the type of patient who's coming there. If it is an Eastern UP person or a Northeast person, a person उन्हीं की कम्युनिटी से, उन्हीं के साथी जो उनकी भाषा में उनको एक्सप्लेन कर सके. किसी को अगर ल्यूकीमिया की बात है तो डॉक्टर के साथ जो स्टाफ है उन्होंने बता दिया कि आपको ये समस्या है, इसके लिए कीमोथेरेपी होगी, रेडियोथेरेपी होगी या जो भी थेरेपीज आप सजेस्ट करते हैं. देयर शुड बी अ पर्सन वो ये बताने का प्रयास करे उनको. पहली चीज तो उनको मेंटली काम आउट करे कि यस वी हैव एन इशू, वी विल डील विद इट, और इसका कीमोथेरेपी का मतलब ये होता है, रेडियोथेरेपी में ये किया जाता है. सिर्फ सिकाई वर्ड कह देने से नहीं समझ में आता है. सो दैट इज व्हाट आई हैव बीन डूइंग फॉर द पास्ट 35 years, trying to make people just talking. I'm not a doctor, I am not a specialist in anything, but I'm just talking to people to making them understand कि yes, it is a human body, इसमें चीजें आ सकती हैं, जैसे विसंगतियां होती हैं वैसे हो जाती हैं और हम उससे बाहर निकल सकते हैं. So in that endeavor we have been working. We started with कैंसर पेशेंट्स, वी स्टार्टेड पेशेंट से ज़्यादा हम फैमिलीज को काउंसिल करते हैं, क्योंकि एक चीज़ और है हमारे रूरल इंडिया में या जहाँ पे भी आप बात करते हैं वहाँ पर सिर्फ पेशेंट की बात होती है. पेशेंट के लिए तो डॉक्टर भी है, डॉक्टर का स्टाफ भी है, बट फॉर द फैमिली उनको समझ में ही नहीं आता कि उनके साथ क्या हो गया. देयर इज अ सोशल ऑस्ट्रासाइजेशन ऑल्सो, एक आइसोलेशन का भी होता है. हर चीज को, हर बीमारी को, कैंसर जैसे शब्द को छुआ-छूत के उसमें भी पहुंचा जाते हैं, क्योंकि उनको ढंग से एजुकेशन नहीं होती है कि ये भी एक शारीरिक कष्ट है, वो निकला जाएगा. तो दैट इज वेयर वी नीड टू सी. हम सीएसआर में बहुत फंड्स डाल रहे हैं, हम बाकी चीजें भी हो रही, बहुत काम हो रहे हैं, बहुत अच्छा हो रहा है, बट हम पहले उस सिंगल यूनिट जो ह्यूमन है उस पर कॉन्सेंट्रेट कर सके, हम उसको समझा सके, हम उसको बता सके. आधी लड़ाई तो हमारी मन से हारते और जीतते हैं. दैट इज हाउ द ब्रेन वर्क्स. If we tell our brain ki yes, we'll tide over with it. Like I remember I had a 2-month-old child. When I was told I have cancer. 2 महीने का बच्चा है, आपको ये नहीं समझ में आएगा कि आपकी जिंदगी शुरू हो रही है कि खत्म हो रही है. That is the thing. So for 2 minutes it went black, जैसे होता है ऐसा रिएक्शन होता है. After 2 minutes I said okay fine. Problem identified is half one. तो वहां पे वो बात, वहीं पर हम पिक्चर पे आते हैं कि हम ये अपने मन को समझा सके कि यस आई विल गेट ओवर विद इट. दैट इज वेयर द ऑर्गेनाइजेशंस कम इन पिक्चर. कि एक व्यक्ति तो वैसे ही वहां पे नेगेटिव उसमें पहुंच चुका है, उसकी फैमिली भी बहुत कष्ट में आ चुकी है. वी हैव टू ब्रिंग देम आउट ऑफ दैट. दैट इज द थिंग. तो उस 2-3 चीजें, आई एम सॉरी, मतलब आई एम स्पीकिंग लॉट बिकॉज आई एम जस्ट स्पीकिंग फ्रॉम माई हार्ट. आई एम नॉट अ स्पेशलिस्ट, बट इन दैट एंडेवर जो आपने डॉक्टर साहब, आपने सैनिटरी नैपकिन्स की बात करी, आपने विमेन हाइजीन की बात करी. आई हैव बीन काउंसलिंग एंड टॉकिंग टू पीपल जहाँ पे उन्हें पैड का कॉन्सेप्ट पता ही नहीं है. वी आर गिविंग देम, वहां पे कंबल का प्रयोग होता है या बालू में जाके बैठने की बात होती है. कैन यू इमेजिन इन टूडेज वर्ल्ड जहाँ पे हम कितनी सारी बातें कर रहे हैं, बट आई एम वर्किंग विद पीपल जिनको ये कॉन्सेप्ट ही नहीं पता है. आप उनकी हाइजीन और उनकी फिजिकल कंडीशन का आप समझ सकते हैं. सो वी हैव बीन वर्किंग ऑन दैट. वी हैव बीन सप्लाइंग रीयूजेबल which we can wash and reuse because we know they don't have an access to having disposable sanitary napkins. एक और छोटा सा काम कर रहे हैं for the past 10-15 years. What I have been doing, I have seen women jails also. Very bad conditions. 60% of the women don't even know why they are there in the jail. और वो सालों लग जाते हैं उस केस को सेटल होने में. आप उनकी परिस्थिति समझ सकते हैं. They are away from the family. प्रॉपर चीजें नहीं मिल रही हैं. There, what we have been doing is we have been installing pad disposable machines and incinerators also. एक ये भी बड़ा सोशल स्टिग्मा भी आपने कहा है, जैसे कि आपको डिस्पोजल के एवेन्यूज नहीं मिलते हैं. यू सी ऑन द रोड, आप रोड साइड पे आप देखिए पूरा पूरा डस्टबिन या जो भी है ओवरफ्लो कर रहे हैं. द डॉग्स आर देयर, द कैटल इज देयर, दे आर. सो उसके लिए इंसिनेटर्स का कभी भी किसी को कहीं पर भी, किसी स्कूल में, किसी कॉलेज में, किसी जेल में, कहीं पर भी आपको कभी भी कुछ इंस्टॉल करवाना हो, आई एम देयर, माय नंबर इज देयर, प्लीज. This is what I've been doing on a personal level, installing both these machines in all the girls colleges. That is what we can do. I mean, as a non-medical person, so my only request is कि बहुत एडवांसमेंट में जाइए प्लीज. आई मीन मेडिकल फील्ड इज एडवांसिंग लाइक एनीथिंग. हमें एट द क्लिक ऑफ अ बटन वी आर एबल टू नो किस कोई भी इशू है तो हम उसके लिए क्या क्या चीजें कर सकते हैं. बट वहां से पलट के हम जितना सिंप्लीफाई कर रहे हैं, पर ह्यूमन माइंड इज वेरी कॉम्प्लेक्स. हमें उस पर पहले ध्यान देना चाहिए कि जो भी आ रहा है हमारे पास, एक कामिंग रूम मैम डॉक्टर साहब प्लीज जरूर रखिए, जिसमें सिर्फ बैठ के सुनना है आपको. कुछ हम सोल्यूशन नहीं निकाल सकते, हम वो सॉल्यूशंस वो इलाज आप ही करेंगे, बट उनके मन को हम मन का इलाज कर सके, उनके कष्ट को कम कर सके. वी शुड ऑलवेज वर्क ऑन दैट. थैंक यू सो मच.
You're not a specialist. You are better than specialists, and you're a human specialist, which is the real specialist. So kudos, I think, the amount of work. Oh, रोंगटे खड़े हो गए सुन के
I
आपकी
think you are
बातें.
truly,
Genuinely.
you deserve that round of applause from
Biल्कुल.
all of us.
Amazing.
Big clap for Smita ji. And we truly appreciate your story of bravery, being a cancer survivor, how you have fought through your life, and still you are contributing so much to the society. You are so thoughtful about what all need to be done. And the most important part is what you're talking about, that softer angle, that human touch, you know, because there are so many things, like if we are talking about cancer, the mere mentioning of the name, it brings you like your heart is sinking. And especially when you have to go through all these therapies, chemos, or so after that there has to be a proper counseling to the patient, to the families, which is very important part, which you have really thought upon. And this has to be incorporated in most of the curriculum syllabus of CSR forums and all these, ma'am, like your seva, what is doing, and even in the hospitals or MSMEs, whatever, even you are being a consultant, Medha, I think you can also talk about it. But I think these are very, very valuable. So we don't have much time left for second round of questions. We are already running out of time. And here we have to sum it up. Thank you all. And I believe it's very inspiring uh, to know about your journeys, your contribution to the healthcare forums. Yeah, sure, Dr. Pandav. Can somebody give the mic to?
Precisely 1 minute. You mentioned about anemia. This is Poshan month, and I'm distressed by the poster given by the government of India. It is saying eat red meat. How many people can afford red meat? Eat eggs. So there is a starvation, deep starvation of communication for behavior change in the Ministry of Health and Family Affairs. Deplorable.
Thank you, sir. Thank you. Uh, it was really a wonderful session. We would have loved to listen you more, but we have paucity of time. And
I think I'm just about to sum it up with the paucity of time. So with these takeaway of morality, empathy, and social behavior, and we have touched upon so many taboo topics, whether it's women hygiene or whether it's about depression and the softer touch to all these things. I'm wrapping it up because we really need to reflect on all these things and how we can incorporate it, how we can be more impactful in the coming CSR programs, in the coming healthcare issues. So best of all, ladies, and we look forward for some more important works and see you soon. Thank you.
thank you, Ms. Misha. Now I would request Dr. Ashu Grover, Deputy Director, Journal, India Council of Medical Research, to please come on the stage and present token of appreciation to our eminent panelists for their time. Ma'am, please. Dr. Smita Singh, Head Industry Division, Yamuna Authority. Ms. Medha Gandhi, Founder and Principal Consultant, Counterpoint Impact Advisory. Dr. Sonia Lal Gupta, Director, Metro Group of Hospitals. Dr. Anita Sabharwal, President, Forum of OBS and Gynae of South Delhi. Dr. Sampa Banerjee, Executive Director, World Association for Small and Medium Enterprises. Dr. Rajvi Joshipura, Senior Coordinator, Self-Employed Women's Association, SEVA. And last but not the least, our moderator of the day, Ms. Misha Dange, Board Member, Hill Foundation. Now we can have a group photograph, please. Please stay back for a group photograph. Thank you. Thank you. Now we move on to our next session, which is on broad spectrum health CSR, addressing diverse disease for holistic community care. The moderator for the session is Dr. Swadeep Shrivastava, founder and chairman, Heal Foundation. If you can please join us on stage. Panelists for session are Dr. Jitendra Sharma, managing director and CEO, Andhra Pradesh MedTech Zone. Sir, if you can please join us on stage. Mr. Sanjay Kumar, chairman and managing director, Railtel Corporation of India Limited. Dr. Nilesh Tiwari, Chairman, WordBrain Center. Dr. Ashu Grover, Deputy Director General, India Council of Medical Research. Mr. Farid Khan, General Manager, Artemis Hospital. And I would request Dr. Anil Kohli, sir, to join us, Padma Shri, a leading dental surgeon and former President of Dental Council of India. Sir, if you can please join us on stage. My apologies. So, Dr. Anil Kohli, Padma Bhushan awardee. एक चेयर और चाहिए. ठीक है. Now we will start with this session with a keynote address on transformative health CSR, innovating for comprehensive community well-being by Dr. Jitendra Sharma, Managing Director and CEO, Andhra Pradesh MedTech Zone AMTZ. Sir, if you can please present.
Morning, namaste everyone. I am sorry I am a few minutes late, but गलती मेरी नहीं है. मैं यहाँ बहुत आराम से डिसिप्लिन तरीके से पीछे बैठकर सुन रहा था. Suddenly in the panel somebody mentioned as an example समोसा, पूरी, हलवा, ऐसे किसी ने बोला. उसके बाद से मैं कंसंट्रेट नहीं कर पाया. तो मैं फिर बाहर गया थोड़ा सा. I just refreshed myself and came, because after listening to samosa, puri, halwa and all that, it is very difficult to concentrate on technical matters. रहा नहीं जाता है. तो मैं बाहर गया. So firstly, a very, very happy Teachers' Day to all the teachers here. I think they deserve our applause. Namaste, wherever they are, in the hall, outside, some sitting in front of us, and all over the world, because we are all product of our teachers. And I think this conclave, CSR conclave, I think the best corporate social responsibility is giving knowledge. And the biggest donors are teachers. And therefore, very nice, Dr. Sudeep, that you chose this day to do a CSR conclave, because I think there is no bigger CSR than giving knowledge. Every wealth, every product, every service, everything that we bring out is because of the knowledge that our teachers gave us. थोड़ा सा आपको बताना चाहूंगा why we are here, joining forces with Dr. Sudeep and all the members, many friends who are around in this hall. I represent an organization called Andhra Pradesh Medical Technology Zone. We are world's largest medical technology manufacturing cluster. We are very small, 8 kilometers campus, 98 lakh square feet of production space, and we make very few products, which includes right from a mask to an MRI machine. We make India's first MRI, India's first CT scan, India's first solar powered wheelchair, India's first heart valve, something even as small as India's first hearing aid. And the reason why thank you, sir. The reason why we do this is that our country is import dependent on medical technology to the extent of 65,000 crore per annum. Very small number. 65,000 crore. शायद हमें इतना भी पता ना होगा आउटराइटली कि इस नंबर में कितने जीरोस हैं. 65,000 crore. We don't know how many zeros are there in this number. That is the import dependency of our country in medical technology. Right from a low weight wheelchair to a hearing aid that comes into India for 13,000 rupees, to a CT scan or an MRI, we are heavily import dependent country. So what AMTZ has done is that we created a huge infrastructure to produce the same MRI that we used to import for 6 crore, we today export at 2 crore 80 lakhs. The same hearing aid that we import at 13,000 rupees, we produce at 1900 rupees. And a prosthetic limb that we make, we produce one leg for 4,000 rupees. There are mobile prosthetic limb production buses where people come without the legs in the morning and they walk back in the evening using a prosthetic limb. That is AMTZ. AMTZ is also home to 145 companies. It's a $1 billion cluster, and it's a place which is having the first World Health Organization Center of Excellence for Health Innovation and a World Trade Center. So we are the only cluster in the world that has a WHO center and a World Trade Center. We bring science and business together, and that is why we are here today. Now, from a perspective of CSR and our ability to do things together, I can only share that there are 3 forms generally in which CSR is done. One, we do CSR for a product. We donate a wheelchair, we means in general, a hearing aid, a hospital bed, an ECG machine, that's contributing for a product. The second category of CSR by and large, besides like the first category in which we give a product, in the second category, we do contribution towards a service. और आप लोगों ने WhatsApp में देखा होगा, somebody is doing अन्नदान, somebody is saying donate a meal, somebody is saying donate for education, somebody is saying donate for a skill. That is how we contribute as a society in the form of service. And the third form, which we also practice very much at AMTZ, is can we donate for an idea? Can we contribute for an idea? Because an idea could become both a product or a service. It could be anything. It could be ultra fast track cervical cancer screening that previous panel, the panelist was mentioning. It could be world's first cornea based detection for anemia, which does not require blood. And somebody was mentioning about anemia. And therefore, before an idea becomes a product or a service, it also needs support. Ashok Bediji is sitting here, who manages the entire Bossia. It's an idea. It is just financing an idea. It is neither a product nor a service. It could be both. Vivek Saigalji is sitting here, who has done tremendous contribution to industry. Mr. Gaur is here. Large number of fascinating people who have not necessarily funded or got funded a product or service, but funded an idea or got an idea to be funded by multiple forces. And therefore, my request to Sudip ji is, this very conference is an idea. It is neither a product nor a service. But you have created an idea which has pulled together multiple people, from a gynecologist to a practitioner of physiotherapy to an organization that supports sportsmen. You have brought together multiple people from multiple PSUs like us, Indian Oil, NBCC, NTPC. These multiple organizations, all of us deal with either a product or a service. People like us who are producing wheelchairs or MRI, people who are in education ministry who are financing and supporting education, Dr. Nilesh who is providing care, all of us are either in product or service. But I think our true innovation today would be, can we fund ideas? Because if we can finance, contribute, develop, donate, support ideas, these ideas can become either product or a service. It could be a common salt which has iodine. Iodine Man of India is sitting here. Or it could be creating people who are Divyanjans, creating the new service delivery model for Olas and Swiggies using only their services. And there are messengers and groups that are already doing this in various scattered places in the country. आप लोगों को याद होगा, बहुत समय पहले there used to be an advertisement in TV for Lijjat Papad, Mahila Grah Udyog, right? Much before it produced Lijjat Papad, it was just an idea of a group of women. They wanted to do something. Lijjat Papad was just one product. The entity was Mahila Grah Udyog. It was an idea that told women that sitting at home without going out of the house, because to do that at that time you had to fight through various layers in the society, and that fight would consume all their time and years. So escaping the fight, within the home, you can run an industry. You can create an industry. That is why it was named Mahila Grah Udyog. Not Mahila Udyog, Mahila Grah Udyog. So that there are no fights. You don't have to challenge. Today, thankfully, our society has enough power to challenge those systems. But 30, 40 years ago, there was no power. There was no critical mass of proud women thinkers. And therefore, very smartly, they named it Mahila Grah Udyog. हमें किसी से झगड़ा नहीं करना है, हम तो घर से बाहर जा ही नहीं रहे, हमारा उद्योग ही ग्रह में है. And they created an industry which became India's first FMCG brand, Lijjat Papad. And therefore, my request today is that, yes, my colleague Mr. Dr. Amit Sharma ji is also here. I don't see there. They make wonderful, and AMTZ is a campus with 22 centers of Government of India. He operates one of them where we make buses. We provide limbs for 4,000 rupees. As I mentioned, people walk in the morning without legs, walk out, walking back on a prosthetic leg. from a low cost hearing aid to a packaged health kit for the entire 9 months of pregnancy, the detection, the ECG, the everything, the blood pressure for eclampsia, everything. Dr. Swadeep Srivastav, they also have a center at AMTZ where we produce, uh, under the brand of India Health Link, a healthcare ATM, an ATM machine which does profiling of more than 200 parameters connected with telemedicine. Cost of service 25 rupees per patient, as low as that. And Honorable Nitin Gadkari ji wanted to put one at Toll Plaza in Nagpur on the national highway. He told us last Monday when he was launching the India's first solar powered wheelchair, a wheelchair, electronic wheelchair that comes into the country imported for 1 lakh rupees. We produced a solar powered wheelchair for 30,000 rupees. And he was kind enough to launch it in Nagpur. But that healthcare ATM, which costs 25 rupees, which is lesser than what we pay on FASTag, right? So there are multiple products and services that you will encounter in life, encounter in this very occasion, in this very conclave, meeting wonderful people. But I think today, if we can create a bank, Dr. Swadeep, as one of the suggestions, and the only suggestion I have for this conclave is that let this conclave not complete today. Let it start today. And let us create a bank where we support ideas. A CSR conclave, which is a rolling conclave happening every day of our lives in our routine works. We only contribute for ideas and support them until idea becomes a product or a service. And I think if we can start that idea bank, where the bank is also banking the idea and also banking the financing. We are financing the ideas that come into the bank, and the eligibility for it to be financed monetarily is only if it is part of the CSR idea bank. I think that will be a very, very good contribution to society on a Teacher's Day, where the work and blessings of hundreds and thousands of teachers can actually create India's largest CSR idea bank, where every idea is funded by CSR. Where we don't say people who bring ideas to go and raise capital from venture capitalists, because they will take away your 60% equity. They will cut a check, but then the company is gone. It is gone for profiteering instead of sustainability. And therefore, large number of industry leaders that I see here, many of you who started your career with as part of a profiteering company, but realize that you are meant for something bigger, something grander, nobler, left that, migrated to creating sustainability. And profiteering is different from sustainability. Sustainability requires profit, but the agenda is something different. Agenda is something bigger. All of you have done that. Can we bring together all the sustainability champions here? The financial sustainability, environmental sustainability, functional sustainability, physical sustainability, all the champions here as messengers of the CSR Idea Bank, and as PSUs, as professionals, we commit to support the CSR Idea Bank, where every idea will be supported only through CSR if it is sustainable. So let us start this conclave today and create this CSR Idea Bank, which brings out hundreds and thousands of products as a contribution to the country. Thank you. Enjoy the conclave. Jai Hind.
Thank you so much, Dr. Jiten. As usual, Dr. Jiten is always full of ideas, but I think this was the best idea what you floated today. That is, create an idea bank for sustainability champions, and that's what this CSR summit today, what we have envisaged, is about. Bring together sustainable champions and also out different new innovative ideas which can fill the gap in the overall. We are more focused on healthcare, so we always keep talking about healthcare impact, but what new ideas can fill the gap in the healthcare impact programs and how it can be made more impactful. So now, with the scarcity of time sitting between the lunch and you guys, so I like to start this session 4 of broad spectrum health CSR addressing diverse diseases for holistic community care. And I would like to start with Shri Sanjay Kumar sir, Chairman and Managing Director of RailTel Corporation of India, one of the largest large rail corporations, and who is, I'm very sure, they have got they do a lot of CSR work also. But more than that, more than the exact CSR fund, I think what more powerful they have is their whole infrastructure, network, technology, people, and that access to people across the country. Penetration. That is, I think, which is more important. So my question to Sanjay sir would be that, given the vast reach of Retail's network, how can digital innovation be leveraged to improve access to healthcare services, particularly in remote and underdeserved areas? Can you share specific examples of CSR initiatives using technology, or any other CSR initiatives your organization where you have been at the forefront, and any learnings from those initiatives run by your organizations?
So thank you, Dr. Sadeep. In fact, very good afternoon, and this session is coming in between us and lunch. So I would like to be very brief. In fact, a very good opening note addressed by Dr. Jitendra Sharma. The idea has to be the idea has to be funded by CSR. So, in fact, technology is the guiding force today, and more than that, the new somebody may say jargons, but those are now the real uh, words, words and reality. Like when I used to study artificial intelligence, there was a para in a book when I did my graduation. So artificial intelligence, there was a para only. Now it is a reality, and artificial intelligence can really be a technology uh, drive which can help us mitigate the gap between the digital gap which is there between urban and rural areas of the country. Most of the India lives in countryside. So तो भारत और इंडिया के बीच का जो गैप है, actually this is the basic challenge of health sector and of course in education sector also. So in health sector, there's a there's a acute shortage of doctors, qualified doctors. There's uh, uh, health literacy is not there. Patients don't know where to go, what to do, and how to do. And there are many other undesired factors also in the tier 2, tier 3 towns, which actually prevent those patients reach the right kind of place. So I think CSR initiatives should focus more on these and and find out ideas, of course, as Dr. Jitin rightly pointed out, that how to bring them on board, because all of them can't visit Delhi or Lucknow or Jaipur or any uh, such place where world class or maybe not world class, even uh, desired level of medical health facilities are available. So then one technology solution, it has been there for quite some time, that was telemedicine, which is a technology product. Telemedicine is being popularized, but still there are lot many gaps. Second would be, I think, the skilling the people, because in rural areas, if um, uh, qualified doctors, practitioners are not there, at least the local people through telemedicine, if they are educated properly, they can help the doctor sitting at the remote comprehend the problem with the patient. As rightly somebody pointed out in the last session, that there has to be a person, because the rural area people, they know only their language. उनको हिंदी भी ठीक से नहीं आती है, उनको सिर्फ अपनी डायलेक्ट आती है। उनके अपनी भाषा में उनके मर्ज को समझने वाला अगर वहां पर बैठा है और वो डॉक्टर के साथ कम्युनिकेट करके प्रॉब्लम को राइट पॉइंट ऑफ टाइम में, इफ ही इज एबल टू send it the right kind of message to the doctor so that he can be treated properly. Similarly, I think nowadays there are devices which can monitor the basic parameters sitting remotely. The patient is remote, and the doctor sitting remotely can actually see the basics. Maybe even ECG also. I think the devices are available, and AMTZ is a place where such innovations keep happening. In fact, I would like to share one, Dr. Jiten Sharma, in fact, told me. So the cloud inside the MTZ campus has been created by Railtel. It is funded by Railtel. So, yeah, and data center also. So we are doing lot many things and trying to do. We are a very small company, so we have very small budget, but we try to spend most of our CSR funds in health sector, hygiene, menstrual hygiene is major issue, and most of the cancer diseases, when they come in, like they are there in rural areas which are undetected, and the patients are dying. Then cancer survivor patients, similarly even other diseases also. Somebody rightly pointed out again in the last session that 50% of your disease goes away if somebody is consoled in a right manner, that what is it and what does it mean to him, and it can be cured, and how, and so on and so forth. So technology, of course, with the use of, like, similarly, another example would be like clinical decision support system. So if a patient, through some ABSS scheme or whatever government schemes are coming up, if a patient's complete database is maintained, and maybe one drug is prescribed to him, so it is ensured that that kind of drug is not affecting that patient in some other disease which he is already suffering from or likely to suffer in near future because of the some other reasons, whatever. So those kind of clinical decision support systems, once they learn on large language models, large databases, they will also really will help us in developing our disease into complexity. So sometimes we don't know something else is also happening inside our body, but we are getting cured with one disease. Some other disease is getting incubated. So this kind of technological inputs and innovations, of course, will be required, and this rural and urban digital divide, with the help of telemedicine kind of initiatives, which are though there uh, in the area, in the country, but hardly being practically available. Maybe in urban areas we are using it, but in rural areas hardly any penetration. Railtel being uh, we have our network along the railway track, so we cover around one lakh village panchayats out of 2.5 lakh total village panchayats. Railtel covers about 1 lakh panchayats, and out of that, about 17,000 we have already connected through our network. They are connected. We are providing broadband facilities also. So such telemedicine facilities or similar other communication networks can be used to proliferate medical advices, medical even other innovative initiatives which are taken in future, can only be a medium. Of course, it cannot happen without health ambassadors, our qualified doctors, and of course, the supporting team sitting at the remote in the rural areas. So they have to be trained. I think unless they are trained, this rural and digital divide cannot be bridged. So thank you very much. This much I want to say. Thank you.
Thank you, sir. Really insightful, sir. So, Railtel is already using the blend of technology and the healthcare doctors and the medical skills for their CSR. That's wonderful to know. So, I would move on to the real doctor, Dr. Nilesh Tiwari, one of the leading psychiatrists of the country. He runs Word Brain Center, very popular brain psychiatry hospital. And mental health has definitely been at the center of discussion in healthcare, particularly during COVID, post COVID, and it has come into limelight. And it is, but unfortunately, it is often overlooked in holistic healthcare. So, how do you think can CSR initiatives be designed to raise awareness about mental health issues and provide accessible support services? Can you discuss the importance of integrating mental health services into community-based healthcare programs? And given the fact that a lot of celebs themselves have come forward to actually pitch in and bring support this cause of mental health issues. So, what is your view, Dr. Tiwari?
Yeah, hi. A very good afternoon to all of you. And today is Teachers' Day, and I'm really so lucky, privileged. Dr. Nimesh Desai is here. Sir, are you here?
He's going to join in a while.
No, I saw him. Oh, yeah. So before I start, I would like to pay my gratitude to Dr. Nimesh Desai. He's my teacher. So I'm so lucky to see him over here. So I'm really blessed. What Dr. Swadeep is telling, that mental illnesses, they are often overlooked. That's very true. And reason behind this is very simple to sir. Happy Teachers Day, pranam. Before I started, आपको मैंने प्रणाम किया.
Dr. Nimesh Desai.
Dr.
Sir.
Nimesh Desai, sir, आपको प्रणाम. I'm so blessed. My teacher is here on Teachers Day. So I was telling that mental illnesses are overlooked often, and there is a very, I'll say, lucid reason for this. Like physical illnesses, injuries, fracture, it is obvious, it is seen. Mental illnesses are not seen. But let me tell you, as a psychiatrist, I can vouch upon this particular statement that these mental illnesses or these psychological injuries, they are much more chronic and much more severe. So, this is the reason why it is often overlooked. Second point, what Dr. Swati was asking, that how we would be able to understand these illnesses and how we can rope in NGOs and all. So let me tell you a very surprising thing. Most of the people sitting over here are not aware about the prevalence of these illnesses. There was a study, national survey done in 2015-16 says that 15% of Indian adults, they require some sort of active mental health intervention at particular time. 15%. And this study was done in way back 15-16. So now after COVID, you guys can understand, because there is a steep rise after COVID. 18% increase in depressive disorders, 15% increase in anxiety disorders, around 30% increase in obsessive compulsive spectrum disorders. So now we can understand what is the real prevalence of these disorders. But the problem is a stigma. Mental health is having the biggest problem, which is a stigma. We can treat illnesses, we have wonderful medicines, therapies are available, everything is available. But stigma is the biggest problem, and that is the biggest hurdle in treating mental disorders. I'll tell you a very interesting story. I diagnosed a patient. I told him, look, sir, you have depression. तो मैंने इसको अपने इंस्टा पे भी डाला था, बिकॉज यूज इंस्टाग्राम आई डोंट यूज ऑफन, बट इतना कि वो मुझसे कहता, क्या मुझे क्यों डिप्रेशन होगा, मुझे वो अमिताभ बच्चन का स्टाइल याद आ गया कि मेरे पास बैंक है, बैलेंस है, कपड़ा है, पैसा है, दौलत है, मुझे क्यों डिप्रेशन होगा? मैंने कहा सर आपके पास सेरोटोनिन कम है. So I made him understand, man, depression is not because of your economic status or your social status, anything. It can happen to anyone, anytime. Like Deepika Padukone, she herself expressed that she is having depression recently. A lot of other people, they are exposing and they are telling that they have, depression. So I told him that, look, the problem is with 5-hydroxytryptamine, serotonin, that is less in your brain. So that's why you have depression. So that is the message which I really want to give through this forum, that please try to understand these mental illnesses are not just because of your psychosocial circumstances or maybe your environmental problems or family problems or occupational problems. It is something which is biological. If your hormones are coming down, if your neurochemicals are, getting their equilibrium is, you're going to have these problems. So try to understand. Because after stigma, I'll be talking about acceptance. Because acceptance is second challenge in mental illness. People don't accept. Even if you'll tell them that you have depression or you have OCD or something, then they'll be going to some other psychiatrist. They'll be saying, उन डॉक्टर साहब ने तो हमें डिप्रेशन बताया था, आप देख के बताइए, हमें नहीं लगता मुझे है. So they will start with this note because they are making the psychiatrist or the therapist biased right from the beginning. Because they just want to validate the notion they don't have this thing. So acceptance is second most important problem, and this happens with parents most of the time. When you tell their child that they have some sort of disorder, some sort of problem, parents will often say, "हमने कौन सी गलती कर दी? पूरा टाइम दिया, इसने तो अपना जॉब भी छोड़ दिया, और साहब इसको कैसे डिप्रेशन हो जाएगा?" तो उनको फिर वही बायोलॉजिकल मॉडल समझाना पड़ता है कि सेरोटोनिन कम है. So that is what I just want to convey. Next, Dr. Sudeep was asking that how we would be able to, rope in NGOs and all. So let me tell you, first of all, we need to understand the magnitude of problem. Once you are able to understand the magnitude, then only you would be able to really think that it is a serious mission and we need to join hands and do ASAP. Like cardiac problems, they will start usually after 40 years or 50 years. Like respiratory problems, COPD, they'll be starting in people who have bronchial asthma, but usually they have some age, mostly around 40, 45. Similarly, if you talk about gastric problems, pancreatic problems, so there is kind of a age where they peak. But let me tell you about mental illnesses. As the child is born, he may be prone to hypoxic brain injury. He may have mental retardation. Then as he grows, there is a possibility of pervasive development disorders, autism, ADHD, then childhood disintegrative psychosis. Then as he grows, he may have behavioral problems, oppositional defiant disorders, conduct disorders. So psychiatric illnesses they really go hand in hand. And so many times you'll not get to know, you'll start suffering from it. Then as you grow, adolescence problems, then of course teenage, then nowadays in Delhi, relationship problems. In Delhi, breakups are biggest problems. Oh, sir, Delhi is heading. Delhi is heading.
Delhi is the
After
capital.
after Delhi, of course, Andhra Pradesh is on second number. So teenage problems. Then, of course, once a child maybe he goes to college, then adaptation in college, then ragging, then lot of negativity. So that can also lead to problems. Even if I'm seeing a lot of IITians or a lot of very bright students, but they are good in maths, they are good in science, but they are not good in understanding the law of nature, law of sociability, and they often fall prey to all these things. After maybe someone completes his graduation, post graduation, and joins MNC, then again a big problem. There was a study done by McKinsey, I think in 2022, which says every third person in a multinational company is having kind of anxiety or depressed symptoms. and he is stressed. Every third person, every third. So you can understand psychiatric illnesses, psychiatric derailments, they are always there in your life. Then as you grow up, you may have schizophrenia, depression, and a lot of other disorders. Then, of course, I'll like to enumerate many others, but since lunch is ready, I think, so I'll go directly to geriatric problems, which is a serious problem these days. Dementia. On this platform, I would like to draw your attention that dementia is growing like anything in India. There was a time when I was in Ibhas and under Dr. Nimesh Desai. So I used to see around 3-4 cases, right, sir? 3 to 4 cases of dementia every month, I believe. And nowadays, I'm seeing at least 2 to 3 new cases of dementia every day. Every day. So it is growing like anything, and we need to make sure that we should start providing whatever we can do for degenerative brain disorders.
Thank you, sir. So I think it was quite, and of course, there's no doubt that the focus needs to be shifted. Though mental health is, Sanjay ji would like to has to go for a meet. Huh? So is definitely at the center of attention, the mental health. But of course, how we can mobilize more CSR funds and more CSR programs around mental health is important. Now coming to, we have a leading scientist among us, Dr. Ashu Grover ma'am. Everybody knows the type of work she's doing at ICMR, and medical research is always even quoted by our prime minister, how we lack in a big way in medical research, original medical research in India. And that's one area where uh, there is a great need for all type of attention, not only CSR focus, the funding, but even various other scientists coming forward, joining hands, various different stakeholders coming forward, and and promoting medical research in India. So, Dr. Grover, what would be your view on?
Good afternoon, everybody. And first of all, thank you, Dr. Swadeep Srivastava and the whole HEAL Foundation, through which we have, come together. And I think just one thing I would like to, start my conversation on that. That this is a fora where, not only the medical professionals, we have the whole lot of academicians from the industry, from the regulatory bodies, from the non-government organizations, from the government organizations. They all have come together to discuss that what we started with Dr. Jitendra, that's an idea. Right. So everybody may have an idea, but to carry forward that idea, we definitely need a platform, and this is the platform. And I'll say just one step ahead of that. When Dr. Jitendra said that it's a beginning, I'll say that this idea and the CSR summit is going to be beyond national boundaries as well. And the day will come that when we'll have an international platform as well on our board, because there are lot many funding agencies who are ready to give to and support this cause. As an epidemiologist, I would like to say that yes, we cannot disconnect from human health from rest of the factors. When we talk about rest of the factors, we say that yes, it's not only the body, it's affected by the environment, it's affected by the interaction, how the society behaves, physical environment, the societal environment, and the natural environment. So when we talk about from the research per se, I belong to Indian Council of Medical Research, and I'm there for last maybe 2.5 decades. What I have seen that when we say that yes, research in our country is not at par at the other developed countries we have at the tune of the National Institutes of Health or the MRC or the Netherlands and Australian agencies. But yes, there are certain landmark achievements which country has got, and it's given to the world, like we talk about very proudly that some of the vaccine strategies which have come out of the research and the diarrheal treatment and tuberculosis treatment. But I would not like to, take those as success stories because the era is changing. We need to come back to the revolutionary, achievements and the developments which have been happening not only for the management of the infectious diseases, but for our non-communicable diseases and right from the reproductive and maternal child health. as a human being, we cannot disconnect that, okay, this is a communicable disease, this is a non-communicable disease, this is a nutrition or like. So we at ICMR, definitely we work in collaboration, which we, rightly believe in that. So Indian Council of Medical Research has been working very closely with the research institutions, and one of the institutions are here. We have the IBAS, we have the AMTZ, we have the Dental Council of India, Dr. Kohli is here, the past president, and many other organizations must be sitting here. So that I say that one, we have to idea and determination. We need to have the collaboration. Collaboration is the key. Whether we want to collaborate for a treatment of illness with the Ministry of Ayush, or with the Ministry of MIT for IT development, or many such agencies. Now, what CSR can do, I'll just take one small example here. That 2 months ago, Indian Council of Medical Research has also started thinking of how to invest the money from the CSR component from the various organizations, and the first meeting was held 2 months ago, and we are having another meeting on 30th of this month again. The only issue that most of the CSR agencies are ready to provide funding to the cause of health research and for alleviation of the diseases as well, but we do not have the regulatory procedures. So when we talk, they tell us how to give the money. Should we directly give it to ICMR pocket, or should we directly give it to the state health authorities? So we really need to carve out some, maybe this is the summit, this is the channel, this is the platform, with the help from AMTZ. They're really susceptible about that. How do we transfer the money? The whole question, we have the Bharat Petroleum, we have the Indian Oils, we have the other pharmaceutical companies also. All only question was that how do we give the money to the cause of medical research? So I think this is one idea. Again, I float on this platform that could we come up some of the regulatory frameworks through this summit, that yes, this is the channel, and advise the government body that how you can take the money from the CSR component. And another issue comes about the prioritization. Should we work on mental health? Should we work on infants? Should we work on menstrual hygiene? Or should we work on diabetes, hypertension? It's all issues of the prioritization. So for that matter, we need to identify that who is working on what areas. For example, AMTZ is working on all manufacturing, medical devices, regulatory. We did not have any agency in India. Trust me, I think this is the first body in India, and probably it is first body in the globe, which has one thing under one roof, that it has regulatory structures, the marketing, the manufacturing, and all the procedures, and to the finest of all the process. There is no deviation from the rules and procedures and all that. So I think many companies would like to go to the AMTZ, and we need many more AMTZ. I'm requesting, sir, many times that let it make it as a national center and then a global center for further training of the other institutions also, and they should have the regional hubs across. So I will stop here. There are many things I had noted, but in the interest of the time and getting a hint from Dr. Kohli that please keep it minimum. So, so thank you so much for inviting me to this platform. And I look forward for the CSR meeting, which is planned on 30th of September. And I wish that there will be some procedures which will be laid down during that meeting. Thank you, Swadeep.
Thank you, ma'am. Very important point you raised, ma'am, that today in the morning session we had Mr. Mukesh ji, the director of Indian Institute of Corporate Affairs, who are very deeply involved into creating guidelines and the CSR impact programs, how they do with the corporates and the PSUs. So of course we can bring all of them together, and as Dr. Jiten Sharma said that now we have to create an idea bank. So I think the idea bank can start from here, right, by connecting the dots. But very one of the pertinent issues which I would like to go to Dr. Kohli also, and then come to Dr. Sharma as well as Dr. Tiwari, is that while we were talking about, and I was listening to Anshu Grover ma'am, so when we talk of medical health research, so this is one module which is globally quite successful. If you look at US in terms of the Stanfords to any other top institutes there, even Harvard, Massachusetts, everywhere, there's a lot of philanthropy, CSR support which goes into these institutes in a very organized way. And that's why there's a lot of initiatives of medical research which have been very successful, and that's why they rule, in fact they rule the world because of their original medical and health research, what they have been doing in terms of bring out new drugs, innovations, technology, everything. If you're sitting in India, we can boast of many things, but one of the fact is that still majority of innovation is done in US and other developed countries. So, Dr. Kohli sir, you have been at the helm. You have seen the healthcare from both ends. One is at the bottom of the pyramid where you do your own CSR, oral health programs, campaigns. At the top of the pyramid, sitting with the treating the dental problem of a prime minister of India. So he's sitting on the mouth of the prime minister of India for so many years. So
Good
from
afternoon, everybody. I'll take few minutes, not very long, because this is between the distance between me and the lunch. This morning I was at a conclave, the roadmap to the Viksit Bharat 2047, where the health minister was there, and then Dr. Sareen was there, and Dr. Guleria was there, and myself was there. And very interesting thing came. And when I came here, I was to come at 11:30, but somehow I came at 12:30. Now also I have to run. 5 people are waiting in my clinic for the appointments. Now, listening to Jitendra, what he was talking about the ideas. Now, we do invest in new ventures. We talk about the startups. But many people, as he rightly said, have very good ideas, but they don't have the funding or they don't have the facilities because they are at the remote places and other things. So there are quite a few things which I summarize when we talk about the health of a nation or health of a person. There are 4 things. They are all 4 A's, which can solve many of the problem. Like you take awareness. The awareness has to be brought into the society about many things. Because with the changing lifestyle, many diseases are increasing every day. And awareness can be brought by people like Sudipto, people like media, people like us, people sitting at the regulatory body, and more than anybody else, the political people. Political will has to be there. Then second day comes availability. How the things are available at the grassroots and how people can reach, that is the best way. As they was telling about the telemedicine, which is the next AI, and all those things are there. Then is the accessibility. How accessible are these things? Now, this morning, Minister was talking about a card where all health data will be there, where you have all the data of the practitioner of the medical fraternity and everything. And the last is the affordability. How affordable is the things? And like we talk about generic medicine, because this morning they were talking violence against the doctor. They were talking about gender bias. All these things have to be addressed. Apart from that, we have a population of 144 billion. For that population, the minister was telling we have increased the seat from 50,000 to 1 lakh. We have increased the medical college from 350 to 700. They are planning for 1,000, and the quality and all. But when you talk about the availability and the cost of the things involved in that, take an example. How much money I spent to become a doctor from a government King George's Medical College? Total money spent is 1,200 rupees, 300 rupees per annum. And look at today, people have to pay crores to become a doctor. I'm talking about 70s, late, yeah. But today, so the best of the minds which can achieve the merit, they don't have the money to spend. The people, those who have money, they don't have the numbers. So there's a quality is a big issue. Coming back to that, about the machines, like you was talking about the machines and best things being used in the medical field, CAT scan and all those things, and MRIs and other things being Indianized, and prices are one tenth of the thing. So we have to promote made in India, make people aware, and do on the preventive side so that we can be a healthy nation. Thank you very much.
thank you. I think the lunch is sitting on our head. We have to cut it short and taking the idea from Dr. Jitin Sharma, from all the panelists, that we have to work towards creating an idea bank. Most importantly, connecting the dots in CSR. I think that's one of the most important thing which needs to happen. A lot of people on the funding side are thinking of doing a lot of CSR work. A lot of people on the NGO side are ready to do a different set of programs on the ground, but there's a gap, there's no connect. Even technology is also not being used properly in CSR. So connecting the gaps, which can start with the idea bank, sir. Thank you so much. Thank you, everyone.
Thank you, thank you. I would request Ms. Misha Dange, Board Member, Heal Foundation, to please come on stage to present token of appreciation for our panelists. Dr. Anil Kohli, Padma Bhushan awardee, eminent dentist, dental surgeon. Dr. Ashu Grover, Deputy Director, Indian Council of Medical Research. Dr. Nilesh Tiwari, Chairman, World Brain Center. Dr. Jitendra Sharma, Managing Director and CEO, AMTZ, Andhra Pradesh MedTech Zone. And our moderator, Dr. Swadeep Srivastava, Founder Chairman, Heal Foundation. I have a request for a group photo. Misha, if you can stay back for a group photo, please. Thank you so much. You have been a wonderful audience till now. Now we'll break for lunch for half an hour. And after half an hour at 2:30, we convene back for 3 more inspirational sessions. So I request all to please grab your lunch as soon as possible and reconvene back at 2:15 p.m. We have 3 more sessions, which is blind spots in CSR, highlighting health issues that are frequently overlooked. Then we have a session on synchronizing efforts aligning CSR with national health goals. And last session on fueling champions, nutrition, preparation, and Boschia's journey of Paralympic athletes. Post which we will have our award ceremony for the day. Hence, I request you all, please come back at 2:15 p.m. post lunch. Thank you.
Drives. First is our flagship program of health media and training capacity building, focused on the vernacular and digital media, under which we have trained more than 1,500 health journalists, editors, bloggers, health writers, and this platform has been a voice to more than 500 experts, key opinion leaders, doctors, and public health experts. And second are extensive CSR programs in healthcare focused on health screening for NCD and preventable diseases using our unique health area module, keeping the marginalized people at the bottom of the pyramid at the center. And Suposhan programs in schools and colleges, and tuberculosis new case finding initiatives using our floating mobile screening module using latest technology and cost effective methods.
15 years ago, a vision was born. A vision to bridge the gaps in healthcare and bring about lasting change in communities across India. Today, Heal Foundation stands as a guiding light, empowerment, and transformation. Heal Foundation, a not-for-profit organization, has tirelessly committed itself to driving impactful change through corporate social responsibility. By uniting policymakers, social scientists, and key healthcare stakeholders, we have forged powerful partnerships that have bolstered India's healthcare framework. Our mission: to educate, empower, and advocate for a healthier, more informed society, ensuring that our CSR initiatives leave a lasting legacy. One of our most impactful initiatives is Suposhan, a program combating childhood anemia in East Delhi. We recognized that widespread anemia was hindering children's ability to thrive. So we partnered with the East Delhi Municipal Corporation, Britannia Nutrition Foundation, and All India Institute of Medical Sciences to make a difference. Through this program, we provided iron and micronutrient fortified biscuits to children for 6 months, ensuring they receive 50% of their daily nutritional needs. One of our proudest achievements is the Swavlamban initiative, a project that has touched the lives of thousands of migrant workers and their families. Through evening health clinics, education centers, and livelihood training, we've brought hope and opportunity to those who need it most. During the unprecedented COVID-19 pandemic, HEAL Foundation stepped up with the COVID Fighters Public Health Safety Movement. In just 400 days, we reached over 120 million people across India, providing accurate information and support during a time of crisis. Our Mask is Must campaign became a symbol of resilience, helping to save lives and spread awareness. In 2021, as the world began to recover, we launched Health for All online, a weekly health show that brought expert advice directly into people's homes. Covering everything from yoga to cutting edge health technology, this show has reached 8 million viewers, sparking conversations about health and wellness across the nation. With our preventive screening drive via mobile health clinic, look at the transformative journey with HEAL Foundation and You Grow Capital's groundbreaking CSR initiative. The preventive screening drive via mobile health clinic. For the past year, we have diverse communities from urban slums to corporate settings, championing the cause of preventive healthcare. As we mark a year of impactful outreach, it is clear that these initiatives have done more than just provide healthcare. They have sparked a cultural shift towards prioritizing preventive health. The preventive screening drive via mobile health clinic is a testament to the power of corporate social responsibility, shaping a healthier future for India. Through the preventive health screening drive via mobile health clinic, National Fertilizers Limited, in partnership with HEAL Foundation, brought essential preventive health services to thousands of undeserved individuals across urban and semi-urban slum areas. This CSR-driven initiative not only delivered vital care directly to those in need, but also ignited a cultural shift towards preventive healthcare, empowering communities with the knowledge and tools to combat non-communicable disease. The program's success highlights NFL's deep commitment to corporate social responsibility, leaving a lasting impact on the health and awareness of these marginalized populations. India Fights TB is a crucial initiative aimed at eradicating tuberculosis from India by raising awareness across the nation. With TB being a leading cause of death, particularly in states like Uttar Pradesh, Madhya Pradesh, Maharashtra, Rajasthan, and Gujarat, this campaign focuses on spreading credible information to prevent and combat the disease at its root, empowering every individual to be a part of the fight against TB. As we celebrate 15 years of service, we look to the future with renewed commitment. HEAL Foundation will continue to pioneer health education, advocacy, and care because a healthier India is a stronger India. Together, we are making a difference, one life at a time. Join us in our journey. Together, we can make India healthier, stronger, and more resilient.
Today, in our first edition of Healthcare CSR Changemakers Summit and Awards program, in line with promoting the role of healthcare changemakers, we have come together to celebrate the role of CSR initiatives, CSR funded programs, and exemplary role played by the CSR changemakers in creating health impact and improvements on the ground, contributing to the social and health upliftment of the underprivileged society with an objective to make our people healthier by adopting preventive habits and taking our country, India, towards becoming the health capital of the world by 2047. Greetings from Heal Foundation. Since our inception in 2010, our core objective at Upliftment India towards becoming the health capital of the world by 2047.
Welcome to the Healthcare CSR ChangeMakers Summit and Awards 2024, where impactful social action meets healthcare excellence. Organized by the Heal Foundation in association with esteemed partners, this summit is dedicated to celebrating and inspiring corporate social responsibility in healthcare. Join us for a day of engaging sessions, insightful discussions, and prestigious awards. This event brings together industry leaders, healthcare professionals, and CSR enthusiasts. Heal Foundation, a not-for-profit organization, is at the forefront of healthcare advocacy in India. Our mission is to raise public awareness, promote healthy living, and drive policy changes for a healthier nation. The summit dives deep into groundbreaking solutions, from innovative CSR projects to empowering policy changes. This isn't just a summit, it's a springboard for action. The prestigious ChangeMaker Awards recognize those making a real difference. Mark your calendars for September 5th, 2024 at the India Habitat Center, New Delhi. Be a part of this transformative journey where we celebrate the change makers driving positive social impact in healthcare.
देश दोस्तों बदल रहा है, देश आगे बढ़ रहा है, नया भारत का निर्माण हो रहा है और हम इस इतिहास का साक्ष्य बने जब हमारे न्यू जनरेशन इंडिया का, हिंदुस्तान का मोदी युग को पढ़ता हो, इस संक्रांति काल का इतिहास को पढ़े, तब हमारे पूर्वजों ने भी ये बदलते हुए देश में कुछ कंट्रीब्यूशन किया था, ऐसा सम्मान न्यू जनरेशन हमें दे, ऐसा देश के लिए कुछ करके जाए, ऐसी आप सबसे मेरी अपेक्षा है। सभी सम्मानित पद्मश्री, पद्म विभूषण से सम्मानित सभी को मैं हार्दिक शुभकामनाएं देता हूँ। उपस्थित सभी भाइयों और बहनों को मेरी ओर से हार्दिक शुभकामनाएं। धन्यवाद।
मेरे सामने यहाँ सब ये प्रतिभाशाली व्यक्तिगण उपस्थित है। इस कार्यक्रम के आयोजक हील फाउंडेशन को विशेष रूप से धन्यवाद देना चाहती हूँ कि जिन्होंने हमारे इस चिकित्सा क्षेत्र में ऐसे प्रतिभाशाली व्यक्तियों को एक साथ इस कार्यक्रम में आने का और उस कार्यक्रम में हमें उपस्थित होने का अवसर प्रदान किया है। मैं फिर एक बार Friends, I am delighted to participate in India's first Padma Doctors gathering in the Bharat Swasth Mahotsav to facilitate the healthcare ChangeMakers, Padma Doctors, for your outstanding contribution to healthcare landscape in India.
बहुत बहुत धन्यवाद आदरणीय स्वदीप जी, उपस्थित मेरे सभी मित्र और भाई बहन. There are people in every sector who believe in the role of Mother India, who want to serve the country, who do their best to establish whatever is good in the society. I think from this podium, I want to thank all those, be it journalists, be it political people, be it the doctors, be it the military people, be it the police guys, be it anyone, and our sweepers, our Safai Karamcharis who worked during that period. I want to thank everyone because it was for our country, and this is an occasion to celebrate all that is good in this country. And there's huge amount which is good in this country. Thank you very much.
Join us at the Healthcare CSR ChangeMakers Summit and Awards 2024. Together, let's create a healthier future for all.
Greetings from HEAL Foundation. Since our inception in 2010, our core objective at HEAL Foundation has been to provide neutral, effective platforms for stakeholders who are committed to healthcare improvements by contributing sincerely in whatever small or big ways, representing the ethos of their sector and organization they stand for. We have been fortunate to pivot two key programs in our health impact and improvement drives. First is our flagship program of health media and training capacity building, focused on the vernacular and digital media, under which we have trained more than 1,500 health journalists, editors, bloggers, health writers, and this platform has been a voice to more than 500 experts, key opinion leaders, doctors, and public health experts. And second, our extensive CSR programs in healthcare focused on health screening for NCD and preventable diseases using our unique health ATM module, keeping the marginalized people at the bottom of the pyramid at the center. And Suposhan programs in schools and colleges, and tuberculosis new case finding initiatives using our floating mobile screening module using latest technology and cost-effective methods.
15 years ago, a vision was born. A vision to bridge the gaps in healthcare and bring about lasting change in communities across India. Today, HEAL Foundation stands as a guiding light, empowerment, and transformation. HEAL Foundation, a not-for-profit organization, has tirelessly committed itself to driving impactful change through corporate social responsibility. By uniting policymakers, social scientists, and key healthcare stakeholders, we have forged powerful partnerships that have bolstered India's healthcare framework. Our mission: to educate, empower, and advocate for a healthier, more informed society, ensuring that our CSR initiatives leave a lasting legacy. One of our most impactful initiatives is Suposhan, a program combating childhood anemia in East Delhi. We recognized that widespread anemia was hindering children's ability to thrive. So we partnered with the East Delhi Municipal Corporation, Britannia Nutrition Foundation, and All India Institute of Medical Sciences to make a difference. Through this program, we provided iron and micronutrient fortified biscuits to children for 6 months, ensuring they receive 50% of their daily nutritional needs. One of our proudest achievements is the Swavlamban Initiative, a project that has touched the lives of thousands of migrant workers and their families. Through evening health clinics, education centers, and livelihood training, we've brought hope and opportunity to those who need it most. During the unprecedented COVID-19 pandemic, HEAL Foundation stepped up with the COVID Fighters Public Health Safety Movement. In just 400 days, we reached over 120 million people across India, providing accurate information and support during a time of crisis. Our Mask is Must campaign became a symbol of resilience, helping to save lives and spread awareness. In 2021, as the world began to recover, we launched Health for All Online, a weekly health show that brought expert advice directly into people's homes. Covering everything from yoga to cutting-edge health technology, this show has reached 8 million viewers, sparking conversations about health and wellness across the nation. With our preventive screening drive via mobile health clinic, look at the transformative journey with Heal Foundation and YouGrow Capital's groundbreaking CSR initiative. The preventive screening drive via mobile health clinic. For the past year, we have diverse communities from urban slums to corporate settings, championing the cause of preventive healthcare. As we mark a year of impactful outreach, it is clear that these initiatives have done more than just provide healthcare. They have sparked a cultural shift towards prioritizing preventive health. The preventive screening drive via mobile health clinic is a testament to the power of corporate social responsibility, shaping a healthier future for India. Through the preventive health screening drive via mobile health clinic, National Fertilizers Limited, in partnership with Heal Foundation, brought essential preventive health services to thousands of undeserved individuals across urban and semi-urban slum areas. This CSR-driven initiative not only delivered vital care directly to those in need, but also ignited a cultural shift towards preventive healthcare, empowering communities with the knowledge and tools to combat non-communicable disease. The program's success highlights NFL's deep commitment to corporate social responsibility, leaving a lasting impact on the health and awareness of these marginalized populations. India Fights TB is a crucial initiative aimed at eradicating tuberculosis from India by raising awareness across the nation. With TB being a leading cause of death, particularly in states like Uttar Pradesh, Madhya Pradesh, Maharashtra, Rajasthan, and Gujarat, this campaign focuses on spreading credible information to prevent and combat the disease at its root, empowering every individual to be a part of the fight against TB. As we celebrate 15 years of service, we look to the future with renewed commitment. Heal Foundation will continue to pioneer health education, advocacy, and care, because a healthier India is a stronger India. Together, we are making a difference, one life at a time. Join us in our journey. Together, we can make India healthier, stronger, and more resilient.
Today, in our first edition of Healthcare CSR ChangeMakers Summit and Awards program, in line with promoting the role of healthcare changemakers, we have come together to celebrate the role of CSR initiatives, CSR funded programs, and exemplary role played by the CSR changemakers in creating health impact and improvements on the ground, contributing to the social and health upliftment of the underprivileged society with an objective to make our people healthier by adopting preventive habits and taking our country, India, towards becoming the health capital of the world by 2047.
Welcome to the Healthcare CSR ChangeMakers Summit and Awards 2024, where impactful social action meets healthcare excellence. Organized by the Heal Foundation in association with esteemed partners, this summit is dedicated to celebrating and inspiring corporate social responsibility in healthcare. Join us for a day of engaging sessions, insightful discussions, and prestigious awards. This event brings together industry leaders, healthcare professionals, and CSR enthusiasts. HEAL Foundation, a not for profit organization, is at the forefront of healthcare advocacy in India. Our mission is to raise public awareness, promote healthy living, and drive policy changes for a healthier nation. The summit dives deep into groundbreaking solutions, from innovative CSR projects to empowering policy changes. This isn't just a summit, it's a springboard for action. The prestigious ChangeMaker Awards recognize those making a real difference. Mark your calendars for September 5th, 2024 at the India Habitat Center, New Delhi. Be a part of this transformative journey where we celebrate the change makers driving positive social impact in healthcare.
देश दोस्तों बदल रहा है, देश आगे बढ़ रहा है, नया भारत का निर्माण हो रहा है और हम इस इतिहास का साक्ष्य बने जब हमारे न्यू जनरेशन इंडिया का, हिंदुस्तान का मोदी युग को पढ़ता हो, इस संक्रांति काल का इतिहास को पढ़े, तब हमारे पूर्वजों ने भी ये बदलते हुए देश में कुछ कंट्रीब्यूशन किया था, ऐसा सम्मान न्यू जनरेशन हमें दे, ऐसा देश के लिए कुछ करके जाए, ऐसी आप सबसे मेरी अपेक्षा है। सभी सम्मानित पद्मश्री, पद्म विभूषण से सम्मानित सभी को मैं हार्दिक शुभकामनाएं देता हूँ। उपस्थित सभी भाइयों और बहनों को मेरी ओर से हार्दिक शुभकामनाएं। धन्यवाद।
मेरे सामने यहाँ सब ये प्रतिभाशाली व्यक्तिगण उपस्थित है। इस कार्यक्रम के आयोजक हील फाउंडेशन को विशेष रूप से धन्यवाद देना चाहती हूँ कि जिन्होंने हमारे इस चिकित्सा क्षेत्र में ऐसे प्रतिभाशाली व्यक्तियों को एक साथ इस कार्यक्रम में आने का और उस कार्यक्रम में हमें उपस्थित होने का अवसर प्रदान किया है। मैं फिर एक बार, friends, I am delighted to participate in India's first Padma Doctors gathering in the Bharat Swasth Mahotsav to facilitate the healthcare change makers, Padma Doctors, for your outstanding contribution to healthcare landscape in India.
बहुत बहुत धन्यवाद आदरणीय स्वदीप जी, उपस्थित मेरे सभी मित्र और भाई बहन। There are people in every sector who believe in the role of Mother India, who want to serve the country, who do their best to establish whatever is good in the society. I think from this podium, I want to thank all those, be it journalists, be it political people, be it the doctors, be it the military people, be it the police guys, be it anyone, and our sweepers, our Safai Karamcharis who worked during that period. I want to thank everyone because it was for our country And this is an occasion to celebrate all that is good in this country. And there's huge amount which is good in this country. Thank you very much.
Join us at the Healthcare CSR ChangeMakers Summit and Awards 2024. Together, let's create a healthier future for all.
Greetings from Heal Foundation. Since our inception in 2010, our core objective at Heal Foundation has been to provide neutral, effective platforms for stakeholders who are committed to healthcare improvements by contributing sincerely in whatever small or big ways, representing the ethos of their sector and organization they stand for. We have been fortunate to pivot key
Hello.
programs in our health impact and
Good afternoon, everyone. I request you all to please settle down so that we can initiate our post-lunch sessions. Can someone please help me close the doors? It's a humble request to everyone to please settle down so that we can initiate the post-lunch sessions. If someone from my team is here, I'll request them to please announce outside that we are starting with the post-lunch sessions. To start our first post-lunch session, which is on blind spots in CSR, highlighting health issues that are frequently overlooked. I would like to invite the moderator for the session, Dr. Manjari Chandra, consultant functional nutritionist, nutritional medicine and nutrigenomics, Manjari Wellness, Max Healthcare, and Metabalance. Dr. Manjari, if you can please join us on stage. Panelists for the session are Dr. Ilmi, consultant physician, Helvetia Diagnostics and Healthcare, Dr. D.S. Ratnadevi, CEO, Dakshima Health and Education, Dr. Vibhor Avasti, General Secretary, Accord, Dr. Anuradha Khairnar, co-founder and chairperson, W Shakti Foundation, Dr. Nimesh Desai, consultant physiatrist, therapist, former director, EBAS, and last but not the least, Ms. Garima Matthias, associate director, programs, IPAS Foundation. I request each one of you please take seat on the panel in front of your photographs. Someone from the production side, I need extra chair on the panel, please. Thank you. Over to you, Dr. Manjari.
Thank you, Dr. Ankit. Thank you, Dr. Swadeep and Heal Foundation. Welcome to all the dignitaries and all the esteemed panelists today on this panel, a post-lunch panel. Hope to get your attention to listen to a lot of interesting things that we'll be discussing today. We'll keep the panel crisp and short, and we'll request all the panelists to, answer briefly and to the point. Take this ahead properly. We have a lot of esteemed doctors and physicians on the panel today. I'll start with Dr. Ijaz Ilmi sitting next to me. Of course, today we're talking about some blind spots in CSR and where are the issues that are frequently overlooked, Dr. Ilmi. So, in fact, I got a chance to just say hi to him before the panel and came to know that he also practices functional medicine, which is very heartwarming to know. So, with that in point, and considering that handling cardiometabolic diseases and progressive chronic diseases in modern medicine is limited to pharmaceutical, intervention, what is your take on how integrative functional medicine or more bioregulatory medicine can be used at a larger platform, and also think of using it in a CSR platform?
Thank you, Dr. Manji. Thanks so much for giving me this opportunity. Well, I'm Dr. Ijazulmi, and I practice consulting physician, and I practice functional medicine, which is the future of medicine is functional medicine, because the pharmaceutical industry is probably growing at 5% every year, but the disease is climbing. Chronic diseases like type 2 diabetes, hypertension, fatty liver, Alzheimer's, dementia, and PCOD for adolescent girls, these are climbing at over 10% every year. So obviously the doctors are doing their best, but they need help. How do you mitigate this pandemic? The second pandemic, we've had COVID. The new pandemic is the pandemic of chronic metabolic diseases, which affects everybody. And now we see adolescent children as old as 15 years, 18 years, coming to you with fatty livers because of ultra-processed foods. And they're diabetic and pre-diabetic, and half of these cases are not diagnosed because nobody wants to go and test. But then it's only when they start putting on mammoth amounts of weight, then the parents get concerned and they get a basic blood biomarker test done. And then you get to know that the child is not suffering from one, but maybe multiple metabolic chronic disorders, which were largely preventable in the first stage. So with the pharma industry rising, with the number of hospitals going up, with the number of gyms going up, but the disease is far ahead of that. So one has to think out of the box. You have to reimagine, rethink, reset yourself, and also think of what else is the cause which is leading to metabolic disorders. I always say this to people, and I quote my favorite professor, it's Robert Lustig. He says most chronic metabolic diseases are not druggable, but they are foodable. So nutritional intervention in terms of identifying the deficits which cause disease, and also how do you use nutrition interventions to actually allow your body, which has the real magic. I don't believe in magical foods. I believe that body has enough magic in itself. You can get it to a chronic metabolic dysfunction level. It will cause 5 years, 10 years, 15 years, and disease will creep up to you slowly. But the body inherently has the capability to reverse, stall, and maybe get into remission with all these chronic diseases if you allow the body, the inherent magic in its body to function. So this primarily is what nutritional medicine is all about. And we try our best. And I believe that we are actually aiding the doctors because who are largely overworked. And I might sound a bit controversial in saying this, but a lot of doctors are so overworked that they don't have time, and the patients actually feel let down when you don't get more than 5 or 7 minutes with the doctor. But the doctor, if you're charging money, it's imperative on you to actually make the people understand science. It's a shared responsibility. Your disease, the patient has to take it upon himself that it's my responsibility also. I can't just leave it to the doctor alone. Unless you share this responsibility that I need to get well, because if I'm the provider, my family needs to get well. My children are in the prime age of college, getting jobs, probably marriage, so I need to stay healthy. So my children should not say to me that when our best time came, when you're getting jobs and getting married, I had to tend to my ailing parents who probably suffering from hypertension, type 2 diabetes, liver disease, chronic kidney disease. So this responsibility can only happen if the doctor and the patient have this shared responsibility among themselves to fight this menace or this epidemic of chronic metabolic disease. Simple blood biomarkers, I'm going to be brief, Manju. Simple blood biomarkers, just getting your blood pressure checked occasionally. And also, what are the most important things, what you can do at home is just take a measuring tape or the thread if you don't have one, If your height is say 5 feet 6 inches, and that's 66 inches, and if your waist is more than 33 inches, 50% of your height, then you definitely have visceral fat, and your propensity and your chances of heading towards metabolic disorders is very, very high. Simple few blood tests like liver function test, kidney function test, HbA1c will give your doctor a complete idea that you are not in optimal health, but your biomarkers are suboptimal. When I did my medicine, my physiology and pathology, this is like 40 years ago in Bangalore University. The biomarkers for an important enzyme like SGOTP used to be 0 to 25. Now the same parameters, when you go to get your blood tested, is 0 to 50. But any doctor of functional medicine will, after 30, 35 SGPT, they will understand that something is going wrong, insulin resistance probably happening, and there's bile buildup and your liver's under pressure. So obviously, the industry is such and the mechanics are such that healthcare is obviously such an important thing of our lives, but the rising cost of healthcare is leaving everybody under pressure. So it's better to that prevention and understanding your own body, thinking about yourself, thinking about your family. These are the key things that I want to talk about. Thank you so much.
Thank you, Dr. Ejaz. And as you correctly said, functional medicine or integrative medicine, as we call it, is the medicine of the future. What you're really trying to say here is that we always talk about prevention. We talk about the fact that most of these non-communicable chronic metabolic diseases are preventable. You can prevent them from happening if you know what is it that you can do on a daily basis, whether it's your food, sleep cycle, stress levels, movement, activity, everything has a role to play. And if you know how to do this well, you can prevent it. But there's another part to this also in functional medicine, which is not just limited to preventing metabolic diseases, but also looking at metabolic diseases in, in the sense of remission, in sense of looking at them in a format where you don't have to live with it. So God forbid if I get diabetes or high cholesterols or fatty liver and so on and so forth, I don't really need to necessarily live with these diseases. And there is an opportunity that medicine already knows about to put these into remission, to get this out of the way. And that's huge, considering that as a nation, we are crippled with the burdens of non-communicable diseases. And, to extend it to community and to the larger group and to people who may not be able to afford treatment, I think is also extremely important. So thank you for your inputs, Dr. Ijaz. I'll take the next question to Dr. Ratna. And Dr. Ratna, thank you for joining in. So, we've also had a session on maternal health early in the day. And looking beyond maternal health, what are the other chronic diseases that you think are, also a bigger part of women's healthcare problems that are not normally looked at? With women, we tend to limit ourselves to maternal health and menstrual hygiene and reproductive health itself.
Thank you, Dr. Manjari, and good afternoon, everyone. I'm Dr. Ratna. I'm actually a public health physician, but the hat that I'm wearing today is to represent the patient voice. I run an organization called Dakshama Health, which has a coalition of about 80 to 100 patient organizations. These are organizations that are run by patients or caregivers. And I was just hearing Dr. Azaz talking about shared responsibility. So our motto, and this is not something that's in India, it's a global motto which says nothing without us, nothing about us without us. There is a WHO framework document which says meaningful involvement of people living with non-communicable diseases, where patient is considered an expert in his or her own condition and can bring as much value to the table as any scientist, medical professional, or any other person who works in healthcare. So on this premise, we work with patients, patient groups to understand what their perspectives are and bring their thought processes to the table to not only shape policy, but also, treatment protocols. And we know that most of medicine comes from the West. So does it really work for populations in the context of our country? And if it does not, what is it that we need to change? This is a little bit of the work that I do. To answer Dr. Manjari's question, we generally talk about maternal health or health in the context of reproductive health. But then women are always at a disadvantage as far as healthcare is concerned, because A, they are not the financial decision makers in the family, and B, they do not have, sometimes they do not have the ability to go to a healthcare center. So there is a geographical access issue, because they do not have the transport, or they are not able to make it to a healthcare center. So conditions that are beyond metabolic diseases, like say endometriosis, 1 in 10 women suffers from endometriosis. 30% of women with endometriosis suffer from infertility, very stigmatized, huge taboo, nobody wants to discuss. And combined with that is severe intolerable pain that makes the person so disabled that they are not able to function as a normal human being. Similarly, PCOD, heart failure, stroke in women. And then another thing that we normally do not discuss is mental health in women. Most women think themselves as very, very resilient, and therefore that topic is not discussed. But we as a patient group or a patient representative organization feel that all health should have mental health. There should be no health without mental health, and I'm sure Dr. Desai will agree with me on that. And we've seen this. Patients who have been discharged from the hospital after a stroke come back home, refuse to eat, refuse to follow the instructions of the caregiver, and deteriorate, have a second attack of stroke, and are back in the hospital. Why? Because nobody thought that they need counseling. The caregivers need counseling. There is so much of burnout in caregivers for chronic long-term conditions. Nobody ever talks about mental health issues for caregivers, especially for children. If it's a spouse, they at least they have the patience and the ability to be able to take care. But children are stressed out because they have to take care of old parents or people with disability in the house, and there is no institutional support mechanism to be able to take care of mental health for these people who have long-term chronic conditions. So I would think that there are a lot of gaps, because we are talking of blind spots in CSR. CSR does not traditionally look at these areas, and I think it's time we invested in these areas. Thank you.
Completely agree with you, Dr. Ratna. And, because you mentioned mental health, who better than Dr. Desai to talk about this? So, Dr. Desai, I'd like to, although, we could go on and on talking to you about mental health, but I have a set of specific questions targeted at you. So, for mental health and lifestyle disorders in particular, as Dr. Ratna also mentioned, there is not much talk of it or intervention or even reach of these in the community when we look at CSR initiatives or any other form of community initiative. So where do you think the government, the policy maker, where are we going wrong? Why is it limited to only larger hospitals? And why are we not reaching the community?
Thanks. Thanks so much, Dr. Manjari. You're right. If I heard you correctly, I have what is a common sign in psychiatry, racing of thoughts. बहुत सारे विचार आ रहे हैं दिमाग में और आपके सामने कौन से रखूं कौन से नहीं रखूं ये नहीं पता. But I'll try and share a few quick ones. What about 98 years ago, Aldous Huxley published a book called The Brave New World. And he said something, he described the whole medical science, health scenario, society. And he said something very beautifully, which today is so much more true. Aldous Huxley said in 1932, now medicine has advanced so much that hardly anyone is healthy. Now we have come much farther on that route. Because of our sensitivity, the technology improving, the diagnosis getting better. So there is virtually not just in psychiatry. Now, I want to come to the closer point, but I'll come to that in a minute. Not just in psychiatry that we all can be diseased or abnormal or unhealthy, but even in physical health, that's actually true. The second point that I want to make, linked to what Dr. Manju and Dr. Ratna are saying, I don't know if it has been discussed since the morning or how many of you have realized. The paradigm shift from communicable diseases to NCDs in the Western world and for Afro-Asia, dual burden of disease, came up not because of WHO alone. Health organizations alone would have shouted from rooftops from 200 years and nobody would have listened. Guess who joined? The World Bank. It was the World Bank WHO project, started in 1990, began to publish data in 96, 99, 2000, and after that, that brought out the whole issue of how NCDs are important. Everything that Dr. Ratna was saying, that NCDs still remain a blind spot. in spite of all this, somewhere, yes, in Afro-Asia, I guess understandably, to empathize with the government, I am now a free bird, not in service role, so no reason for me to defend. But to be fair, the bureaucrats, the policymakers, the groups, working groups have a problem because we are going through a dual burden of disease. You know, so how that is where the CSR can step in, but the SR has, in fact, much larger blind spot. If I might use the terms, and no offense to the other gender or the other two genders, but CSR does not find mental health or NCDs very seductive or sexy to work with. It's not. You know, I mean, you work with HIV, you work with, you know, a whole lot of other topics. I might slightly differ with whoever one of these colleagues said that, you know, the issues of NCD became important in terms of behavior. No, actually, if nothing else, this pandemic recently taught us that all health is related to behavior. One, all health is related to collective behavior. It's not even my health will depend on how I behave or my lifestyle, but how we all collectively behave. Now, that's important. That's where the prevention promotion part that my colleagues have been talking about will come in. Curative, rehabilitative medicine or healthcare is essentially one-on-one, individual. You, the patient, I, the doctor, or I, the health provider. The moment you come to preventive and promotive paradigms in public health, it has to become mass-based. And that is very difficult for people to do. I found it very interesting. Dr. Ajaz made some great points. Lot of them are moving towards functional medicine, and a lot of psychiatry is moving from being called functional to organic. A lot of psychiatrists don't like, you know, what was called as functional disorders, the disease of the mind. We all want to identify with the brain. But my one or two last points before I close for this part is this. Actually, it's a serious problem that 50 years ago, with all respect to all who must have been big shots then, Pandavs will know firsthand, the 1974 definition of health is a serious problem. And we in mental health are very thrilled about the fact that it includes in the latter part physical, mental, social health. So be it. My problem is with the stem. Health is not only absence of disease, but a positive state of well-being. Damn it. And here again, I think I differ with Dr. Manjli. If I understood her correctly, you don't have to live with the disease. I think you have to live with disease. Good health or optimal health, as Dr. Azaz said, I love that term, optimal health, is learning to live with disease, impairment, disability. Is there anyone in this hall who can say that he or she, however your age, even 25, 30-year-olds, certainly those who are over 40 or 45-year-old, you have never had a health problem, you don't have an ongoing health problem? No one. If you in fact add up the prevalence rates of all the, you know, we say 15%, Nilesh shared pre-lunch, somebody will say we are 20%, we are 15%, the total goes up to more than 200%. So if you include comorbidities, physical and mental health both, living with the disease is the idea of health. I really sincerely want to put this to you. And 50 years down the road, sir, 74 to now, 2024, it's time to review and revise the definition of health. You know, the last part in that line is that mental health, obviously, no, I'll leave mental health alone. I want to go back to what Dr. Ratna said. Lived in experience or subjective experience or the consumer experience, call it what you want. If there is one trend that is unarguable in last few decades, is what Dr. Ratna emphasized. Doctor alone, technical expertise alone is not enough. Now, what CSR initiatives will be able to examine that together? Does healthcare service delivery, does health outcome, does optimal health get better if you have a participatory approach as compared to I doctor, you patient? That I doctor, you patient ideas are decades old. So CSR really needs to focus on even that, really.
Yeah, thank you. We'll take it later, please. Okay, thank you, Dr. Desai. That was, yeah, as you can see, everybody really listened really earnestly. Thank you for those points. We can still debate on whether we can be free of disease or live with disease, but maybe later at some point of time. I'll take the next question to Dr. Anuradha. Dr. Anuradha, how is it possible that we develop enough successful strategies? And when I say strategies, I'm saying post the COVID pandemic, we were able to do something, with the pandemic. How can we replicate successful strategies to meet the public health challenge that we see today, considering that we're talking about blind spots in CSR today?
I'm Good afternoon, everyone. I'm Dr. Anuradha Kernar, and I'm the chairperson of W Shakti Foundation and Director Healthcare in ISAP India Foundation. Thanks, Manjari, for giving this opportunity. The COVID-19 pandemic was, we all know, it was, one of the biggest pandemics in the entire human history. And we are very proud that India is at the forefront of handling this crisis situation, not only internally, and we also helped the other countries as well. During this pandemic, the way the disease was handled, the crisis was handled by the government and by all the stakeholders was really commendable. And we could take a lot of lessons from our handling of the situation into other healthcare areas. And this is happening. Actually, this is being recognized that there are a lot of successful strategies that could be adopted in handling the public health challenges. I would start with the first thing, the power of collaboration. This was the first time, I think, the entire force of government machinery, corporate partners, and people like, the NGO partners and even the community, every single part of the community came together and pulled this big cart and to achieve the the success in handling the situation, whether it was the disease burden or even the vaccination. So the power of collaboration was clearly demonstrated during the COVID pandemic, and we could all see that how we all come together and to handle public health challenges like TB, diabetes and mental health and all the the challenges that are still remaining. And number two, convergence. Even amongst the stakeholders, we were a part of COVID vaccination drive. So even the stakeholders, the multi stakeholders that are in the community, whether it's the NGO partners, whether it is the faith based organizations, MSME agencies, you could women self help groups. So any organization or anybody in the community thought that they had to play a role in in handling the situation and improving the vaccination drive. So we could all see that I would say everybody was able to see the greater good for the society. So everybody played their role in in handling this. For example, in a very remote part of Bengal, we were doing a vaccination. Even those village boys, they became the peer champions, and they could go and bring all the old people in their own vehicles, and even take carrying this vaccinators to travel 10 kilometers, matlab pahad chad karke, without chappals they could travel and then give the vaccination. So it was really heartwarming to see that if the community could see that the collective effort could result in a greater good to the society. I think that was demonstrated during this COVID pandemic crisis. And the third thing I would say is the community engagement. Like previously I mentioned, the community also played a very great role, assessing that everybody was doing for their benefit. So that was a great thing. And finally, I would talk about the technological adoption. The COVID was the first ever, I think, technology adoption on such a large scale, which I think none of the other countries were even able to replicate. Whereas even in US, they were getting handwritten certificates. We in India were able to download it on our mobile. We had it at our fingertips, and that has been replicated now to UWIN, for the routine immunization of the children. So likewise, there are a lot of technology adoption that has happened at a micro level and at a macro level, and are being replicated to handle the public health challenges. So these are the couple of successful strategies we could look at a granular detail, and how they worked and why they worked and why they became so successful. That could be replicated in handling other public health challenges. Thank you.
Yeah, thank you, Dr. Anuradha. Of course, there are a lot of takeaways from COVID, but now COVID is behind us and we have newer challenges to meet. Obviously, some of the strategies and things that we learned in COVID can be adapted. One of them is, of course, technology, as you mentioned. I mean, all of us in India had our vaccines on our phones, and we could track them, which was quite a remarkable thing considering the population and the length and breadth of this country. So yeah, I think these are things that can be adopted if you're looking at reaching the community. We'll take the next panelist, Ms. Garima now. Ms. Garima, how do you think, in which areas specifically would you think there is a need in CSR for more funding and more support to come through?
I thank you, Dr. Manjari, and good afternoon, everyone. I hope हम सब अपनी बातों से post lunch आपको engage करके रख पाए. So bear with us. I'm sure food was very nice. So thank you to the organizers for that. I'm from IPAS Development Foundation, and we work for preventing and managing unwanted pregnancies, which includes abortions and contraceptions. And we also work with young people, youth, and adolescents in parts of the country. So we work with Government of India, we work with private sector. Foxy is one of our leading partner. We collaborate with them, and we also work with CSR organizations. So coming to the question and the topic you asked, Dr. Manjari, I think CSR plays a very vital role when it comes to augmenting government strategies that they are implementing. We all know government has its limitations. We, as CSR partners or CSR organizations, can augment the government services by collaborating and taking the services to the last mile. I think where CSR can fund more is what Dr. Desai briefly touched upon is on behavior change communications. Uh, Generally, what happens is that CSR fundings are short duration. There are various laws that govern that, but the fundings are short duration. The activities and the targets are very time bound. There are limited resources. However, if we want to see change, we need to work on behavior change, especially for the youth that is coming up, and they are contributing. They're going to be the largest workforce that India is going to create now. If you see our demographic, if you see the population, if you see our the what do you call that pyramid, yes, thank you so much. The population pyramid, the youth forms the biggest chunk of that pyramid, and they are going to come into the workforce soon. So I think that we can, and CSR can collaborate together. Organizations like us can collaborate together with CSRs to take up the behavior change for sexual reproductive health to the community.
Yeah, thank you. That I think, Garima, I agree with you. And obviously, there's a lot of scope in terms of funding, in terms of support in the community in CSR. So let's have our last panelist, Dr. Vibhor Avasthi. Dr. Vibhor, my question to you would be about the advocacy, really, and healthcare advocacy. The lesser, the more we do this, still it's very less on ground. There's a lot of advocacy channels. The government itself is trying to do a lot of advocacy around health, both preventive and treatable, and of course, maternal health and many other things. But, how do we make advocacy stronger? And how is it that advocacy can play a major role in ensuring that the CSR activities actually, see the light of the day?
So thank you so much, Manjari. First of all, thank you to the organizers. I actually was feeling, a deja vu, that feeling like a backbencher, where the question always comes to last. The only difference is in college, we used to be happy that, there's no question to be asked, but I'm glad you are asked a different question. Uh, See, I'll start by saying that in our own health setup, and I'm not talking about CSR right now, there is a lot of silozation of what we are doing. Now, for example, we just had a talk, a panel discussion before this, and there the psychiatrist was talking about dementia, schizophrenia, Alzheimer's. What we have felt is that there is a lot more of mental health apart from that, and I think Dr. Rizvi has already spoken about this before. uh, in fact, our organization, which is the organization for comorbidities, is basically talking about the presence of more than one disease in an individual, which in India is very, very common right now. So what we see now here is that a physician treats hypertension, the physician treats diabetes, maybe also a kidney disease followed by diabetes, but nobody is willing to know what the mental status of that person is. Now, what I also have seen in different forums is, and I've been part of the psychiatry conference, which is ANSIPS, and other conferences also. ANSIPS is the only conference which is now talking about psychiatric illness in comorbidities. If you go to any of the diabetes conferences, cardiology conferences, they very rarely talk about the presence of these diseases. So I think that is number one problem, and I think the same thing might also be coming in the CSR activities. So what I feel is that the CSR activities are operating in silo, and what we need to do is we need to connect them together. So one silo has to connect to the other silo to give the proper advocacy to the government and make some kind of a policy. Unless that happens, I think that advocacy part would actually not come very well. And one of the example which was given was adult immunization. Adult immunization has been worked very well. It's a very great CSR initiative, and now the government of India is actually accepting a schedule of adult immunization, as a routine for every physician to follow. The second thing which I wanted to say is we have to make sure that all the activities, or at least the message of the activities, needs to go to the grassroots. I still feel we are working too much in the 25-30% of the Indian industry. I think what all good things are happening should go to the grassroots level, go to the villages, to the primary health care. And this will only happen if the CSR in some way connects with the government of India. And I think the Heal Foundation can be a good kind of a string which can bring them together. Thank you.
Thank you, Dr. Vibho. Thank you so much. So, one of the things that you pointed about, mental health, and about the fact that there are psychiatric conditions in people with comorbid conditions. In India, as you correctly said, you don't have a person just having one ailment. There are multiple comorbidities. And obviously, it not only leads to psychological stress, eventually it leads to psychiatric conditions. And one of the things that that is not addressed is mental health. I mean, to take a very simple example, in chronic diseases like cancer, where trauma and mental health is a big thing that needs to be addressed, there's still very little that we do about it, and we mostly focus on the therapy part of it, the pharmaceutical intervention part of it. So yes, I think that's very important. Also, the I mean, all of us see it in our clinical practice on a daily basis. The number of people who look for support, for psychological support, for therapists is tremendous. There is so much of requirement and ask for it, but solutions still are not enough. So yes, and that's one thing. Also, another thing about mental health, because we tend to put mental health and physical health in two different brackets, and we tend to sort of disassociate each other, whereas the truth is that in terms of your bioregulatory systems, in terms of physiology or a pathophysiology, the origin of both is the same, and both are interconnected to each other. So whether we're looking at the psychosomatic influence, whether you're looking at micronutrient deficiencies, whether you're looking at gut inflammation or systemic inflammation, all of it is leading to both forms of conditions. So I think it's very important for not only healthcare providers, but everybody in healthcare setup and regulatory bodies and everybody else in the landscape to recognize that a person who's going through any form of physical condition or a clinical problem also has associated trauma and mental health conditions, and they have to be simultaneously addressed, and
I'll just have one point. I forgot in the deja vu. I'm sorry. Uh, I think what we are forgetting right now is family. I think family support should be one of the biggest CSR activities we're looking at. So you might be talking about any disease. A patient suffers, but I think the family also suffers along with it. And there are very few CSR activities which are revolving around taking care of the family. So I think that is a part which is important.
Yeah, I'd like to finish this. I'd like Dr. Desai to add
Thanks.
something on the family bit that
Right.
Dr. Avasthi mentioned.
Right. I agree. I agree with Dr. Vibhor completely, and Dr. Ratna and I do, I think, too. There is amongst a whole lot of pluses and minuses of different countries and cultures, what Afro-Asia, as I keep referring to, and South Asia in particular, has a huge strength is however worse off we are in terms of family systems as compared to 40 or 50 years ago, we are still a lot better than a whole lot of other countries. And so we need to capitalize on not just curative health and rehabilitative health, but preventive and promotive health at the level of family. But that reminds me of something, if Dr. Angarada doesn't mind my picking on that one idea. And it's a concern, it's a challenge as I see. I also see hopefully we will do it. What she described so well about how we handled the epidemic beautifully, I have only one concern. See, most of us or all of us will remember the great Indian wedding. Till last minute, everything is a mess. In that last few hours, everything falls into place. So we are very good in crisis management. And we did that in the epidemic. I'm not too sure. My concern is how much we will be able to sustain that on an enduring basis for health systems. That's my concern. But the other thing occurred to me, as Vibhor was saying, I'm not one of those five-star NGO or physician guys, as you might realize. But the buzzword, if it has not come up since the morning, is intersectionality. Some years ago, we used to talk about intersectoral approach. Then it changed to intersectionality. Whatever be the not so hidden cynicism about newer terms, but yes, intersectionality makes sense, especially in the light of what people have said. Physical and mental health comorbidity. If I might again, Manjri, pick on one of the things that you said, not just between physical and mental health. My mom in Ahmedabad at 90 has had huge orthopedic problems, 3 TKR operations, fracture shaft femur. She also has serious GI problems, serious respiratory issues. So forget mental and physical health overlap, but within physical health itself, a whole lot of issues overlap, and the person or the unit functions as one. Unfortunately, the idea of joint management, even in clinical medicine, is kind of disappeared already. And there, I have only one more concern that I think I wanted to pick on. I want to continue from what Dr. Ratna said. I'm sorry. The whole issue about women and mental health, as she said, seriously, but in a lighter vein, about 60 years ago, early 60s, British researchers found that in UK, British Isles, and all over the world, as far as they could study, depression was 2 or 3 times more common in women as compared to men. Okay, good epidemiological data, not just hospital data. But men, if they are chuckling, don't. Because to me, that's only an indication of the biological hormonal issues and the exploitation that men have done of the other gender for long. And so, will health issues or the gender differences in health issues will also be subject to socio-economic political change? Now, that's a delicate issue. How is CSR ever going to fund that and work with the government? I have no idea. That's a challenge. Can we pick up sensitive issues and work on them?
Yeah, thank you, Dr. Desai. Thank you. Though everybody does want to say more, and maybe in the next forum, because I have constant, requests from the organizers. Yeah, yeah. We've left it for you, Dr. Pandey.
Hello.
Yes.
Sorry, if I can just highlight one key point where I think CSR
I think everybody
can...
does want to say something or the other and not be fair. So maybe next time for sure. But thank you all for joining in. Thank you, Dr. Desai, Dr. Avasthi. Do we have a Q&A?
We'll take questions,
Maybe later.
maybe later on Chai Pe Charcha, but currently we seriously have positive of time because, our chief guest is supposed to arrive at 4
Yeah,
p.m.
but
So we
it's
have to close
also
our session before
very
that.
heartening to see that everybody was so involved in the discussion. Thank you all for being a great audience. Thank you to the participants and the panelists. Thank you, Dr. Ankit. I'll leave it
Thank you. Now I would request Dr. Manisha Bobde, CEO, KG Somaya Hospital, Mumbai, to please come forward on stage and provide token of appreciation to our eminent panelist and moderator. Doctor, yeah, you can start from here. She's the moderator. Speakers start. Dr. Azaz Ilmi. Dr. D.S. Ratnadevi, CEO, Dakshama Health and Education. Dr. Nimesh Desai, consultant psychiatrist, therapist, former director IBHAS. Dr. Anuradha Khernar, co-founder and chairperson, W Shakti Foundation. Ms. Garima Mathias, associate director, programs, IPAS Development Foundation. Dr. Vibhor Avasthi, general secretary, Accord. And last but not the least, our moderator, Dr. Manjri Chandra, consultant functional nutritionist, Manjri Wellness. Thank you. Now can we have a group photograph, please? One group photograph, please. Thank you so much. Someone who had question from the audience, our panelists would be here. They can take their questions with them personally. Moving on to next session. Now we have a keynote address on social impact initiatives of Seva Bharati, the largest NGO in the world. I would request Mr. Vikash Namjoshi, Director Rashtriya Seva Bharati, to please come forward to deliver his keynote. May I have Mr. Vikash Namjoshi? Sir.
It's already there. So, good afternoon, everyone. Sabhi ko namaste. I could hear the bell ringing twice in the last session. My time has already been reduced from 15 minutes to 10 minutes, and I'll try and make sure that it doesn't ring in between. So, probably I'll have to wrap up a bit faster, but you all have to bear with me. Yesterday, when I saw the program agenda, against my session, it was mentioned as the largest NGO in the world. This is what people say. We may not be the largest in the world, but for sure we are the biggest in the country, one of the biggest in the country. Also, as the topic goes, says that CSR initiative of Seva Bharati. So, Seva Bharati, which is the organization which works on the ground, and I am representing Rashtriya Seva Bharati, as the name suggests, which is an umbrella organization. So just to clarify that we don't entirely depend on CSR. I know the entire forum is for the CSR initiatives and all that, because जैसे बोलते हैं ना, नर सेवा नारायण सेवा, सेवा परमो dharma. So we have that there. We believe in that philosophy. So, but yes, of course, we do need a lot of CSR funds for various initiatives. So we do take use of that also. So rather, I would use this opportunity to introduce all of you to who we are, because some of you may not know about Seva Bharati. So as I mentioned, Rashtriya Seva Bharati is an umbrella organization. And we have close to 1,000 plus affiliated organizations present all across the country. With the help of those organizations, we conduct close to 31,000 is what the number is written here, in the various domains like education, health, self-reliance, and social. I had to run through quickly, so I'm not reading the whole thing. That's our vision. And our mission is to provide all our affiliate organizations and its representative a national level platform uh, while fostering a sense of community and capacity building. We do this through the 4 activities or the 4 dimensions or the IAM, what we call it as of Rashtriya Seva Bharati, which is Jagran, Sahyog, Prashikshan, and Adhyan. That is awareness, cooperation, training, and research. Few of the activities what we conduct against under all these initiatives are mentioned here. But to mention a few, we do conduct a survey every 5 years, and which we formally publish in the form of a magazine called Seva Disha. Some of you who might have gone through our stall there, it's kept even there also, which gives us a direction that where the Seva should lead to, what we have achieved in the past, and where we need to tweak to ultimately get the result what for which we are working. Similarly, every 5 years, Rashtriya Seva Bharati conducts Rashtriya Seva Sangam, wherein we call all the affiliated 1,000 plus organization. It's typically a 3-day program wherein there is a cross learning and we learn from the experience of each other. And then we have Sahyog, Prashikshan, and research. I'll have to quickly go through skip this slide rather. Now to tell you the number, the impact what we create. So if you see the number of beneficiaries from our regular Seva project, so we do conduct a lot of Seva projects. All those projects which runs either on a daily basis or at the max on a weekly basis, we call them as a regular Seva projects. That number is close to 17 million. So around 1.7 crore हमारे ऐसे प्रकल्प चलते हैं. And similarly, apart from this, the beneficiaries from hospitals, small hospitals, OPD, mobile dispensary, medicine center, mobile lab, etc., that adds to around 3 million more. And then there are something which we do, these activities, which typically happens either on a monthly basis or a fortnightly basis, but not on a regular basis. That adds to another 1.8 million. So put together, we have more than 2 crore plus beneficiary in the country. As I mentioned, Rashtriya Seva Bharati works through our affiliated and the Pran Pratinidhi Sanstha. So like Rashtriya Seva Bharati is an umbrella organization, but all the state units are Seva Bharati. You might have heard the name Delhi Seva Bharati, or there is Jaipur Seva Bharati, or Telangana Seva Bharati. So likewise, we have the presence all across the country, but Rashtriya Seva Bharati is an umbrella organization of that. So those organizations which works on the ground work under 4 domains, which is education, health, social, and self-reliance. These are the projects what we undertake under all these initiatives. So I'll not go through the number, but let me just dwell more upon the health. So this number is around 7,000 plus, 7,300. And in the health sector, what we do is there are some 19 categories of activities which we do on the ground, ranging from Arogya Mitra or Swasth Mitra to a full-fledged hospital. Now, let me just give some insight on the various activities what we do, wherein we also do fetch some CSR. So it's not that we are totally independent of running our organization through CSR. But our focus is always on the individual donor, because राष्ट्रीय सेवा भारती या सेवा भारती इस उद्देश्य से काम करती है कि जो समाज की आवश्यकता है उसके लिए समाज के सहयोग से ही काम करना. अब वो इंडिविजुअल डोनर हो, वो जो चैरिटेबल ट्रस्ट हैं या जो फिलैंथ्रोपिक फाउंडेशन है, वो भी हमें मदद करते हैं. और ऑफ कोर्स जैसे मैंने बोला, जो कैपिटल इंटेंसिव प्रोजेक्ट्स हैं उसमें सीएसआर की भी मदद लगती है. तो ऐसा नहीं है कि हम सीएसआर लेते नहीं या नहीं लेना चाहते, बट हमारा हमेशा जो फोकस रहता है वो ये रहता है कि चूंकि सीएसआर अवेलेबल है तो हम कोई प्रोजेक्ट खड़ा करें, हम उस फिलॉसफी पे काम नहीं करते. जहां समाज की आवश्यकता है वहां हम काम खड़ा करते हैं, समाज उसके लिए हमें सहयोग करता है, और फिर हमें जहां जरूरत होती है वहां हम सीएसआर का भी सपोर्ट लेते हैं. तो ये कुछ एक्टिविटीज हैं, 18-19 एक्टिविटी तो some of the big activities I'll just mention quickly. एक हमारी एक्टिविटी है ग्रामीण आरोग्य रक्षक और मित्रा. If you see the numbers, so close to 4,500 this arogya rakshak. These are basically health representative. And if you see the span, we work almost in 30 plants, including tribal areas and the remotest of the villages in the part of Northeast, Gujarat, Maharashtra, and all other. So these volunteers go to those villages and then help them guide about their health and well-being. We have now already associated one of the company who is providing a CSR for us. This Arogya Rakshak we will use for the Suposhit Bharat campaign, which I'll just mention in the subsequent slide, wherein the agency will conduct the testing, the diagnostic test, and Rashtriya Seva Bharati or our ground organization Seva Bharati will provide the volunteers for the distribution of that medical kit or the this medicine and the kit, and also subsequent follow-up for that Suposhit Bharat program. These are another activities like medical center, we run therapy center, we do have blood banks. There are close to 125 ambulances running in various parts of the country. And we do have diagnostic center. Let me just tell something about diagnostic centers. So we have around 24 diagnostic center present. The one which is in the picture is in Delhi, is in Ashok Vihar. We do conduct all the advanced tests like CT scan, MRI, ultrasound, DEXA scan, and all that. And the good thing is these labs, this is a state-of-the-art facility with NEBL approval and all that, and we charge only 50% of the rate which is prevailing in the market. And I'm happy to share that Sudeep ji and Puneet ji, they had supported us for this particular initiative when this center was set up through their CSR. These are another set of activities like leprosy patient service, eye bank, de-addiction center and all that. And also you see on the top left-hand corner is the hospital. So as I had mentioned, we are from Arogya Mitra to full-fledged hospitals. We run around 36 hospitals all across the country. 2 are in tribal area, 8 are in urban slum area. Around 3 of them have the bed capacity of more than say 75 and up to 150. The one is in Gwalior, another one is in Nellore, Andhra, and the one is in Latur, Maharashtra. Similarly, 2 of our hospitals are more than 500 bedded. The one which is shown in the picture is Dr. Hedgewar Rugnalaya in Sambhajinagar, Aurangabad, and another one is in Kanpur. So this shows the quantum, the magnitude of our work in the entire country. And of course, these kind of big projects, we do take help of the corporate through CSR, because this kind of project typically the expense goes in the maybe 400 crores. So these were all supported by various either PSUs or the corporate sector for building these hospitals. Another campaign which Rashtriya Seva Bharati runs every year. So typically every September month of the year is celebrated as the Suposhan Mah by Rashtriya Seva Bharati. As we all know, malnutrition is still the biggest problem in India. So last year, this was the Suposhan Jagruk Abhiyan poster. This was released by Param Pujaniya Sarsanga Jalak ji. And this year, we had the opportunity to have Honorable Health Minister on the 31st of August, wherein he had released this poster, Mr. J.P. Nadda ji. Under Suposhit Bharat Abhiyan, these are the various activities which we conduct. Oh, I'm sorry, I moved ahead. I'll just take a couple of minutes, that's it. These are few more activities which we conduct under Suposhit Bharat Abhiyan. This is currently run in 13 plants, covering 290 districts and 1180 Seva Basti where we work. We do conduct training under the Suposhat Bharat Abhiyan. These are some of the pictures of the training which was conducted last year. And we do take initiative of healthcare during Abda. So be it natural calamity or man-made disaster, Rashtriya Seva Bharati is always the first one to reach and help. Generally, sometimes ahead of the government or the non-government organizations. So these are few of the activities which we had conducted as a part of the Abda Prabandhan. Before I say thank you, I would definitely urge and request all the distinguished guests who are present out here. As I said, though we are not dependent on CSR, but for making it even bigger and to create more impact in the society, we do need help and support from who are present out here. So I would request everyone to, so in whatever kind you can help us, our organization, that would be great. Thank you so much.
Thank you. Now I would request Dr. Nimesh Desai, sir, please come forward to provide token of appreciation to our speaker. Thank you. Moving on to our next session, which is on synchronizing efforts, aligning CSR with national health goals. Moderator for the session, Dr. Navneet Anand, founder and director, Grey Matters Communications and Consulting. Dr. Navneet, if you can please join us on stage. Panelists for the session are Dr. Zoya Ali Rizvi, Deputy Commissioner, Ministry of Health and Family Welfare, Government of India. Dr. Zoya Ali Rizvi, ma'am, if you can please join us on stage. Dr. Urvashi Prasad, former Director, Office of Vice Chairman, Niti Aayog, Government of India. Dr. Urvashi, if some of my team members here, can you please ask Dr. Urvashi to join? She is just outside the hall. Dr. Puneet Yadav, MD, Hospital Administration, IHMR. Mr. Bikram Upadhyay, Senior Journalist. Mr. A. Natarajan, former Director, Passport and Visa, Ministry of External Affairs. Request you to please take seats as per your photographs. Thank you. Yeah, she's just coming over to you.
Thank you. Good afternoon, and I am sure all of us know that we are running late. We are behind the schedule, and therefore, in the interest of time, I'll try and make this conversation as precise, as short as possible. There is an abundance of doctor, and perhaps I'm the only non-doctor doctor in this room, which is I'm a PhD wala doctor, not that doctor in true sense of the term. Welcome, and we have a very distinguished panelist today, as you can all see, and without, I think, I thank Swadeep Srivastava for getting this top minds of the country for this discussion today, covering a range of topics. And this one is especially very relevant, synchronizing efforts, aligning CSR with national health goals. And, being a moderator, I'll only do that, not share my own perspective, but I think this is something, yeah. Dr. Urvashi Prasad. All right, so we'll begin the discussion straight away. My request to the panel is that we are running very late, and therefore there is, because Honorable Chief Guest is on his way and arriving anytime soon. So I'll begin with you, Dr. Rizvi, about your initial remarks, and then perhaps I'll ask maybe one question.
How long do the remarks have to be?
1 minute.
Okay, great. So I think I'll try and keep it crisp. Thank you for having us, because being a person from government, we do realize that most of the programs which the government implements is at scale. So CSR for the government, the introduction I'm just saying, is to help where the government cannot reach. So we do have a whole structure for implementing our health programs, whether it is for adolescent, maternal, child, nutrition, anything. We have a structure, but CSR is where they can plug in the gaps. So I will just stop here, because that is where CSR will have a role, because at scale implementation is already taking place. But CSR can plug in the gaps and then help strengthen and saturate the programs.
Excellent. Dr. Rizvi, जैसा हम लोग सुनते आ रहे हैं, bureaucrats speak less, those in the government speak, and to the point, that was very precise. Thank you so much. But you're also in a position where you can see that how our CSR programs, because it has become fashionable to do CSR without perhaps all the time thinking. And health is something that certainly needs the highest of priorities. All of us agree on that. India, as it is growing, the Viksit Bharat dream can only become true if their health remains the priority. So, any thoughts on that before I move to the next?
Just quickly saying, because what was discussed was that India is a very young country. So for that, if you just quickly say, if you look at the population projections जो हमारे रहे हैं, तो 1950 में average age इंडिया की 21 साल थी, और 2024 में 28 साल हो गई है, और वो 2050 में जाके 37 साल हो जाएगी. तो we're not getting any younger. So any interventions which we have to do for young people have to be done right now, so that these young peoples are healthy now, they end up being healthy adults, and they're healthy and aware adults, so that the next generation which comes, when it comes, also is aware and healthy.
Dr. Prasad, you have been there, I think, where many aspire to be, and you would sure have got that macro perspective. What are your thoughts, when it comes to aligning the CSR goals with the national health priorities? What has been the success or lack of it so far in your views, ma'am?
Thank you. So again, I'll go very quickly. So I think success in a number of programs we've seen actually. So like the aspirational districts program, and now the aspirational blocks program, which has been launched recently. So of course, we'll see how that pans out, but that's along a very similar model of ADP. So I think there we saw a lot of successful collaborations between the local government, CSR, NGOs, and that's really how we can move the needle, I think, on health parameters, because generally it's very complicated and challenging. I think in terms of what we can do and what we can do better is the sustainability aspect, because you said sometimes, like you said, sometimes it can be just, we announce an initiative because it's fashionable, and then the next year we stop funding it, we move on to something else. And that is a challenge, because the fact is that when it comes to basic fundamental health issues, you need it all the time. You can't do it one year and stop the next. So I think if the CSR initiatives can be more sustainable as well, we don't always have to look for something fashionable or something unique. It could be something very basic. It could be just funding some critical equipment, in a health and wellness center or in a district hospital or whatever it is. But if you're doing it over a period of time, I think that is where the real value lies.
Uh, I totally agree, and even if incremental, but if it adds value and sustains a program, I think nothing like it. Mr. Vishal Chauhan, I think I'm sure you have had the opportunity. Actually, he's not here. Okay, Dr. Yadav, you are an administrator. You are
I'm
MD.
currently a teacher. I'm with IHMR.
IHMR. And what is your view on how companies or PSUs or corporates should focus on CSR as a powerful tool to bring about that change that is needed vis-a-vis the health sector?
So my perspective is on three domains. The first part is, while many companies are willing to come forward, but they don't know where to get into the system, I'd say, and whom to approach. So that's the first part. The primary ownership of our national health programs is with the government of India. So, and it's largely, a lot of them are actually run by the state governments. So I'm looking at actually a mapping industry and a public-private partnership, a connect between the government, where the government can actually map out where are the resources actually required, and the industry can thereafter can pitch into that particular domain. Now there are two aspects to it. One is, as my co-panelists have already brought out, one is the short term, where short-term projects like infrastructure building for health and wellness centers and such opportunities, equipping. The second is slightly longer term program, where you are providing resources, training, to the healthcare staff, maybe augmenting the health and wellness centers or such initiatives itself. And so that's the operational part which is there. And one very important element is, I also feel, is implementation research, wherein a lot of these outcomes which are coming out from these health initiatives itself, either the industry along with educational institutions can get into the parameter of wherein implementation research is funded, and where we are able to get better outcomes and we are able to align our programs in a much better fashion. So that's my perspective.
Thank you. That brings me to out of curiosity, Dr. Rizvi, uh, has there been some efforts to perhaps create clusters and bring together PSUs and corporates to address, health priority, or invest in a CSR that it is more coordinated? Having been a journalist myself and having worked also with corporates, I see that most of these are very sporadic, without any coordination either with the government priorities. And so, just out of curiosity and for the benefit of my audience, if you
I think that's a very good question, because what government has also said, in fact, recently you may be aware there was a CSR conclave which was supported by the Department of Public Enterprises, which had discussed with the Ministry of Health what are the priorities of the ministry, and those priorities were showcased and discussed with the various CSR activities of the PSUs which are there. Within that, I think a few examples was sickle cell disease was there, management of tuberculosis, management of anemia, management of rare diseases, where government needs help. So those things were actually showcased. I think government is going about the whole issue of using CSR funds in a kind of scientific and systematic manner. So that, I think, that step has taken place, and what the priorities of government for reaching certain goals, like Urvashi mentioned about aspirational district or aspiration blocks, those coordination with CSR are there. And for these other diseases, like I mentioned, which are in the mission mode, whether it is sickle cell disease mission is there, tuberculosis is there, rare diseases for our country is there, which are really, which need large amount of funds at one time. So that also CSR cooperation. So I think we are going about it in a quite a decent and scientific manner.
and you need a better communicator in Swadeep Srivastava to perhaps take it and amplify it better. Uh, Mr. Natarajan, there is swapping of seat. You were supposed to sit, but uh, sir, you have seen a different facet of this all. Having been a director in Ministry of External Affairs, what is your perspective when it comes to global health? Having dealt with some of these priorities in your tenure over a period of time.
सबको मेरा नमस्कार। मैं मेडिकल सर्विस से नहीं हूँ, फिर भी अगर फॉरेन पॉलिसी बारे में पूछेगा तो
इसीलिए मैंने ग्लोबल हेल्थ के बारे में पूछा, बिकॉज
लेकिन मैं कई देशों में सर्विस किया है, इंक्लूडिंग इन चाइना, इंडोनेशिया, नेबरिंग कंट्रीज, और यूरोप में भी मैंने सर्विस किया है। मैंने यही देखा है कि मेरा पर्सनल एक्सपीरियंस भी है, सो अगर ज़रूरत पड़ेगा तो मैं बाद में बताऊंगा। लेकिन ऑल इज़ वेल, ईस्ट और वेस्ट, होम इज़ बेस्ट। मैंने हेल्थ में भी यही देखा कि पर्सनल हेल्थ प्रॉब्लम ही जब विदेश में हम फेस करते हैं, डॉक्टर के पास वहाँ जाते हैं। उदाहरण, चाइना में मेरा वाइफ का साइनस प्रॉब्लम हुआ था, सीरियस प्रॉब्लम। उनका ट्रीटमेंट वहाँ हो नहीं पाए। The local doctors, Chinese doctors, could not diagnose at all. So they made the case from bad to worse. So finally, I had to bring my wife back home to India to take further treatment. यहाँ इंडिया में आने के बाद ही उनका ठीक हुआ है। सो यहाँ जब मैं दिल्ली में ट्रीटमेंट कर रहे थे एम्स में, जब आया तो एम्स में डॉक्टर ने पूछा, भाई पहले आप कहाँ ट्रीटमेंट ले रहे थे? जब मैंने सब पेपर वगैरह दिखाया तो वो थोड़ी बहुत सरकास्टिकली ही वाज स्माइलिंग और बता रहे हैं, भाई चाइना के बारे में तो आपको पता है। सो हम इतना बोलते हैं, चाइना इतना आगे बढ़ गया, ये वो सारा दुनिया भी बोलते हैं, लेकिन अभी भी अगर आप चाइना जाएंगे, यूरोप में भी यही हाल है। सो in my perception, whatever we are having the facilities in health sector, I think we are one of the best in the world. That's what I would say. Thank you.
Thank you. Vikramji, of course, you have been a journalist and have covered and written and seen. As an observer, what has been your understanding of the way CSR projects are being delivered on the last mile? Do you find that many of these are replicated, equally effectively in other markets, other regions? What could be done to make it more sustainable? And Dr. Urvashi Prasad was referring to.
मैं जर्नलिस्ट हूँ तो कुछ नंबर्स पे बात करूँगा तो जल्दी चीज़ें ख़त्म कर दूँगा मैं। मैंने जो तीनों जो नेशनल पॉलिसी फॉर हेल्थ देखा उसमें सबका एक कॉमन गोल था कि सबके पास हेल्थ का एक्सेस होना चाहिए। और आपको लगेगा डॉक्टर नहीं हूँ बट फिर भी लगता है कि जो प्राइमरी हेल्थ सेंटर्स वो हमारे जो है मेजर फोकस के केंद्र होनी चाहिए। और अभी हमने देखा था पार्लियामेंट क्वेश्चंस आया था कि आउट ऑफ 30,000 प्राइमरी हेल्थ सेंटर्स में केवल 50% से कम ऐसे सेंटर्स हैं जो 24 घंटे चलते हैं, अदरवाइज जो है वो थोड़े समय के लिए खुलते हैं और चलते हैं। अभी हमने देखा जो एक्सपेंडिंग है ना, हेल्थ स्पेंडिंग जो गवर्नमेंट का हमारे यहाँ 2% के जीडीपी से भी कम है, जबकि हम देखते हैं कि ग्लोबल बजट में बहुत सारे कंट्रीज मिला के देखें ग्लोबल बजट का 9.8% जो है ना तक जो है पैसे हेल्थ सेक्टर्स में एक्सपेंडिचर्स होता है। अभी की बता रहा था कि 4 लाख से हमारा 7 लाख जो है वो CSR फंड्स होने वाले हैं, बट कहाँ 4 लाख 7 लाख के फंड से कुछ होना नहीं है इस देश में। बट फिर भी मैं मानता हूँ कि अगर कॉरपोरेट अपनी रिस्पॉन्सिबिलिटी समझते हैं और CSR फंड्स ठीक से एलोकेट होता है तो वही जो है रामायण में जो गिलहरी का रोल था वो CSR का भी रोल हो सकता है। अदरवाइज जो है हेल्थ स्पेंडिंग बहुत होना है। और हमने देखा, ये अभी पढ़ रहा था मैं, केरल ही एक ऐसा मात्र स्टेट है हिंदुस्तान में जहाँ पर व्यक्ति जो है ज़्यादा दवा में एक्सपेंड करता है। अदरवाइज आप जम्मू कश्मीर देख लें, नॉर्थ ईस्ट देख लें, बहुत ही लिस्ट लोगों के पास दवा की पहुँच है। मैंने देखा है CSR में बहुत सारे हमने कंपनीज को देखा है, कुछ हमने पब्लिकेशंस को भी देखा, उन्होंने खुद का अपना एक फाउंडेशन बना लिया और वो अपने हिसाब से काम करते हैं, वो फंड अपने हिसाब से इस्तेमाल करते हैं। यानी उनका जो एक मैंडेटरी है गवर्नमेंट की तरफ से कि वो पैसा खर्च करना है, तो ज़रूरी नहीं है कि सोशल कॉज पे या इस हेल्थ सेक्टर्स में करें, वो अपने हिसाब से करते हैं। तो मुझे लगता है अभी जो लोग बता रहे हैं, जो गवर्नमेंट का मैंडेट है कि हेल्थ सेक्टर्स में पैसा जाना चाहिए, वो अगर इक्विटी लानी है, सबको बराबर मिलना है हेल्थ सर्विसेज, तो इसमें भी बहुत आगे जाना है। और इसके लिए जो है हमारा जो है CSR फंड प्रॉपर्ली एलोकेट हो और उसका ठीक से मॉनिटरिंग हो तो इसका रिजल्ट आ सकता है। थैंक यू।
धन्यवाद। डॉक्टर यादव, ये केवल पैसे की बात है या कहीं एडमिनिस्ट्रेशन की भी बात है?
I think it's a combination of both factors. Like जैसे अगर आप देखेंगे कि there are some states which have got a health denominators which are much less than what the other states are. Other states are, so it is both. It is because some states have got better trained personnel, and at the same time they're using it in a much more cost efficient and cost effective manner than the other states. The issue is about capacity building for states which are catching up. They are all catching up, and there are a lot of initiatives which are actually happening in these particular states, like those aspirational districts program and all that. So I would look at it in a very positive framework as we go ahead in this thing. But definitely there is an opportunity for CSR and for the industry to be a part of this national building initiatives.
And one last question to Dr. Prasad. Do you think, how do you can you give us some insight on the way Niti Aayog functions and the way the policies are being framed, whatever within permissible limits, whatever you can, so that there is some clarity as I go back and I tell my corporate friends, what should be your goal and how should you be looking at CSR?
I mean, you asked me a question I can write a book on, but okay. So how Niti Aayog functions, very briefly, it's a policy think tank. So the idea is to work with all the central ministries as well as very importantly with states in India to basically improve the functioning of their programs, to provide fresh thinking, fresh inputs, the best of research that is available domestically and internationally, and channel that into the policy making process. And of course we also engage with a lot of external stakeholders, so whether it's private sector, civil society and others. So that in a nutshell, I would say that, that is the role of the institution. And I think a lot of the work currently and going forward is going to be at the state level, helping states prepare their plans for 2047. Because as you know that, of course, we've also been working on an overall Viksit Bharat 2047 plan for the country, but we're also taking that to every state, because obviously every state needs to have its own unique roadmap if we are to achieve those goals. So I think a lot of the work currently and also going forward is going to be in that direction.
Excellent. And as you always, the ministry has the last say, and why it should be different here.
No, I totally echo what Urvashi mentioned about state being the center of all action. That is what I would request the CSR also, because states should be able, because you can't have an intervention which fits all the states, because there's no one size will not fit all. So intervention should always be discussed with the states. Whenever any CSR intervention is being planned, please do take the state governments on board, explain to them so that they are fully owning whatever intervention is going to take place, whatever you're planning to spend the money on, because that is where the action takes place, that is where the effect will take place. And like Urvashi mentioned, we are looking at Viksit Bharat 2047. So the vision of states is very critical right here, right now.
Thank you. That was short, sweet, and exciting. And my compliments to Swadeep Srivastava and team for this brilliant gathering and very meaningful discourse. I'm expediting it so that you can have your tea in peace before the Honorable Minister comes in. Thank you all very much for being patiently listening to us.
That was really, really, I would say, well time framed session, I would say. So now I would request our AI partner, Health Presso CEO, Mr. Dilip Manhas, co-founder and CEO, to please come forward on stage and provide token of appreciation to our speakers and moderator, please. Mr. Vikram Upadhyay, senior journalist. Mr. A. Natarajan, former Director, Passport and Visa, Minister of External Affairs. Dr. Puneet Yadav, MD, Hospital Administration, IHMR. Dr. Urvashi Prasad, former Director, Office of Vice Chairman, Niti Aayog, Government of India. Dr. Zoya Ali Rizvi, Deputy Commissioner, Ministry of Health and Family Welfare, Government of India. And last but not the least, Dr. Navneet Anand, Founder and Director, Grey Matters, Communications and Consulting. I request all panelists for a group photograph. Dilip, you please join. Yes. Thank you. Now we move on to our last session of the day, and post that we will be starting with our award function. As I have been apprised by the minister's office that minister would be here by 4:30. So we will try to wrap the last session by 4:30. For the last session, Fueling Champions, Nutrition, Preparation, and the Boscia Journey of Paralympic Athletes, I would request Mr. Jasprit Singh Dhaliwal, President Boscia, to come on stage, who would be moderating the session. Mr. Dhaliwal. The panelists for the session are Mr. Ashok Bedi, Chairman Boscia, Mr. Shaminder Singh Dhillon, Secretary General Boscia, Dr. Ravinder Singh, Scientist D, ICMR Advisory Board Member, BSFI, Mr. Ramandeep Singh, Head Classifier Boscia, Mr. Sachin Chamria, Player BC3 Male, Ms. Anjali Devi, Player Boscia 3 Female. If I can have all the panelists on stage, please. In this session, we have two players with us who has defied all odds to to bring glory to India, Mr. Sachin Chamria and Miss Anjali Devi. So the session would be taken place just below the stage. So request you all to support this. Okay.
Hello. Hello. गुड गुड आफ्टरनून टू ऑल। सबसे पहले मैं हील फाउंडेशन का धन्यवाद करता हूं जिन्होंने आज
I'll request the moderator to speak in Hindi because our most of the players they are more comfortable in Hindi because they come from the very rural and remote areas. जिसमें जी हिंदी में ही करना बात।
थैंक यू। सबसे पहले तो मैं हील फाउंडेशन का धन्यवाद करना चाहता हूं कि जिन्होंने आज हमारे जो बच्चे इंटरनेशनल स्टैंडर्ड पे मेडल जीत के आए हैं उनको आज फैसिलिटेशन सेरेमनी उनके लिए ऑर्गेनाइज किया है और साथ में जितने यहाँ पे ऑफिशियल्स आए हैं उनका भी धन्यवाद करना चाहता हूँ और सबको बधाई देना चाहता हूँ कि जो पैरालंपिक्स में अभी हमारे बच्चे कर रहे हैं, जो हमारे पैरा एथलीट्स कर रहे हैं, अभी टोटल 24 मेडल्स आ चुके हैं इंडिया के, तो वो काबिले तारीफ है और वी आर ऑल्सो पार्ट ऑफ दैट मूवमेंट। हमारे बच्चे भी उसी मूवमेंट का पार्ट है और जो बॉचिया गेम है वो पैरालंपिक स्पोर्ट्स में है, जो 22 पैरालंपिक स्पोर्ट्स हैं उसमें से एक बॉचिया है। और जो आज का सेशन है वो अबाउट द जर्नी ऑफ बॉचिया इंडिया, हमारे प्लेयर्स का सफ़र, उन्होंने हमने जो बॉचिया का ऑर्गेनाइजेशन 2016 में स्टार्ट किया था, उस टाइम से लेके अभी तक हमारा ऑर्गेनाइजेशन जर्नी और हमारे बच्चों का जर्नी हम आपके साथ शेयर करेंगे, और हम कोशिश करेंगे कि ज़्यादा से ज़्यादा जो यहाँ पे ऑफिशियल्स आए हैं हम उनको बता सकें कि बॉशिया क्या है। क्योंकि मेरे हिसाब से जितने ऑफिशियल्स आए हैं, कोई हैंड रेज कर सकता है कि हमें बॉशिया के बारे में पता है? किसी को बॉशिया के बारे में पता है, जो एक पैरालंपिक स्पोर्ट्स है और 1984 से पैरालंपिक्स में भी खेला जाता है? नो। तो ये हमारे लिए एक मतलब अच्छी बात नहीं है, हम इस सोसाइटी का हिस्सा हैं और हमारे एथलीट्स अभी पैरालंपिक्स में मेडल ला रहे हैं, तो कुछ लोग ऐसे होंगे कि उन्होंने अभी उनको देखा है और अभी वो सर्च कर रहे हैं कि ये बच्चे भी खेल सकते हैं। तो हमारा जो मेन टारगेट है वो यही है कि हम ज़्यादा से ज़्यादा लोगों को अवेयर कर सकें, और जो उनके रिलेटिव्स हैं, उनके फ्रेंड सर्कल में हैं, जो बच्चे घरों में बैठे हुए हैं, वो भी आके परफॉर्म कर सकें और अपने फैमिली का, अपनी स्टेट का और अपनी कंट्री का नाम रोशन कर सकें। तो बॉचिया का हम आपको एक इंट्रोडक्टरी वीडियो दिखाने जा रहे हैं। जो इंट्रोडक्टरी वीडियो है वो टोक्यो पैरालंपिक गेम्स की जो लोकल ऑर्गेनाइजिंग कमेटी है उनकी साइड से बनाया गया था। प्लीज वीडियो नंबर 1। वॉल्यूम। आई थिंक सो वॉल्यूम नहीं आ रहा है, तो जैसे आप बच्चों को खेलते देख रहे हैं, इट्स दिस वीडियो फ्रॉम द रियो पैरालंपिक्स जो 2016 में रियो में पैरालंपिक्स हुई थी। तो ये इंटरनेशनल स्टैंडर्ड पे हमारा बॉचिया का गेम है जो बॉल से खेला जाता है, और बहुत ही ज़्यादा जो सिवियर डिसेबिलिटी है वो बच्चे बॉचिया को खेलते हैं। पैरालंपिक्स में टोटल 22 गेम्स हैं, उसमें से एक बॉचिया है। ये हमारा कोर्ट है, इट्स सिमिलर टू बैडमिंटन कोर्ट। जो व्हाइट बॉल है इसे टारगेट बॉल फॉर बोथ एथलीट्स, जो दोनों प्लेयर है उनके लिए टारगेट बॉल है ब्लू और रेड के लिए, और जिसका बॉल नियरेस्ट टू व्हाइट बॉल होता है ब्लू का या रेड का, उसको स्कोरिंग दिया जाता है, पॉइंट दिए जाते हैं। बाकी अभी हम डिस्कशन करेंगे तो उसमें बच्चे अपना एक्सपीरियंस शेयर करेंगे, हमारे जो पैनलिस्ट है वो आपको बॉचिया के बारे में बताएंगे। ये जो कैटेगरी है BC3 फॉर द स्फीयर डिसेबिलिटी, जो बच्चे अपने हाथ से बॉल को ग्राउंड में रिलीज नहीं कर पाते हैं तो वो रैंप का यूज करते हैं, असिस्टिव डिवाइस हम उसको बोलते हैं, जैसे मुंह से बॉल को प्ले कर रहे हैं। जो सर बॉल्स हैं इसके बारे में मैं बताना चाहूँगा कि जो बॉल्स हैं ये लेदर की हैं, लेकिन इसमें काफ़ी वैरायटीज़ हैं। सॉफ्ट बॉल, हार्ड बॉल, सॉफ्ट, सुपर सॉफ्ट बॉल, मतलब उसका अलग अलग यूज़ है। जो हार्ड बॉल है वो सामने वाले के टारगेट को साइड पे करने के लिए, जो सॉफ्ट बॉल है वो रिप्लेस करने के लिए। तो इस स्ट्रैटेजी एंड स्किल का गेम है। तो जो आपके सामने हमारे 2 एथलीट्स अभी हैं, बोथ आर इंटरनेशनल प्लेयर एंड मेडलिस्ट फ्रॉम द इंटरनेशनल कॉम्पिटिशंस। अभी सेशन का स्टार्ट करने से पहले मैं हमारे जो डॉक्टर रमन जी हैं, हमारे हेड क्लासीफायर हैं एक्रीडेटेड बाय वर्ल्ड बॉचिया, तो मैं उनसे रिक्वेस्ट करूंगा कि वो थोड़ा आपको जानकारी दें कि जो बच्चे बॉचिया को खेलते हैं वो उनका जो मेडिकली कंडीशन होता है वो किस तरह का होता है, जिससे आप अपने सोसाइटी में जाके बच्चों को अवेयर कर सकें और उनको बता सकें कि आपको घर में रहने की जरूरत नहीं है, आप भी ग्राउंड में जा सकते हैं और खेल सकते हैं अपने लिए और अपने देश के लिए। थैंक यू डॉक्टर रमनदीप जी।
गुड आफ्टरनून एवरीवन। जो अभी बताया गया कि बॉशिया के बारे में, बॉशिया स्पेशली फॉर क्वाड्रिप्लेजिक के लिए है। डिसेबिलिटी भी कई तरह की होती है, जैसे कोई तो मैनुअल व्हीलचेयर यूज कर सकता है, लेकिन जो बॉशिया के मोस्टली प्लेयर हैं वो मैनुअली व्हीलचेयर यूज नहीं कर सकते। उनको जब भी वो व्हीलचेयर यूज करेंगे उनको असिस्टेंट चाहिए होता है, और इलेक्ट्रॉनिक व्हीलचेयर यूजर होते हैं जो बॉशिया प्ले करते हैं। तो बॉशिया इज गेम स्पेशली डिजाइन फॉर क्वाड्रिप्लेजिक। उसमें जो हायर डिसेबिलिटी आ जाती है, जो स्पाइनल कॉर्ड इंजरी हो जाती है, अपर लेवल स्पाइनल कॉर्ड इंजरी हो जाती है, वो ये गेम प्ले करते हैं। जो बायबॉर्न सेरिब्रल पाल्सी होते हैं बच्चे, वो ये गेम प्ले करते हैं। सेरिब्रल पाल्सी भी कई टाइप्स की होती है, जैसे सीवियर स्पास्टिक होता है, तो वो बच्चे बॉशिया प्ले करते हैं। जिनका कंट्रोल नहीं रहता, तब वो अलग इसमें 4 कैटेगरी हैं, BC1, BC2, BC3 और BC4। जो भी बच्चा कोई भी गेम खेलता है उसकी डिसेबिलिटी के अकॉर्डिंग उसको कैटेगरी दी जाती है, जिसमें उसके मसल्स के पावर के अकॉर्डिंग उसको हम डिफरेशिएट करते हैं। कोई BC1 में प्ले करता है, कोई BC2 में, BC3, BC4, 4 कैटेगरी है, डिपेंड अपॉन द डिसेबिलिटी। बट क्या है उसमें, जो चारों कैटेगरी में प्ले करते हैं वो सीवियर डिसेबिलिटी ही होती है। जैसे BC3 कैटेगरी है, वो एक ऐसी कैटेगरी है जो हेड के साथ गेम खेली जाती है। ऐसे आपको कहीं भी कोई भी बच्चे ऐसे मिले जो बाउंड ऑन व्हील चेयर है, आपको लगता है कि वो अनएबल टू डू देयर स्मॉल वर्क, मतलब उनको हर वक्त उनको एक हेल्पर की जरूरत रहती है। अगर आपको ऐसा लगे, आप बॉशिया स्पोर्ट्स फेडरेशन ऑफ इंडिया के साथ कम्युनिकेट कीजिए। जहां पर भी बच्चे अवेलेबल होंगे हम उनकी क्लासिफिकेशन करेंगे, तो आने वाले टाइम में वो किस कैटेगरी में खेल सकते हैं, किस में नहीं खेल सकते। अगर वो बॉशिया के लिए नहीं भी एलिजिबल हैं तो उनको उनकी सपोर्ट करेंगे, उनको एक डायरेक्शन बताएंगे कि पैरालंपिक में आप इस गेम में पार्टिसिपेट कर सकते हो। लेकिन बॉशिया एक ऐसी गेम है जो पैरालंपिक में और बच्चे खेल सकते हैं गेम, जो किसी का वो फिजिकली क्या हम बोल सकते हैं, किसी के मतलब बोल सकते हैंड के मूवमेंट नहीं है, वो लिंपिंग ऑफ लेग्स है, उनके लिए अलग अलग गेम्स बनी है। लेकिन जो ऐसे बच्चे थे, जैसे मस्कुलर डिस्ट्रॉफी है, एक मस्कुलर डिस्ट्रॉफी ऐसी प्रॉब्लम है जिनमें बच्चों का वेट 150 केजी हो जाता है, तो उनके लिए तो ये एक बॉशिया ही ऐसा प्लेटफॉर्म है। तो इस टाइप के बच्चे ये बॉशिया गेम प्ले करते हैं। कोई भी आपको आने वाले टाइम में बच्चे ऐसी कैटेगरी के साथ जो जूझ रहे हो, तो प्लीज आप हमारे साथ कम्युनिकेट कीजिए। हम उनको एक जो प्लेटफॉर्म बॉशिया स्पोर्ट्स फेडरेशन ऑफ इंडिया का है, वहां पर उनको क्लासिफाई करके उनको खेलने का मौका मिल सकता है, और अपने आप को रिप्रेजेंट करने का और इंडिया को रिप्रेजेंट करने का अपॉर्चुनिटी उनके पास मिल सकती है। अगर क्लासिफिकेशन के रिगार्डिंग कौन खेल सकता है, कौन नहीं खेल सकता है, कोई भी क्वेरी हो, तो हम यही आपके पास है, आप हमारे साथ बात बात कर सकते हो, उसके बारे में आप बता सकते हैं। धन्यवाद जी।
थैंक यू रमन जी। जैसे डॉक्टर रमनदीप सिंह जी ने आपको बताया कि जो भी हमारे एथलीट्स हैं, जैसे 22 गेम्स हैं, तो जो बच्चे बॉचिया खेलते हैं वो 21 स्पोर्ट्स नहीं कर सकते हैं। तो उनके लिए एक ही गेम है कि वो बॉचिया में आए और इन्वॉल्व होके वो अपने जीवन में एक गेम को अपनाएं और अपने जीवन को अच्छे से व्यतीत करें। अभी हमारे जो सेक्रेटरी जनरल साहब हैं शिमिंदर सिंह ढिल्लों जी, मैं उनको रिक्वेस्ट करूंगा कि हमारा जो स्पोर्ट्स है वो 2016 में हमने इसको स्टार्ट किया था। तो जैसे बाकी हमारी फेडरेशंस हैं, एज अ प्रेसिडेंट मैं देखता हूँ कि पैरालंपिक कमेटी ऑफ इंडिया है, व्हीलचेयर बास्केटबॉल है और भी नेशनल फेडरेशंस हैं। लेकिन जो ग्रोइंग हमारी है बॉचे इंडिया का है, हमने 2016 से लेके अभी तक जो अचीव किया है, 2 बार हमने एशियन पैरा गेम्स में हमारे बच्चों ने पार्टिसिपेट किया है, हमारे इंटरनेशनल मेडल्स हैं। तो आगे भी जो हमारे इवेंट्स हैं उसके लिए हमारे बच्चे बहुत मेहनत कर रहे हैं कि जो ये फास्ट ग्रोइंग गेम है बॉशिया का इंडिया में, उसका क्या 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 रीजंस हैं और कैसे हम इसको यहाँ तक लेके आए हैं। थैंक यू। शिमेंद्र सिंह।
गुड आफ्टरनून ऑल ऑफ यू। सबसे पहले मैं हील्स फाउंडेशन ने यहाँ आज हमें बुलाया है, मौका दिया है, बॉशिया स्पोर्ट्स फेडरेशन ऑफ इंडिया के सभी हमारे बच्चों को और हमारे पूरे मैनेजमेंट जो आपके सामने बैठे हैं, स्पेशली हमारे चेयरमैन श्री शोक बेदी सर, हमारे फाउंडर और प्रेसिडेंट मिस्टर जसप्रीत सिंह जी धालीवाल, उनके साथ डॉक्टर रविंदर जी आईसीएमआर से, मैम आशु ग्रोवर हैं आईसीएमआर से, डॉक्टर रमनदीप जी हैं, और हमारे 2 रिसेंटली जो मेडलिस्ट हैं गोल्ड मेडल, अंजलि देवी हिमाचल प्रदेश से और सचिन चामड़िया, तो सब लोग आपके सामने बैठे हुए हैं। इन सब लोगों की जो 2016 में, जैसे आज स्टार्टिंग में जसप्रीत जी ने पूछा कि बॉशिया को कोई यहाँ जानता है या नहीं, तो जब 2016 में बॉशिया गेम का नाम हमने सुना, जसप्रीत जी कोरिया में गए, उन्होंने इस गेम के बारे में रीड आउट किया और इंडिया में हमने इस पे वर्क स्टार्ट किया कि ये गेम, बाकी पैरालंपिक्स मूवमेंट चल रहा है लेकिन बॉशिया गेम है जो इंडिया में नहीं है। और डिसेबिलिटी आपके सामने हमारे बच्चे बैठे हुए हैं कि किस लेवल की डिसेबिलिटी उनको है, तो इनके लिए एक नई मिसाल, नई जिंदगी इस गेम की वजह से आई। तो ऐसे हमारे पूरे भारत देश में पता नहीं कितने लोग हैं जो घर में बैठे हुए हैं इस डिसेबिलिटी के, लेकिन बॉशिया गेम आने से इन सबको एक नया प्लेटफॉर्म मिला है। तो इसका ग्रोइंग का रीजन है हमारी पूरी जो टीम आपके सामने बैठी हुई है, स्पेशली हमारे चेयरमैन साहब हैं, क्योंकि 2016 से गेम चल रही थी, बच्चे नेशनल लेवल पे हमारे अवेयरनेस कैंप्स हो रहे थे, हम स्टेट लेवल पे इवेंट्स कंडक्ट कर रहे थे, और इंटरनेशनल सबसे पहले जो इवेंट हमारा दुबई में हम 2017 में खेला था, तो उस टाइम स्टार्टिंग थी हमारी। तो आज बड़े प्राउड के साथ हम कह सकते हैं कि अभी इजिप्ट में हमारा एक इवेंट हुआ है, तो उसमें हमारा 1 नहीं 2 नहीं पूरे 6 मेडल आए हैं। तो वो 6 के 6 बच्चे आज हमारे बीच यहाँ मौजूद हैं। ब्लू टी शर्ट पहनी हुई है, सभी लोग व्हील चेयर पे हैं। व्हील चेयर जैसे डॉक्टर साहब ने बताया कि इनकी डिसेबिलिटी, जैसे अंजलि है, ये कैटेगरी BC3 की है, ये खुद इसकी विदाउट हेड इसका और कोई भी मूवमेंट नहीं पार्ट करता। सेम सचिन है हमारे बीच सरिता बैठी हुई है आपके पीछे। तो इनकी डिसेबिलिटी को देख के एक बार तो कोई भी है इंसान चौंक जाता है कि इस डिसेबिलिटी के होते हुए भी इतना बूस्ट है इन लोगों में, इतना जज्बा है इन लोगों में कि ये इंटरनेशनल लेवल पे पार्टिसिपेट करके मेडल जीते हैं। और सबसे ज्यादा जो कंट्रीब्यूशन मैं हमेशा बोलता हूं, जो हमेशा हमारे साथ और इनके साथ रहता है, इनके एस्कॉर्ट्स और इनके पेरेंट्स, क्योंकि आज ये ब्लू ड्रेस में हमारे साथ जरूर बैठे हैं, लेकिन जो वक्त अपने पेरेंट्स के साथ ये लोग गुजारते हैं, जो पूरा दिन पूरी रात इनकी सपोर्ट करते हैं, सुबह से लेके शाम तक इनको खिलाना सुलाना पिलाना, जो पूरी रिस्पॉन्सिबिलिटी उठाते हैं, हम सबके उनसे सबका धन्यवाद करते हैं और उनके लिए एक जोर से क्लैपिंग भी होनी चाहिए, क्योंकि सबसे ज्यादा जो सपोर्ट रहता है, क्योंकि हम देखते हैं जब ये नेशनल में पार्टिसिपेट करने आते हैं, जब ये इंटरनेशनल हम इनके साथ होते हैं, तो सुबह हम भी इनकी जितने लेवल पे होती है, हमारे कोचेस इनके साथ रहते हैं इनकी सपोर्ट के लिए। तो ये सब लोगों का, मैनेजमेंट का, इन खुद का और इन सब का मिश्रण से ही इकट्ठे होके ये इंटरनेशनल लेवल पे पार्टिसिपेट करते हैं। ये बहुत बड़ी बात है। और ये प्रैक्टिस जो करना है इनका, वो भी बहुत बड़ा एक पार्ट है इनकी लाइफ का और इस गेम का, क्योंकि ज्यादा हमारे पास वो जो इंटरनेशनल स्टैंडर्ड में कोर्ट में हम खेलते हैं बॉशिया, तो वो भी इंडिया में बहुत ज्यादा जगह पे नहीं है। हमारा पहले जो सोलन में हमने ग्राउंड किया, जो IMD, इंडियन एसोसिएशन ऑफ मस्कुलर डिस्ट्रॉफी, जो डॉक्टर रमनदीप जी ने बताया कि बड़ा डिजीज है, जो वो बच्चे इसको खेलते हैं, तो सोलन में हमारा ग्राउंड बना हुआ है सबसे पहले। अभी गवर्नमेंट की ओर से ग्वालियर में सेंट्रल फॉर डिसेबिलिटी स्पोर्ट्स बनाया है, तो वहां भी हमारा कोर्ट है, कर्नाटका में भी है। क्योंकि जब जब हम स्टार्ट किया, ग्रो कर रहे हैं, जैसे जैसे लिंक अप्स हो रहे हैं, लोग हमारी सपोर्ट के लिए आ रहे हैं, तो हम पूरे इंडिया में इसका एक हमारा प्लेटफॉर्म बन चुका है। नियर अबाउट 21 स्टेट्स में हमारे साथ जो स्टेट्स रिकॉग्नाइज्ड हैं, तो स्टेट्स लेवल पे ये इवेंट्स हमारे बच्चे देखते हैं। और लास्ट में मैं बताना चाहता हूँ कि जिनकी सपोर्ट रही है, जैसे बैंक्स की सपोर्ट रही है, जैसे काफ़ी कंपनीज हमें सपोर्ट करते हैं, हमारे चेयरमैन सर उनके कोऑर्डिनेशन में जैसे लिंक अप्स आते हैं, जैसे बैंक्स है, SBI बैंक है, यूनियन बैंक है, PNB बैंक है, पंजाब एंड सिंध बैंक है, और जैसे स्टार सीमेंट जिंदल चामड़िया जी हमारे साथ बैठे हैं, और IDBI बैंक है। ये सब लोगों की सपोर्ट से आज हम यहाँ पहुंचे हैं, यही है। और इसके लिए मैं सबका धन्यवाद करना चाहता हूँ कि आप सब लोग ने हमारे बॉशिया के बारे में जाना। थैंक यू सो मच। थैंक यू सर।
हेलो, थैंक यू सेक्रेटरी साहब। अभी हम हमारे जो चेयरमैन सर हैं, हम जब से जैसे शुमिंदर जी डिस्कस कर रहे थे कि बता रहे थे, जब से चेयरमैन सर हमारे ऑर्गेनाइजेशन के साथ जुड़े हैं, तो हमें हर लेवल पे सपोर्ट मिला है, चाहे वो गवर्नमेंट सेक्टर हो, चाहे स्पॉन्सरशिप हो, CSR हो, बच्चों की ट्रेनिंग हो, इंटरनेशनल कॉम्पिटिशन्स हो। तो हम सर से ही जानना चाहेंगे कि सर आपका हमारे जो ऑर्गेनाइजेशन है बॉचिया इंडिया नेशनल फेडरेशन, उसके साथ आपका सफ़र कैसा रहा सर, प्लीज। थैंक यू।
थैंक यू। नमस्कार। बोसिया एक्चुअली में मैं आपको बता देना चाहता हूँ, शायद मेरे प्रेसिडेंट साहब और सेक्रेटरी जनरल साहब ने नहीं बताया, बोसिया इज नॉट न्यू गेम। बोसिया सबसे पहले ग्रीस में जब ओलंपिक शुरू हुए थे, उसमें शुरू किया गया था। हिंदुस्तान में काफ़ी लेट पहुंचा। एक्चुअली यूरोपियन कंट्री के अंदर सर्दी बहुत पड़ती, ठंड बहुत पड़ती है, वहाँ पे पहले ये लोग खेलते थे, जैसे फौज से रिटायर हो गए। और बोसिया जरूरी हिंदुस्तान से बाहर, बोसिया आम आदमी भी खेल सकता है, एवल भी खेलते हैं, आपको जानकर जानकारी होगी, लेकिन वो ओलंपिक में नहीं माने जाते। ये 22 पैरा ओलंपिक में गेम आते हैं, ये उसका एक पार्ट है। आप सोच रहे होंगे पैरा ओलंपिक पेरिस में हो रहे हैं, हमारी इंडिया की टीम क्यों नहीं गई। हमारा लास्ट चाइना के बीच में हम गए थे, पैरा ओलंपिक उसमें हुआ था, तो हमारी जो सी पोजीशन थी वो वहाँ पे अंडर 10th नहीं थी, बाद में नंबर पे थी। जब हिंदुस्तान में खेलना शुरू किया तो हमारी उस टाइम आई थिंक सो 27th पोजीशन थी, जो आज 10th के ऊपर पहुंच गई है। और फर्स्ट टाइम 75 इयर्स इंडिपेंडेंट के बाद हमारे प्लेयरों ने जज्बात दिखाते हुए इजिप्ट वर्ल्ड कप बोसिया में 6 मेडल जीते हैं, जिसमें ये सारे हैं। जहाँ तक सफ़र का सवाल है, मैं इंडियन पैरा ओलंपिक कमेटी में सेक्रेटरी था, वहीं पे मुझको जिम्मेदारी सौंपी गई थी कि आप बोसिया को देखिए। हर एक जगह फाइनेंशियली प्रॉब्लम तो होती है। प्रेसिडेंट और सेक्रेटरी जनरल का मैं बहुत शुक्र अदा करता हूं कि इतने हालात ख़राब थे कि एक तो गेम, दूसरे इसके जो से इंस्ट्रूमेंट हैं, बॉल, रैंप और इनकी किट और व्हील चेयर, वो इतनी महंगी है कि रूरल एरिया में आम प्लेयर क्या कोई भी अफोर्ड नहीं कर सकता। आने के बाद जब से CSR कंपनियों ने देना शुरू किया, उसके बाद ये प्रोग्रेस शुरू हुई और मेडल आए। उम्मीद करता हूँ आगे अच्छा चलता चले जाएगा। मैं तो इनको शुभकामनाएं दे सकता हूँ और आप लोग हैं इन फ्यूचर में CSR के बारे में जरूर सोचेंगे इन बच्चों के लिए। थैंक यू, धन्यवाद।
थैंक यू सर। जैसे सर बता रहे थे कि जो बॉचिया गेम है इस ओनली फॉर द पैरालंपिक। तो जैसे मैंने आपको फर्स्ट में एक क्वेश्चन किया था कि बॉचिया के बारे में आप जानते हैं। तो जैसे बैडमिंटन है, एथलेटिक्स है, तो हम जब बात करते हैं कि पैरा बैडमिंटन, पैरा एथलेटिक्स, तो हमारे ख्याल में आता है कि थोड़ा बहुत सिमिलर होगा, लेकिन जो बॉचिया है उसका ओलंपिक में काउंटर पार्ट नहीं है। इट्स ओनली फॉर द पैरालंपिक्स। तो ये भी एक अहम मतलब जानकारी है। इसके अलावा अभी मैं रिक्वेस्ट करूंगा सचिन से कि उनका बॉचिया के साथ क्या कैसा सफर रहा, और आफ्टर दी जो इंजरी है पहले उनकी लाइफ कैसी थी, और अभी वो गेम कर रहे हैं, अभी उन्होंने इंटरनेशनल स्टैंडर्ड पे मेडल भी जीता है, तो अभी वो कैसा फील करते हैं और उनका आने वाले टाइम में उनका क्या एम है, क्या करना चाहते हैं बॉचिया में। थैंक यू।
हेलो एवरीवन, गुड इवनिंग। मेरा नाम सचिन चमारिया एंड आई बिलोंग टू दिल्ली. I had my accident in 2008 in Calcutta, and I broke my spinal cord at C4, C5 level. So I'm a quadriplegic. I'm paralyzed below my chest down, and now I'm wheelchair bound for last 16 years almost. सो इंजरी के पहले भी मैं स्पोर्ट्स में काफ़ी एक्टिव था. आई वॉज अ टाइकोंडो प्लेयर एंड आई हैड अ ब्लैक बेल्ट इन टाइकोंडो, एंड मैंने इंडिया को काफ़ी रिप्रेजेंट किया था नेशनल्स एंड इंटरनेशनल टूर्नामेंट में. बट आफ्टर इंजरी ऑब्वियसली टाइकोंडो में खेल नहीं सकता था क्योंकि ना हाथ काम करते थे ना पैर. सो जब मुझे स्पोर्ट्स के बारे में पता चला, आई वॉज वेरी एक्साइटेड टू ट्राई इट आउट, क्योंकि वंस यू आर अ स्पोर्ट्स पर्सन, आप हमेशा स्पोर्ट्स पर्सन रहते हैं. तो मैं जसप्रीत जी को सबसे पहले थैंक यू बोलना चाहूँगा कि फॉर ब्रिंगिंग दिस ब्यूटीफुल गेम इनटू द कंट्री. और इस गेम की खासियत ये है कि इसमें ये एक इंडिविजुअल ऐसा स्पोर्ट है जिसमें पैरालंपिक्स में 40 मेडल हैं जीतने के लिए, द मोस्ट इन एनी स्पोर्ट. अगर आप एक स्पोर्ट में पार्टिसिपेट नहीं करते हैं तो यू आर डाउन बाय 40 मेडल्स ऑलरेडी. तो और जैसा जसप्रीत जी ने पूछा, हम अभी ये 2016 में आया, बाकी लोग 1984 से खेल रहे हैं. तो स्टार्टिंग में हमें बहुत दिक्कत हुई, बहुत, क्योंकि प्लेयर्स को, जो बाकी कंट्री के प्लेयर्स थे उनको बहुत एक्सपीरियंस था, उनके बाद डेडिकेटेड कोचेस थे और उनको बहुत ज़्यादा तजुर्बा था इस गेम का. हम पहले कंपटीशन में गए, हम वहाँ हारे, फिर गए, फिर हम हारे. बट ओवर द टाइम वी इम्प्रूव्ड. हमें गेम समझ में आया, हमें स्ट्रैटेजी समझ में आई, क्या करना होता है, गेम को कैसे खेलना होता है, हमें सब समझ में आया. एंड नाउ हम लोग फाइनली विनिंग ट्रैक पे हैं. हम लोग इस बार 6 मेडल जीत के आए. पहली बार हुआ कि इंडिया 6 मेडल जीत के आया. एंड हमारा एम तो यही है कि वी वांट टू रिप्रेजेंट कंट्री एट द बिगेस्ट स्टेज ऑफ ऑल, एंड वी आर टारगेटिंग नाउ द 28 में LA में जो पैरालंपिक्स होने वाला है, कि हम वहां पर जाएं और इंडिया का नाम रोशन करें. थैंक यू.
थैंक यू सचिन। अभी मैं हमारे दूसरे जो प्लेयर हैं इनके लिए क्लैपिंग होनी चाहिए, क्योंकि जो गोल्ड मेडल इन्होंने इजिप्ट में जीता है तो उससे हमारी रैंकिंग भी बहुत इम्प्रूव हुई है। और हमें जो आने वाली एशियन पैरा गेम्स हैं जो जापान में 2026 में होनी है, और वर्ल्ड चैंपियनशिप है जो कोरिया में होनी है, उसके लिए जो स्लॉट के चांसेस है वो भी बहुत बढ़ गए हैं। तो अभी मैं उनसे बेनती करूंगा कि वो भी अपने सफ़र के बारे में आपके साथ शेयर करें। थैंक यू।
हेलो एवरीवन, मेरा नाम अंजलि है और मैं हिमाचल प्रदेश मंडी से हूँ। तो मेरा 2018 में एक कार एक्सीडेंट हो गया था जिसमें मेरा सर्वाइकल स्पाइनल कॉर्ड इंजरी हो गया। और सेम सचिन भैया की तरह मैं भी BC3 कैटेगरी में बोशिया गेम को खेलती हूँ। और मेरा बोशिया जर्नी है वो स्टार्ट हुआ था 2023 नेशनल चैम्पियनशिप से। और मैं बोशिया गेम से मेरा इंट्रोडक्शन चंडीगढ़ स्पाइनल रिहैब चंडीगढ़ से हुआ था। मैंने वहीं पे गेम को देखा था, जो कि मेरे सीनियर प्लेयर हैं उनको मैंने खेलते हुए देखा था। तो मैंने उनको देखा और मेरा इंटरेस्ट इस गेम में बन गया। तो सबसे पहले तो मैं बोशिया फेडरेशन ऑफ इंडिया को थैंक यू बोलना चाहूँगी कि उन्होंने इस गेम को इंडिया में इंट्रोड्यूस करवाया और हम लोगों को एक प्लेटफॉर्म दिया कि हम लोग भी स्पोर्ट्स फील्ड में आगे बढ़ सके और अपना फ्यूचर बना सके, हमें एक सपना दिया। सो थैंक यू सो मच जसप्रीत सर और शमिंदर सर सेक्रेटरी जनरल और अशोक बेदी सर कि आप फेडरेशन को रन कर रहे हैं और हम लोगों के लिए एक अच्छा प्लेटफॉर्म लेकर आए और हमें अपॉर्चुनिटीज़ दे रहे हैं ताकि हम लोग नेशनल और इंटरनेशनल लेवल पे पार्टिसिपेट कर सके। तो उसके बाद मैंने 2 जो है नेशनल इवेंट्स खेले हैं और 3 इंटरनेशनल इवेंट्स। नेशनल इवेंट्स पे मेरे 2 गोल्ड हैं और एक सिल्वर है पेयर्स में और एक गोल्ड है पेयर्स में। उसके बाद मैंने एशियन पैरा गेम्स में लास्ट ईयर इंडिया को रिप्रेजेंट किया था। जो अभी रिसेंटली 2024 में जो कायरो इजिप्ट में इवेंट हुआ था, तो बोशिया स्पोर्ट्स फेडरेशन ऑफ इंडिया के हार्ड वर्क और डेडिकेशन की वजह से हम लोग वहाँ पे मेडल्स 6 मेडल्स लेके आए और उसमें भी मेरा एक इंडिविजुअल में गोल्ड मेडल है। सो मैं मैं फर्स्ट टाइम ऐसे किसी इवेंट में को अटेंड कर रही हूँ। सो थैंक यू सो मच फॉर गिविंग मी दिस अपॉर्चुनिटी एंड थैंक यू फॉर लिसनिंग मी। थैंक यू सो मच।
थैंक यू अंजलि। अभी हमारे साथ हमारे एडवाइजरी बोर्ड मेंबर हैं आशु ग्रोवर मैम। मैं उनसे रिक्वेस्ट करूंगा कि मैम जब भी हमारे इवेंट्स होते हैं तो मैम का इंटरेक्शन रहता है बच्चों से, तो इनका काफ़ी एक्सपीरियंस है सोसाइटी में और काफ़ी वर्किंग एरियाज में सोसाइटी में विचरते हैं ऑल ओवर द इंडिया एंड इंटरनेशनली। तो आईसीएमआर में अभी मैम देख रहे हैं वर्किंग। तो मैं मैम से रिक्वेस्ट करूंगा कि जो उनका हमारे बच्चों के साथ इंटरेक्शन है, तो मैम का क्या उसके लिए विचार है कि हमारे बच्चे क्या कर सकते हैं और कैसे करेंगे, तो उसके लिए इनको गाइड भी कीजिए और हमारे जो सोसाइटी है उनको बताइए कि कितना स्पिरिट है हमारे बच्चों में। थैंक यू।
Thank you, Jasprit. Respected Bedi sir, chairman, and Jasprit, and all the members who are sitting here on the dais and on the other side, and especially the children who have won the medal and who are part of the journey. जो मतलब आई थिंक जो इन्होंने अपने शब्दों में बयान किया, वो जब आप देखते हो इनको खेलते हुए, वो आई थिंक वो देख के ही पता चलता है कि वो कैसे एफर्ट्स करते हैं और कैसे वो बॉल जाती है। जो क्वाड्रिप्लेजिक बच्चे हैं वो कैसे मुंह से बॉल को पहुंचाते हैं और उसको कुछ टारगेट होता है, टच करने होते हैं। मैंने पहली बार ये गेम ग्वालियर में देखा नेशनल लेवल पे, और it really gave me a kind of so much of pride that I have been watching these games live. एंड मुझे ऐसा लगता है कि जहाँ भी ये नेशनल गेम्स हों, आपके स्टेट लेवल पे हों या नेशनल लेवल पे हों, जहाँ भी हों, यू ऑल मस्ट गो एंड सी दीज गेम्स बाय योर ओन आइज। यू विल रियलाइज कितने चैलेंजेस हैं जो इन्होंने चैलेंज बताए सारे कि खेलने के लिए और जीतने के लिए। उसके अलावा अब आई थिंक सिंस दिस इज़ अ हेल्थ समिट फॉर CSR कॉम्पोनेंट, तो आई विल डेफिनेटली एम्बार्क अपॉन कि इनके हेल्थ इश्यूज को भी एड्रेस करने के लिए CSR कॉम्पोनेंट को आगे आना चाहिए। I mean, it is not, look, you can feel the difference. Like we perform on daily activities of life, like they perform their daily activities of their life. And definitely when we were part of the China Games, and I was part of their female physician, and मैं जब females पैरा स्पोर्ट्स बच्चों के कमरों में जाती थी, स्पेशली गर्ल्स के कमरों में, it was really a kind of a situation they needed intervention. एंड दैट इंटरवेंशन वाज कि उनको थोड़ा सा हेल्थ एजुकेशन करना, उनको प्रॉपर उनकी सैनिटेशन देखना, हाइजीन देखना, उनको एजुकेट करना, उनको अप्रोप्रिएट फैसिलिटीज देना। वो इट इज़ नॉट ओनली गवर्नमेंट ऑफ इंडिया पर्सपेक्टिव, ये CSR लोगों का और सबका मिलीजुली भगत है, बिकॉज दे बिंग प्राइड टू द कंट्री। सो आई विल डेफिनेटली नॉट स्पीक मच अबाउट, बट ये जब चीज़ें हम करते हैं तो ये देख के ही ज़्यादा पता चलता है रादर देन। सो थैंक यू जसप्रीत फॉर इंट्रोड्यूसिंग दिस गेम एंड नेम टू दिस अगस्त ऑडियंस। एंड मुझे ऐसा लगता है कि जहाँ भी मेजर CSR कंपनीज हैं जो अपने कंपोनेंट को यहाँ पे एम्बार्क कर सकते हैं, डिलीवर कर सकते हैं, दे शुड डेफिनेटली कम फॉरवर्ड एंड हेल्प दीज चिल्ड्रन इन fostering the game of Bosia, not only at state level, national level, but at international level. Thank you so much for giving this opportunity and be part of this important delegation.
थैंक यू मैम। तो अभी मैं रिक्वेस्ट करना चाहता हूँ हमारे डॉक्टर रविंदर सर आईसीएमआर से, जो हमारे एडवाइजरी बोर्ड के मेंबर हैं, कि वो भी बौछिया के बारे में 4 शब्द बोले। थैंक यू।
थैंक यू जसप्रीत जी। गुड इवनिंग एवरीबॉडी। 2 इशू हैं, एक तो हम सीएसआर वाली मीटिंग में क्या कर रहे हैं और दूसरा हेल्थ में क्या इशू है। मतलब दोनों, इन्होंने हेल्थ का इशू चुना और सीएसआर चुना और वहां पे बौसिया प्लेयर आ गए। तो मैं डब्ल्यूएचओ के साथ काम करता हूं आईसीएमआर की तरफ से, और हमने एक काम किया। डब्ल्यूएचओ ने एक लिस्ट बनाई थी 2016 में, उसको प्रायोरिटी असिस्टेड प्रोडक्ट लिस्ट बोलते हैं। उसमें 50 प्रोडक्ट थे, उसमें व्हील चेयर और वॉकर एंड स्पेक्टिकल, चश्मा, हीयरिंग एड सब हैं। तो हमने इंडिया में काम शुरू किया। तो उस लिस्ट का नाम आप लोगों ने अगर सुना होगा, अगर कोविड के टाइम पे, तो बाकी सब चीजें बंद हो गई, दूध और ब्रेड ये बंद नहीं हुए, और कुछ और ऐसे आइटम थे, उनको हम इसेंशियल आइटम बोलते हैं। तो हमने आईसीएमआर की तरफ से एक लिस्ट तैयार करी बेस्ड ऑन डब्ल्यूएचओ लिस्ट, उसको हम नेशनल लिस्ट ऑफ एसेंशियल असिस्टेड प्रोडक्ट बोलते हैं, एनएलईएपी। दैट मीन्स कि जो प्रोडक्ट उस लिस्ट में आएंगे वो एक एसेंशियल लिस्ट की कैटेगरी में आने चाहिए, और उनमें से व्हील चेयर एक है, और उसमें स्पेक्टिकल्स हैं, उसमें हीयरिंग एड्स हैं। जो भी प्रोडक्ट हमारी फंक्शनैलिटी के लिए, हम डिसेबिलिटी की बात ही नहीं करते हैं, हम कहते हैं फंक्शनैलिटी या एबिलिटी की थी, तो ये आज यहां पहुंचे हैं। उन बच्चों के एबिलिटी है तो पेरिस में 24 मेडल ले आए। तो हम डिसेबिलिटी की बात ही नहीं करते हैं, हम असिस्टिव प्रोडक्ट के थ्रू, रिहेबिलिटेशन के थ्रू जो इनको आज जो मुकाम दे सकते हैं, आई थिंक दैट नीड्स टू बी स्ट्रेंथन। कल मिनिस्ट्री में भी यही बात हुई थी, वहां भी मैंने यही बोला था। मिनिस्ट्री ऑफ हेल्थ में एक बहुत बड़ा ग्रुप हमने रिहेबिलिटेशन का बनाया है, और उसके हमें डीजीएचएस ने बड़ा अच्छे से सपोर्ट किया। मिनिस्ट्री ऑफ हेल्थ की बहुत अच्छी सपोर्ट है हमें, और आने वाले समय में मैं ये श्योर कर सकता हूं कि ये व्हील चेयर की कॉस्ट कम हो, क्योंकि डॉक्टर जितेंद्र शर्मा भी यहाँ बैठे होंगे, जो उनके एफर्ट्स हैं इन सब प्रोडक्ट्स का कॉस्ट कम करने के लिए। उसमें 4 ए की बात करते हैं, अफोर्डेबल, अवेयरनेस, अफोर्डेबिलिटी, एक्सेसिबिलिटी एंड एक और 4 है तो अवेलेबिलिटी। तो ये 4 अगर हम ए को अचीव कर पाए अगले आने वाले 5 साल में या 10 साल में, आई थिंक दैट वुड बी अ ग्रेट सर्विस टू दिस किड्स, एंड they are going to bring us lot of gold and gold medal to us. Thank you very much.
थैंक यू। इसके अलावा जो जैसे अभी आप देख रहे हैं कि पेरिस पैरालंपिक्स चल रहे हैं, हमारे मेडल आ रहे हैं, तो हमारे जो ऑनरेबल प्राइम मिनिस्टर हैं, उन्होंने भी हमारे जो एथलीट्स हैं उनकी प्रेज की है। तो अभी जो रिसेंटली एक प्रोग्राम रेड फाउंट पे हुआ था दिल्ली में, तो मैं चाहूँगा कि उसकी वीडियो भी आपको दिखाई जाए, जिसमें वो हमारे पैरा एथलीट्स और हमारे पैरालंपियंस का प्रेज कर रहे हैं कि वो भी अपना सोसाइटी में रोल अदा कर रहे हैं। प्लीज वीडियो नंबर 2।
जब मेरे दिव्यांग भाई बहन भारतीय साइन लैंग्वेज की बात हो या तो सुगम्य भारत का अभियान हो, उसको लगता है कि अब मेरी भी डिग्निटी है, मेरे प्रति देश के नागरिक सम्मान के भाव से देखता है। और पैरालंपिक में तो हमारे खिलाड़ी नई नई ताकत दिखाने लगे हैं, तब लगता है कि ये जो मेरा मम भाव है, हम सबका मम भाव है, उसकी ताकत नजर आती है।
तो हमें थैंक यू। हमें जो सोसाइटी में एथलीट्स हैं, जो हमारे पैरालंपिक्स के साथ जुड़ने वाले प्लेयर हैं, हमें उनको अवेयर करना है। और जैसे हमारा नेशनल फेडरेशन काम कर रहा है इन एथलीट्स के लिए, तो हमारा आपसे एक ही बेनती है कि ज़्यादा से ज़्यादा आप इसको सोसाइटी को अवेयर करने में हमारी हेल्प कीजिए। और जहाँ पे भी आप हमारी फेडरेशन जहाँ हमारे एथलीट्स को सपोर्ट कर सकते हैं अंडर दी CSR, अंडर दी स्पॉन्सरशिप, सपोर्ट कीजिए। थैंक यू।
एक स्मॉल रिक्वेस्ट टू द मैनेजमेंट ऑफ इंडिया हैबिटेट सेंटर, इफ समबडी इज लिसनिंग, जो यहाँ पे एक छोटा सा रैंप लगना था. तो आई थिंक नेक्स्ट टाइम दे विल टेक केयर ऑफ इट. It's not small issue, it's a very very big issue, or I think they will listen to and take care of it. And similar situation happened in ICMR once. One of the expert, he refused to attend my meeting because there was no ramp. ज्यादा कोई खर्चा नहीं आएगा मेरे ख्याल से, 400-500 रुपए से ज्यादा कोई खर्चा है नहीं है, बट अगर और अच्छा लेंगे तो और बेटर है. So please take care of it. So that next time we attend meeting, I think we will have that ramp there. Thank you very much.
Surely. Thank you. Can we have a group photograph of the panel, please? Thank you. So with this, we conclude our sessions of the summit, and now we will move on to our award ceremony. The award ceremony would be moderated by my colleague, Ms. Vigya Roy. So Vigya, now I will hand over the stage to you. Thank you.
Ladies and gentlemen, at the heart of the summit is the belief that transformative change happens when innovation meets compassion. It is with great honor that we welcome our guest of honor for today, Major General K.K. Sinha, a distinguished geostrategic and global security expert. Major General Sinha's illustrious career spans decades of dedicated service in the Indian Army, where he earned accolades such as the Sena Medal and the Vishish Seva Medal. I invite Major General Sinha and Dr. Swadeep Srivastava, Dr. Mohsin Wali to come forward and offer a bouquet and welcome the Major General K.K. Sinha. Can we have a bouquet, please? I request Dr. Padma Shri Dr. Mohsin Wali to welcome Major General K.K. Sinha. Thank you so much. As we are waiting for our chief guest, Sri Harsh Malhotra, I would request, so be seated. I would request Major General Sinha to come forward and share a few words, sir.
Jai Hind and good afternoon. Jai Hind, because I do belong to military fraternity. I do not know where I fit in this when I see the complete medical fraternity, where I fit in. But I have got a lineage, pattern and lineage. My father was a doctor, and I'm talking about pre-independence, where the medical fraternity was there. I had a little bit understanding because of my father, and thereafter how the medical care, the medical fraternity has grown, and what is the future when we are looking forward for 100 years, when we are attending in 2047, when the India is going to emerge, because my field is strategical understanding of global in the today's world, where everything's are changing, the global order is changing, and where it fits in. So how much time I have got? 2 minutes? 10 minutes. Okay. I do not know, because it is a different thing which I am trying to bring it out, and I will bring it out from my experience, what I have got it, and I will try to correlate with the medical things,
I hope people understand English, otherwise I'll just switch on to Hindi, which it's fine that I'm speaking in English. Okay. Okay. Ladies and gentlemen, see, when I perceive, the mini God, this, I call them the medical fraternity, in whatever level they are, it is a mini God. And this perception, I've got it from very young childhood, which had got the superheroes, and now it has been termed as a warrior, which has recently came after the COVID. They have got different name. But mini God is why mini God, because you medical fraternity may not realize this what they are. It is only a layman like us who has seen the things life and death from very close distance, because I have been for about 40, 45 years in combat and hard combat in the country itself and abroad, in UN missions and many part of the world, where we have seen the life and death from a very close distance. And these disability which you have just seen with my own eyes, we have seen hale and hearty people who have actually got into this position. Now, I will, where it fits in, I do not know, but because it is part of my experience, I will just narrate. My father, where the medical was there, pre-independence, he was, he was doing his MBBS from in Darbhanga Medical College, and then he has moved. This is before we got independence, and then he went to Calcutta. Calcutta, the medical college that time used to be called Calcutta Medical Bengal. It used to be called that time, that college. And he did join the Subhash Chandra Bose because he was in Calcutta during that time. But there was a call again by Mahatma, and he did join the British Indian Army, where he joined as a doctor, where he was given the assignment to be ambulance train, used to be in various parts of the world where the fighting was taking place. And finally it was in Hiroshima and Nagasaki where the bombs were dropped. So he has seen the combat in. And why I'm bringing my parent lineage in it, because the dedication, the devotion, the motivation, selfless sacrifice, which we talk about and try to I imbibe it going to the military, I picked up from him absolutely. And because he was after the independence, he did join the medical service in India and also represented WHO. The amount of dedication I've seen, and I feel that every person who was in this fraternity has got the same thing, dedication and devotion and supreme sacrifice they have done. I'll just narrate one or two things on that, and then my experience when I was in the military, how I have seen this, this mini gods functioning on ground. Whether it was a nursing assistants, it was whether we have got sisters, we have got nursing, women who are functioning. It was a doctor, lab technicians, because it is very important to understand by the social responsibility. Today we are talking about a CSR, and what has got in importance of that social responsibility. I call it social responsibility. Each and everyone. Today I have dedicated myself toward this social responsibility when I have hanged, but at the strategic level. I've just returned back from 1.5 months from United States of America. Especially I was there in California, in that area, where we try to generate for this cause, because India is somewhere reaching on those lines. Maybe next 20 to 22 years we will be on that line where the world is as today. Now I will tell you that dedication and selfless sacrifice, when this profession people do it. My father joined eradication of malaria. He was one of those renowned guy, but he chose to came down. And I picked up from him that it is important to go for a cause rather than other things which drives you to join. Second thing, when I joined army, I joined armed forces from National Defense Academy. In the age of 16 and a half, I was there in that academy, and thereafter we generally you go through the all trainings and then you commission, thing like that. what I picked up, I will just sum up what is the dedication of this mini gods are, because it must inspire you, because once you are inspired, it is gets translated everywhere in the environment. Actually, you guys deal with heart, mind, soul, body, and that is what the God manifestation. When we say God manifests in the human being, and the human being manifestation, and you are the guys who actually look after that. That's why it is called many God. Now, I'll give you one example how the supreme sacrifice has been done by these. You must have heard, there was in news about a year back, there was a doctor, a young doctor who was a captain at the time, a doctor posted at Siachen Glacier. And he is from Pune, that is AFMC Pune, a very young, budding. We have got something called RMO, Regimental Military Medical Officer, who actually are posted with the battalion. He is the only medical in, and then one or two nursing assistants, but in hard combat they are. A number of examples are there. This guy in 23 in Siachen Glacier, highest battlefield of the world. There was a fire, where actually it was an ammunition dump where the fire broke out, and it is spread. He saved 3 gentlemen, their life, his colleagues. But the thing which I wanted to narrate, there was fiber hut, where you actually it saves you from the cold and avalanches and chilling, that chill blinds and all which you get it. So there were some medicines, life saving medicines, and there was equipment which is very, very important for the troop of body, because the battalion has got approximately 2,000 people. So it's very important, and he's there. He jumped inside that, knowing that is the sure death to save, just to save the equipment that he was in the fiber hut, so that when the time, because in these areas in Siachen Glacier, if that goes, the life of maybe in danger of 2,000 odd people who are looking after and guarding the border. He jumped inside, saved the equipment, saved the life-saving drug, came out. He got the Kriti Chakra, but he died. That is what and that when I'm narrating this and trying to bring it out, this example, this is exactly has been seen during the COVID time. And that's why in the nationwide, when the Prime Minister gave the name of the warrior, and the right, I think, right word, right acronym, or right, position you can give it to a true warrior, a mini God's true warrior. And that should motivate you to actually do those dedications. Now, I leave it here because there are a number of examples where we have seen an absolutely young, boy with full of, you send them in operations, and within 5 minutes he comes down and you find he is no more. This time the trauma, that time, these are the life when you realize what is the importance of. My time is over? Okay, I think my time is over, but I'll just take one few seconds, because we are reaching somewhere, because I deal with strategical level at geostrategic level, and that is very, very important. India is very soon, within 22 years time, it is no time. India is going to be not what people are talking about, Viksit Bharat. That is not the thing. India has got all probability, because we deal with it, India to becomes one the superpower of the world, and the chances are there within 10 years time. It was the sole superpower, surpassing America, where there is a forecast is there, $30 trillion economy. But in the comprehensive national power, it is very, when we talk, the tangible factor is the human being, and the human being is looked after by the people, because the quality that will makes a difference. There you chip in, and that's why when we are talking about in medical term, these things doesn't come up. So we have to actually because that is what your reach is. And I am very sure with the way it has started in 100 years, it will reach there. And the way Indian medical fraternity is doing all over the world. And someone who was from the foreign ministry just said, east and west, India is best, and it is not a slogan. This is a fact as for the medically facilities, medical treatment, medical care, which is there in this country. Thank you very much for taking some time.
Thank you so much, sir. It is a great privilege to introduce our esteemed special guest, Padma Shri Dr. Mohsin Wali. I invite Ms. Misha Dange to come forward and welcome him. Dr. Wali is a highly respected figure in the medical community, known for his exceptional contributions to healthcare and his dedication to advancing medical science. Ms. Misha, if you can come forward and welcome Dr. Wali. Can we have the bouquet? Thank you, sir. Now, with great privilege, we welcome our esteemed special guest, Padma Shri Dr. Chandrakant S. Pandav, renowned as the Iodine Man of India. Dr. Pandav is celebrated for his pioneer work in addressing iodine deficiency disorders and advancing public health. I invite Dr. R.K. Tuli to come on the stage and welcome Dr. Pandav. So please. Thank you, sir. Thank you, sir. It is a distinct pleasure to introduce our next special guest, Dr. Ram Kumar, General Secretary of Seva Bharati. Dr. Kumar has been a leading force in advancing community service and social welfare through his work with Seva Bharati, an organization dedicated to empowering underprivileged communities and fostering holistic development. I request Ms. Misha Dange, and do we have Dr. Ram Kumar here in the hall? Okay. So I will invite Dr. Chandrakant S. Pandav to come forward and share a few words.
Namaskar. First of all, I want to express my gratitude to all the participants. You have been very patient. I think we gathered here at 10 o'clock in the morning, but I appreciate your patience. Dhanyavad. Also to the esteemed speakers who came from all over India. Gratitude to them. Now, my story is very simple. I wanted to become a neurosurgeon. I was admitted at the All India Institute of Medical Sciences in 1971 to do my MBBS. But my director, Dr. Ramalinga Swami, said India does not require neurosurgeons to go to public health. So I went to public health. That was a turning point. My esteemed colleague, Dhananjay ji, he is writing a book on me, Savior of the Brains of India. So that's how I got into iodine work, and I've been working in this area for the last 45 years. It's a simple story. What we do is add iodine to the salt and make it iodized salt. Iodine deficiency is the single most important cause of mental retardation globally, and it is totally preventable. So that's what I've been doing, not only in India, but 60 countries of the world. My inspiration in life is, of course, my parents, my family who supported me to do this work. And my motto in life is serve the society. I'm not in search of happiness. I want to use my scientific knowledge for the people's well-being and welfare. Thank you very much for this opportunity. Dhanyavad.
Thank you, sir. May I request Dr. Mohsin Padma Shri Awardee, Dr. Mohsin Wali, to share a few words with us?
Major General K.K. Sinha, Iodine Man of India, and audience. And I cannot address each and every marvel in the audience. Dr. Panda was speaking just now his story. Every one of you has a story to tell. आप सब जो यहाँ रत्न इकट्ठे किए हैं हमारे सुदीप जी ने और उनकी टीम ने, आप सब की एक अच्छी सी एक कहानी है, हमारे प्लेयर्स की एक कहानी है, हमारी ऑडियंस में हर आदमी जो यहाँ बैठे है उसकी एक कहानी है, और वो कहानी सक्सेस की है। और आज हमने दो चीज़ें सीखी। एक तो हमने ये सीखा कि एक गेम नया होता है, जो अभी आपने देखी, जिसके प्लेयर्स को अभी हम लोग अवार्ड करेंगे। और एक सुबह डॉक्टर पालन ने एक बात बताई कि हैप्पीनेस का मतलब ये नहीं है कि आप खुश रहें, हैप्पीनेस का मतलब ये है कि आप दूसरों को दें। जब तक आप देंगे नहीं, जब तक मिलेगा नहीं। और CSR का जो मेन उद्देश्य है, जो थीम बिहाइंड CSR है, वो यही है कि CSR के थ्रू जो कंपनियां, बड़े बड़े लोग कमाते हैं, वो CSR के थ्रू जनता के लिए कुछ करते हैं, अपने लोगों के लिए कुछ करते हैं। और हमने श्री कृष्ण और अर्जुन के संवाद से भी आज कई चीजें सीखी। तो ये सब जो लेसन्स हैं, ये देने वाले लेसन्स, ये बहुत पुराने हैं। इसीलिए कहा जाता है जो हाथ देता है वो लेने वाले हाथ से अच्छा होता है। तो CSR के मेन थीम से आज ये इस तरह की फर्स्ट कॉन्फ्रेंस सुदीप जी ने की है। मैं उनको और उनकी टीम को बधाई देता हूँ। डॉक्टर सौमित्र रावत हमारे बीच में पधारे हैं, ये भी पद्मश्री अवार्डी हैं, एक अच्छे सर्जन हैं, और हमारे नेशनल टास्क फोर्स के मेंबर बनाए गए हैं। चीफ जस्टिस ऑफ इंडिया इन्हें सिलेक्ट किया। और ये सबसे ऊपर बात यह है कि मेरे बहुत अच्छे दोस्त हैं, इनका भी स्वागत है। तो मैं जो बात कह रहा था वो ये कह रहा था कि आज जो हमारे सुबह से शाम तक की मेहनत का अगर हम इसको एक वर्ड में समराइज करें कि आज हमने क्या सीखा, तो वो वर्ड है देना, गिव, डिस्ट्रीब्यूट, वितरण कीजिए, दीजिए, सैक्रिफाइस कीजिए। तो जब हम सब सैक्रिफाइस करेंगे तो सबको मिलेगा। आज सारी दुनिया में लड़ाई है वो इस बात की है कि हम क्या किसी से छीन लें, किससे ले लें, किसको हथिया लें, किसकी जमीन हड़प कर लें। सो सारी इंटरनेशनल फाइट्स जो हैं वो इन्हीं चार चीजों के लिए हो रही हैं। कहीं ऑयल पे है, कहीं लैंड पे है, कहीं पैसे पे है। तो इसी सब को रिवर्स करने के लिए ये जो थीम है देने का, ये सदा से चला आ रहा है। सुबह ये बात आप लोगों के सामने आई, जो लोग आए हुए हैं, कि ये आदिकाल से चला आ रहा है। तो इसलिए आज के दिन का ये लेसन बहुत इंपॉर्टेंट है कि वी शुड बी ऑन द गिविंग साइड। और मुझे 10 सेकंड दीजिए, मैं आपको हैप्पीनेस की पूरी परिभाषा सुनाता हूं अभी। ये डॉक्टर पांडा की एक छोटी सी किताब थी जो इसमें रखी थी, मैंने अभी इनसे ली थी, और शायद ये वापस चली गई इनके बैग में। ये मैं वापस निकलवा रहा हूँ। यस। So while we are summarizing today's conference, you should understand the purpose of life. Purpose of life is not to be happy. It is to be useful, be honorable, to be compassionate, and to have it make some difference that you have lived and lived well. And this is a famous saying of Ralph Waldo Emerson, who died in 1882. He was an American poet and philosopher. So, with these words, I'll take leave and tell you to learn this quality in your day to day life for the rest of the life, that be on the giving side and not only taking side. Be kind to be kind to everyone, and what we say for long life, this is the same our mantra: be passionate, be humble, be kind, be on the giving side, and you will live longer. Thank you.
Thank you, sir. May I invite Dr. Ram Kumar, General Secretary of Seva Bharati, who is a special guest for today. Dr. Kumar has been leading force in advancing community service and social welfare through his work with Seva Bharati, an organization dedicated to empowering underprivileged communities and fostering holistic development. May I invite Mr. Dhananjay to come forward and welcome Dr. Ram Kumar. Can we have the bouquet, please? Ladies and gentlemen, it is with great honor and anticipation that we welcome our esteemed chief guest for today, Shri Harsh Malhotra ji. As the Minister of State in both the Ministry of Corporate Affairs and the Ministry of Road Transport and Highways, Shri Harsh Malhotra ji have been driving force in advancing policies that foster corporate responsibility and societal development. Please join me in extending a warm welcome to Shri Harsh Malhotra ji as he graces us with his presence and shares his insights with us today. I invite Ms. Misha Dange to offer a bouquet and welcome him. May we please have a round of applause? We also have amongst us a distinguished special guest for today, Padma Shri Dr. Soumitra Rawat, Chairman and Head of Surgical Gastroenterology and Liver Transplant at Sir Gangaram Hospital. Dr. Rawat is a renowned specialist in the field of surgical gastroenterology and liver transplantation, and his contributions to advancing medical care are widely recognized. May I request Dr. Sadeep Srivastava to offer a bouquet and welcome him. To officially start this next segment of our event, it is my distinct pleasure to invite Dr. Swadeep Srivastava, founder and chairman of the HEAL Foundation, to the stage. Please join me in welcoming Dr. Srivastava, who will deliver the welcome address. Dr. Srivastava.
गुड इवनिंग एवरीवन. इट हैज़ बीन अ वेरी लॉन्ग डे. आज सुबह से 10 बजे से लगातार ये कार्यक्रम चल रहा है, जिसमें करीब 150 से ज़्यादा CSR, हेल्थ केयर CSR से जुड़े लोग ने भाग लिया और इस कार्यक्रम को सक्सेसफुल बनाया. अब जब इस समापन का टाइम है, तो दिस इज द मोस्ट इम्पॉर्टेंट सेगमेंट विच वी आर गोइंग टू स्टार्ट नाउ. एंड आई सिंसियरली वेलकम आवर चीफ गेस्ट श्री हर्ष मल्होत्रा जी, मिनिस्टर ऑफ स्टेट for Road Transport and Corporate Affairs Ministry, and sir was able to squeeze out time from his busy schedule and be present here. So please give a big round of applause for Mr. sir. And my heartiest welcome to our Guest of honor, Lieutenant General Shri Sandeep Sinha ji. The special guest on dais, Dr. Chandrakant S. Pandav, he's a Padma Shri awardee, known as the Iodine Man of India. Dr. Ram Kumar, the General Secretary, National General Secretary of Seva Bharati, which is the largest NGO in the world. Dr. Mohsin Wali, the physician to the three presidents of India, Padma Shri awardee, very popular physician, and Dr. Soumitra K. Rawat, we just now welcomed him. So before taking, I would not like to take much time. We'd like to quickly run the program and come to our award function very fast. And then at the end, we'll have our chief guest lecture and end the program. So I would just like to play our video for the program and then swiftly move on to our 3 award segments. Thank you so much. Greetings from HEAL Foundation. Since our inception in 2010, our core objective at HEAL Foundation has been to provide neutral, effective platforms for stakeholders who are committed to healthcare improvements by contributing sincerely in whatever small or big ways, representing the ethos of their sector and organization they stand for. We have been fortunate to pivot 2 key programs in our health impact and improvement drives. First is our flagship program of health media and training capacity building, focused on the vernacular and digital media, under which we have trained more than 1,500 health journalists, editors, bloggers, health writers, and this platform has been a voice to more than 500 experts, key opinion leaders, doctors, and public health experts. And second, our extensive CSR programs in healthcare focused on health screening for NCD and preventable diseases using our unique health ATM module, keeping the marginalized people at the bottom of the pyramid at the center. And Suposhan programs in schools and colleges, and tuberculosis new case finding initiatives using our floating mobile screening module using latest technology and cost-effective methods.
15 years ago, a vision was born. A vision to bridge the gaps in healthcare and bring about lasting change in communities across India. Today, HEAL Foundation stands as a guiding light, empowerment, and transformation. HEAL Foundation, a not-for-profit organization, has tirelessly committed itself to driving impactful change through corporate social responsibility. By uniting policymakers, social scientists, and key healthcare stakeholders, we have forged powerful partnerships that have bolstered India's healthcare framework. Our mission: to educate, empower, and advocate for a healthier, more informed society, ensuring that our CSR initiatives leave a lasting legacy. One of our most impactful initiatives is Suposhan, a program combating childhood anemia in East Delhi. We recognized that widespread anemia was hindering children's ability to thrive. So we partnered with the East Delhi Municipal Corporation, Britannia Nutrition Foundation, and All India Institute of Medical Sciences to make a difference. Through this program, we provided iron and micronutrient fortified biscuits to children for 6 months, ensuring they receive 50% of their daily nutritional needs. One of our proudest achievements is the Swavlamban initiative, a project that has touched the lives of thousands of migrant workers and their families. Through evening health clinics, education centers, and livelihood training, we've brought hope and opportunity to those who need it most. During the unprecedented COVID-19 pandemic, HEAL Foundation stepped up with the COVID Fighters Public Health Safety Movement. In just 400 days, we reached over 120 million people across India, providing accurate information and support during a time of crisis. Our Mask is Must campaign became a symbol of resilience, helping to save lives and spread awareness. In 2021, as the world began to recover, we launched Health for All online, a weekly health show that brought expert advice directly into people's homes. Covering everything from yoga to cutting edge health technology, this show has reached 8 million viewers, sparking conversations about health and wellness across the nation. With our preventive screening drive via mobile health clinic, look at the transformative journey with Heal Foundation and You Grow Capital's groundbreaking CSR initiative, the preventive screening drive via mobile health clinic. For the past year, we have diverse communities from urban slums to corporate settings, championing the cause of preventive healthcare. As we mark a year of impactful outreach, it is clear that these initiatives have done more than just provide healthcare. They have sparked a cultural shift towards prioritizing preventive health. The preventive screening drive via mobile health clinic is a testament to the power of corporate social responsibility, shaping a healthier future for India. Through the preventive health screening drive via mobile health clinic, National Fertilizers Limited, in partnership with Heal Foundation, brought essential preventive health services to thousands of undeserved individuals across urban and semi-urban slum areas. This CSR-driven initiative not only delivered vital care directly to those in need, but also ignited a cultural shift towards preventive healthcare, empowering communities with the knowledge and tools to combat non-communicable disease. The program's success highlights NFL's deep commitment to corporate social responsibility, leaving a lasting impact on the health and awareness of these marginalized populations. India Fights TB is a crucial initiative aimed at eradicating tuberculosis from India by raising awareness across the nation. With TB being a leading cause of death, particularly in states like Uttar Pradesh, Madhya Pradesh, Maharashtra, Rajasthan, and Gujarat, this campaign focuses on spreading credible information to prevent and combat the disease at its root, empowering every individual to be a part of the fight against TB. As we celebrate 15 years of service, we look to the future with renewed commitment. Heal Foundation will continue to pioneer health education, advocacy, and care, because a healthier India is a stronger India. Together, we are making a difference, one life at a time. Join us in our journey. Together, we can make India healthier, stronger, and more resilient.
Today, in our first edition of Healthcare CSR ChangeMakers Summit and Awards program, in line with promoting the role of healthcare changemakers, we have come together to celebrate the role of CSR initiatives, CSR funded programs, and exemplary role played by the CSR changemakers in creating health impact and improvements on the ground, contributing to the social and health upliftment of the underprivileged society with an objective to make our people healthier by adopting preventive habits and taking our country, India, towards becoming the health capital of the world by 2047. एक इनफैक्ट बात बोल के मैं खत्म करना चाहूंगा कि जो हमारा पहला CSR प्रोग्राम था सुपोषण, हमने ईस्ट दिल्ली म्युनिसिपल कॉर्पोरेशन के साथ किया, तब हमारी जान पहचान हुई हर्ष सर से, who was the mayor of East Delhi Municipal Corporation, and in fact it was his initiative that such a program should be done in East Delhi schools, and it became a very successful program. Thank you. Yeah, Dr. Panda was their department was the technical partner, nutrition partner.
May I now invite all the dignitaries to come down from the stage and felicitate our champions from Boscia, which promotes and supports the sport of Boscia, empowering athletes with disabilities through competitive and inclusive opportunities. May I also request Sri Ashok Bedi, Chairman of Boscia, to come forward and join our dignitaries along with Dr. Ravinder Kumar, an esteemed advisory member, with Boscia and a distinguished representative from the Indian Council of Medical Research. We have also amongst us Dr. A.K. Grover, a renowned name in the field of ophthalmology. May I request all the dignitaries to come down? As part of our ongoing commitment to community and excellence through the CSR initiatives of HEAL Foundation, we are privileged to recognize and celebrate the remarkable achievements of our Boscia India medalists. These extraordinary athletes have demonstrated skill, determination, and sportsmanship at the World Boscia Challenger in Cairo, Egypt. May I please request Sri Harsh Malhotra ji to felicitate Ms. Anjali Devi, who won a gold medal in individual BC3 category. Ms. Anjali Devi, gold medalist in individual BC3 category. Now may I request Ms. Sarita Devi, who won a bronze medal in individual BC3 category and silver medal in pair BC3 category. Ms. Sarita Devi, who won a bronze medal in individual BC3 category and silver medal in pair BC3 category. I request Sri Harsh Malhotra ji to felicitate her. I invite, now may I request Ms. Gayatri HM, who won a silver medal in individual BC1 category. Ms. Gayatri, who won a silver medal in individual BC1 category. I request Sri Harsh Malhotra ji to felicitate her. I request Mr. Ajay, who secured the 4th position, but we would also like to acknowledge that Mr. Sachin Chamaria, who won silver medals in both the individual BC3 category and the pair BC3 category, has generously chosen to offer his prize money to Mr. Ajay. Mr. Ajay, I request Sri Harsh Malhotra ji to felicitate Mr. Ajay. Now, may I request Mr. Sachin Chamaria to also be here, who won silver medals in both the individual BC3 category and pair BC3 category. May I request Shri Harsh Malhotra ji to felicitate Mr. Sachin Chamaria. Can I please have Mr. Gobind Bhai, who won a bronze medal in individual BC2 category, to come forward, and request Shri Harsh Malhotra ji to felicitate Mr. Gobind Bhai, who won a bronze medal in individual BC2 category. May I now request Mr. Vinay Kumar Kush and Krishna Kumar Samania, who won bronze medals at International Canoeing and Kayaking Sprint Goodwill Cup Moscow, Russia in 2024. May I please have Mr. Vinay Kumar Kush and Krishna Kumar Samania. This achievement was not only a testament to their athletic skills, but also highlighted the essential support provided by HEAL Foundation under guidance and patronage of Honorable Minister Shri Harsh Malhotra ji. Please join me in extending a heartfelt congratulations and admirations to these champions whose achievements inspire us all and truly represent the values we cherish at HEAL Foundation. May I request all the dignitaries, including our chief guest, Shri Harsh Malhotra ji, and our special guest, our guest of honor, to come on the stage and be seated, please. We'll stand on the stage. Please come over the stage. Yes. Please join me as we continue our celebration today, it is with great pride that we now transition to one of the most revered segments of our event, the Lifetime Achievement Awards. For contribution to the healthcare improvements, this prestigious accolade honors individuals whose unwavering dedication and transformative work have significantly advanced the field of healthcare. The visionary efforts and commitment have not only elevated standards but have also touched countless lives. May I please request to play the presentation? May I request Dr. Kamalpreet Kochar, Professor and Head, Department of Physiology, AIMS, New Delhi, to come on the stage to receive the award by our dignitaries. May I request Dr. Sanjay K. Mattu, Additional Deputy Director General. May I request to assist in handing over the award to Shri Harsh Malhotra ji so that he can felicitate Dr. Kamalpreet Kochar. Dr. Kamalpreet Kochar is a highly respected expert in physiological research and education. With a distinguished career marked by academic leadership, Dr. Kochar has made significant contributions to the field of human physiology. Now, may I request Dr. Sanjay K. Mattu to come forward. Additional Deputy Director General, Central TB Division, NTEP, Ministry of Health, Family Welfare, Government of India. With 28 years of experience as a senior public health professional, TB program manager, nodal officer for management of drug susceptible and drug resistant TB, extrapulmonary TB, digital and AI approach under the program TB and comorbidities, clinical research, public health research, TB program, gender representative approach in the program, and supply chain management. May I request Dr. Rupak Singla, Professor and Head, Department of TB and Respiratory, to come on the stage and receive the award. As the head of the Department of Chest Diseases at the National Institute of Tuberculosis and Respiratory Diseases in New Delhi, for the past 33 years, he has made substantial contributions to the healthcare industry. Can we now have Dr. Subhash Giri, Director, Professor, Medicine, ABVIMS. Dr. Subhash Giri is a distinguished healthcare professional celebrated for his expertise in medical innovation and patient care with a solid foundation in clinical practice and healthcare management. May I request Dr. Manisha Bobade, Chief Executive Officer, KJ Samaya Hospital and Research Center, to come on the stage and receive the Lifetime Achievement Award. Dr. Manisha is a seasoned healthcare leader with over 33 years of experience. Starting her career as an emergency physician, she transitioned into management with a patient-centric approach that balances business fundamentals. May I request Mr. Amitabh Bakshi, Head, Country Government and Public Affairs, Novartis India, to come on the stage and receive the Lifetime Achievement Award. Mr. Bakshi is a distinguished business executive with extensive expertise in strategic management and operational excellence. The last Lifetime Achievement Award goes to Dr. Purushottam Lal, Chairman, Metro Group of Hospitals and Director, Interventional Cardiology. And on behalf of him, we have Mr. Dipesh Kapoor. Can we please have him over the stage? Mr. Dipesh Kapoor on behalf of Dr. Purushottam Lal. Dr. Purushottam Lal is a distinguished interventional cardiologist who celebrated globally for his revolutionary advancements in cardiology. May I request all the dignitaries to now we move forward to our Healthcare CSR ChangeMakers Awards 2024. Can we please have the video? For Healthcare CSR Chainmakers Awards 2024. This is the last segment of today's event, but very crucial. The jury chaired by Dr. Chandrakant S. Pandav and chaired by Dr. Mohsin Wali, and the members we had Dr. Harsh Mahajan, Dr. Shuchin Bajaj, Dr. Urvashi Prasad, Dr. Sunil K. Khetarpal, Mr. R. Shankar, Dr. Ravi Gaur, Mr. Sudhir Mishra, Mr. Manish Rastogi, Dr. Rajiv Gautam, Dr. Nilesh Tiwari, Dr. Rajiv Chibbar, and Ms. Misha Dange. Can we also request all our jury members to come on the stage and felicitate our awardees? Dr. Sunil Khetarpal, Dr. Rajiv Gautam, Mr. Manish Rastogi, Ms. Misha Dange, Dr. Nilesh Tiwari, we are pleased to announce that the jury has completed the meticulous evaluation and scoring for the Healthcare CSR Changemakers Summit and Awards. After a thorough review of all the entries, we are excited to share the results. Please join us as we reveal the awardees who have demonstrated exceptional commitment and impact in advancing healthcare through their corporate social responsibility efforts. The very first category is Women Empowerment Champion Awards. And the award goes to Voice of Slum. Can we have a representative from Voice of Slum for the Women Empowerment Champion Awards? The next awardee under this category is Nari Pragati Social Foundation. Can we have a representative from Nari Pragati Social Foundation? The next awardee is Sushri Shailani Suman. Can we have Dr. Anita Sabarwal, who is a gynecologist with 42 years of experience, and Dr. Antul Tewatia, President Zilla Parishad Bulandshahr, general and laparoscopic surgeon. May I invite all the awardees to come on the stage and receive the Women Empowerment Champion Awards. The next segment is CSR Healthcare Changemaker Awards. We have awardees from Nari Pragati Social Foundation. Can we invite all the women up on the stage and receive the Women's Empowerment Champion Awards? Nari Pragati Social Foundation. The next category is CSR Healthcare Changemaker Awards, for which the first winner is Hindustan Petroleum Corporation Limited as an organizational awardee, HURL. Can we have a representative from HURL? Sorry, Hindustan Petroleum Corporation Limited, HPCL. The next awardee is Bharat Aluminium Company Limited. Can we have a representative from Bharat Aluminium Company Limited? Bharat Aluminium Company Limited for the CSR Healthcare Changemakers Awards. The next award goes to KJ Somaya Hospital and Research Center. Can we have a representative from KJ Somaya Hospital and Research Center to receive the award CSR Healthcare Changemakers? The next award in this category is Mr. Ramnesh Kumar Jairat, founding and managing partner of TNR Associates, Advocates and Consultants. Mr. Ramnesh Kumar Jairat for CSR Healthcare Changemakers Awards. The next category is Medical Technology CSR Awards. And we have one winner from this category, Dr. Ankur Kumar Tanwar, Senior Ayurveda Researcher and Consultant. Mr. Dr. Ankur Kumar Tanwar, Senior Ayurveda Researcher and Consultant for Medical Technology CSR Awards. Congratulations. The next category is Excellence in Social Impact Awards. The first winner is Dr. Ishwar Gilada, recognized globally as the HIV campaigner. Can we have Dr. Ishwar Gilada? The next awardee is Dr. Bhavna Barmi, Medical and Social Psychology, PhD, Psychology Therapist, Clinical Psychologist. Dr. Bhavna Barmi in the category Excellence in Social Impact Awards. Can we have Dr. Anjum Datta, Assistant Professor of Department of Physiology, Subharti Medical College, Meerut, for Excellence in Social Impact Awards. May I please request Dr. Puneet Jain, Clinical Psychologist, Vinayak Hospital and Fortis Escorts Hospital to come on the stage and receive the award in the Excellence in Social Impact category. Dr. Puneet Jain. Can we also have on stage Mr. Saurabh Garg, Chairman of POCT Group? Mr. Saurabh Garg, Chairman of POCT Group. Can we have Dr. Sunita Jaitley from Bhor Living Humanly Foundation? She is the director of the organization, Dr. Sunita Jaitley. The next awardee is Mr. C.P. Arora, Chief of Corporate Planning, VAPCOS. May I please invite Mr. C.P. Arora, Chief of Corporate Planning, VAPCOS, to receive the award in the Excellence in Social Impact category. Can we have Mr. Abhilash, representing NTPC, National Thermal Power Corporation, in the Excellence in Social Impact category? Mr. Abhilash from NTPC in the Excellence in Social Impact category. Can we please have a round of applause for all these awardees? Can we also have RJ Rahul Makin from Fever FM? RJ Rahul Makin from Fever FM in the category of Excellence in Social Impact. Accompanying with RJ Umar Nisar from Mashk Talks. RJ Vishesh Chabra, Punjabi Fever FM. And the team of Red FM Delhi. And RJ Rachi from Big FM. RJ Vishesh Chabra from Punjabi Fever FM, Red FM team, and RJ Rashi from Big FM. Congratulations to all the awardees. Can we now have Ms. Zaina Ali Khan, silver medalist, 39th Delhi State Rifle Matches 2024. She is the awardee of the Achiever Award. Ms. Zaina Ali Khan, silver medalist in 39th Delhi State Rifle Match 2024. Can we also have Ms. Sabira Harris, bronze medalist, Indian team at the Junior World Cup, Porpeto, Italy 2024. In the Achiever Awards category, Ms. Sabira Harris. May I request all the awardees of the Lifetime Achievement Award to come on the stage for the group photograph. All the Lifetime Achievement Award awardees. Dr. Kamalpreet Kochar, Dr. Sanjay K. Mattu, Dr. Rupak Singla, Dr. Subhash Giri, Dr. Manisha Bobade, and Mr. Amitabh Bakshi. Thank you. Can we have all the awardees of the Healthcare Changemaker Awards of all the categories? Social Impact Award, Excellence Award, Women Empowerment Award, and Achievers Award. Can we have all the awardees on the stage for a group photograph? Yes. All the categories of our Healthcare Changemakers Awards. Do we have everybody? I think RJs are missing from the group photograph, please. Please. Now I request everybody to be seated. I request all the dignitaries to be seated, and I request Shri Harsh Malhotra ji to share a few words with all of us.
vote of thanks होगा हैं क्या बोला
बता दे ठीक है हील फाउंडेशन जिन्होंने आज ये सारा दिन का सेमिनार ऑर्गेनाइज किया, उसके कर्ता धर्ता भाई सुदीप श्रीवास्तव जी, यहाँ पर उपस्थित सभी डिग्निटरीज, हील फाउंडेशन से मेरा जुड़ाव 2012-13 से है। तब आपने स्टार्ट किया था सुदीप जी 2010 में, और मुझे याद नहीं है कि इनका पहला इवेंट था, पर मैं चेयरमैन एजुकेशन था एमसीडी में, दिल्ली में, ईस्ट एमसीडी में, क्योंकि एमसीडी में हमारे लगभग 500 स्कूल्स हैं अभी भी। उसमें जो ज्यादातर बच्चे पढ़ने के लिए आते हैं वो बच्चे आते हैं जो बहुत झुग्गी झोपड़ी में रहने वाले बच्चे, जिनके पेरेंट्स के पास उनकी वर्दी लेने के लिए, उनके शूज लेने के लिए भी पैसा नहीं हो पाता है। तो मुझे लगा कि ये बच्चे, बहुत कुछ बच्चे ऐसे लगे, और कुछ में भी लगभग 1 लाख के करीब बच्चे ऐसे लगे कि इनको आवश्यकता है इनकी हेल्थ को ठीक करने की। मेल बच्चे लगे। सुदीप जी मुझे कहीं मिल गए और इनके साथ बैठ के बात हुई, तो मुझे समझ में आया कि इनकी मदद से और ब्रिटानिया फाउंडेशन की मदद से मैं उन बच्चों की कुछ मदद कर सकता हूं। हालांकि सबको लगता है कॉरपोरेशन है, सरकार है, लेकिन हर इंस्टीट्यूट की, हर सरकार की अपनी लिमिटेशंस होती हैं। तो उस मुहिम में हम जुड़े और हमने लगभग 1 लाख बच्चों को, आदरणीय पांडा जी भी बैठे हैं यहाँ पे, डॉक्टर पांडा उस समय एम्स में इन्होंने हमारी मदद की थी, एम्स हमारा पार्टनर था। उन बच्चों की हमने हीमोग्लोबिन स्क्रीनिंग की और उसमें लगभग 60,000 के करीब बच्चे ऐसे पाए जिनका हीमोग्लोबिन 10 से नीचे था, बल्कि 8 से नीचे भी पाया। तो एक चैलेंजिंग काम लग रहा था, सभी को लग रहा था आप चेयरमैन एजुकेशन हो, किस चक्कर में पड़ गए भाई।
थोड़ा और देख लो। मुझे लगा, मैंने कहा एजुकेशन तो कर लेंगे, लेकिन एजुकेशन तभी होगी जब ये बच्चे हेल्दी होंगे। अगर हमने इनकी हीमोग्लोबिन लेवल बढ़ा दिया तो ज्यादा बेटर होगा, एजुकेशन तो हम दे ही देंगे। फिर हमने ब्रिटानिया फाउंडेशन से बात की, उन्होंने फोर्टिफाइड बिस्किट्स स्पेशली डेवलप किए जिसमें कैल्शियम और आयरन था, और उसको 2 बिस्किट्स का पैकेट बनाया, क्योंकि एमसीडी में हमारा स्कूल हेल्थ प्रोग्राम के अंतर्गत हीमोग्लोबिन का कंटेंट बढ़ाने के लिए आयरन टैबलेट्स दी जाती है, और छोटा बच्चा जो 3rd, 4th, 5th का बच्चा है वो टैबलेट खा के खुश नहीं है, खाता नहीं है, फेंक देता है। इस कारण से हमने सोचा कि बिस्किट्स खा लेगा, तो हमने 6 महीने तक हील फाउंडेशन, ब्रिटानिया फाउंडेशन और ईस्ट दिल्ली म्युनिसिपल कॉरपोरेशन और एम्स ने मिलकर ये प्रोग्राम चलाया। और वो प्रोग्राम हमने जब 6 महीने उन बच्चों को फोर्टिफाइड बिस्किट्स, डेली 2 बिस्किट्स दिए, तो 6 महीने के बाद उनको दोबारा स्क्रीनिंग की, तो एवरेज हीमोग्लोबिन का जो हमने इंक्रीज पाया वो 1.2 ग्राम था। और ये एक बड़ा अचीवमेंट मानता हूं मैं, हील फाउंडेशन का भी, ब्रिटानिया का भी और एमसीडी का भी, कि इनिशिएटिव लिया, एम्स ने मदद की। आज भी सोसाइटी में जब सरकार ने ये मैंडेटरी किया है कि कंपनीज को अपनी एनुअल इनकम में से 2% सीएसआर निकालना पड़ेगा, और वो मैंडेटरी है, और उसको सोशल कॉजेज के लिए खर्च करना है। मैं बाय चांस उसी मंत्रालय का मंत्री भी हूं, एमसीए के अंडर ही आता है वो। अभी जितना मैं 2-3 महीने में, 4 महीने में देख पाया हूं कि वो बहुत सा फंड्स लैप्स होता है। अगर वो फंड, वो कंपनीज सोशल रिस्पॉन्सिबिलिटी में खर्च नहीं कर पाती हैं, तो वो डेफिनेटली प्राइम मिनिस्टर रिलीफ फंड या ऐसे 3-4 फंड्स हैं, उसमें वो फंड ट्रांसफर हो जाता है, अदरवाइज वो सोसाइटी के काम आता। वैसे जो सरकार की तरफ वो फंड जाता है वो भी अल्टीमेटली पब्लिक एट लार्ज के ही काम आता है, लेकिन जब डायरेक्टली हमारे पास है और हर साल निकालना है, हर साल उसको कंज्यूम करना है। मैं अभी देखा, मैं सुदीप जी से सुबह पूछ रहा था कि क्या कार्यक्रम कर रहे हैं, कौन लोग उसमें आने वाले हैं, पार्टिसिपेंट्स क्या हैं, और इस आपकी इस कॉन्फ्रेंस का आउटकम क्या आने वाला है। तो मैं इसीलिए सुदीप के इस कार्यक्रम में भी आता हूं कि सेल्फलेसली, इन रियल सेंस, हील फाउंडेशन सोसाइटी के उस सेक्शन के लिए काम कर रही है जहां पर सबसे ज्यादा जरूरत है, और वहां पर सरकार भी नहीं पहुंच पा रही है, पर सीएसआर के माध्यम से सरकार ही पहुंच रही है, सरकार के कारण ये बात संभव हो पा रही है। और जो बड़ी कंपनीज सीएसआर जिनको मैंडेटरीली स्पेंड करना है, मैं उनका भी बहुत धन्यवाद इसलिए करता हूं कि वो उदारता से अपना फंड ऐसे एनजीओस को, ऐसे फाउंडेशंस को देते हैं जो इन रियल सेंस समाज तक वो पैसा पहुंचाते हैं, जहां पर या उनकी हेल्थ, एजुकेशन, शेड्यूल 7 ऑफ कंपनीज एक्ट में ऐसे लगभग 12 हेड्स हैं जिसमें सीएसआर को स्पेंड किया जा सकता है। उस पर और स्टडी करने की जरूरत है। वो लगभग इतना वास्ट है कि सोसाइटी के हर फील्ड में आप सीएसआर को स्पेंड कर सकते हैं। स्पोर्ट्स, एजुकेशन, स्वच्छता, हेल्थ, ऐसे 12, आर्ट एंड लिटरेचर, 12 सेक्टर्स है, और उसमें लगभग सभी कवर भी होता है। मैंने देखा यहाँ बहुत से एनजीओज हैं, उनको अवार्ड भी किया गया है, बहुत से डॉक्टर्स बैठे हैं, बहुत से हॉस्पिटल्स के हेड्स बैठे हैं, स्पोर्ट्स के बहुत से बच्चे हैं, और पैरा एथलीट्स हैं, पैरा स्पोर्ट्स वाले मैंने बच्चों को यहाँ पे देखा है। मेरे को अभी 4-5 दिन पहले, क्योंकि पब्लिक हमारे पास आती है, उनकी कोई परेशानी होती है, तो कुछ बच्चे किसी स्पोर्ट्स के फील्ड में पार्टिसिपेट करने जाना चाहते थे, उनके पास फंड्स नहीं था। मैंने सुदीप से रिक्वेस्ट की, तो सुदीप ने उन बच्चों को कुछ मदद की उनके आने जाने के लिए, और वो दोनों लोग पीछे बैठे हैं, उनको अभी अवार्ड भी किया है हमने। तो ये हम जब सपोर्ट करते हैं सोसाइटी के हर सेक्टर में, तो इसका अपने आप को जो सेटिस्फेक्शन होती है वो होती ही है। पर मैं मानता हूं कि भारत की संस्कृति बड़ी रिच संस्कृति है, और हम सब लोग किसी ना किसी भगवान को मानने वाले, गॉड को मानने वाले, ऑल माइटी को मानने वाले लोग हैं। उसकी भी दया दृष्टि उन लोगों पर होती है जो समाज के लिए सेल्फलेसली काम करते हैं। ऐसे आप सब लोग यहाँ बैठे हैं, मैं आप सबका बहुत बहुत आभारी हूँ। आपने मुझे यहाँ बुलाया, मुझे आपसे मिलने का मौका मिला। बहुत बहुत धन्यवाद। भारत माता की जय। एक मेरा रिक्वेस्ट और भी है, जो डिग्निटीज को आपने या मोमेंटो दिए उनको तो ठीक है, पर ये जो नेता लोग आते हैं ना, इनको कोई मोमेंटो मत दिया करो, इनको कुछ कोई पेन, कोई बुक दिया करो, कोई कॉपी दे दिया करो। मोमेंटोज हमारे लोगों के लिए, हमें अच्छा लगता है कि आप लोग हमें सम्मानित करते हैं, बट सुदीप भाई, मैं आज सुबह से 4th 5th प्रोग्राम में हूँ। मैंने बहुत एसोसिएशंस को इस बात के लिए मजबूर कर दिया है कि वो मोमेंटोज ना ही दिया करें, उसकी जगह कुछ यूटिलाइजेशन की चीज दें, कोई ऐसी चीज दें जो कुछ और इनोवेटिवली सोचिए।
I request Dr. Sudhir Srivastava to honor our Honorable Minister Shri Harsh Malhotra ji, in spite him telling us not to give it to him. But it's just a token of appreciation and gratitude for you, sir. And may I also request Dr. Chandrakant S. Pandav to come on the stage. Dr. Chandrakant S. Pandav. Please. Thank you for being here, sir. Thank you for your presence. May I request Dr. Soumitra K. Rawat to come on the stage, and we want to thank him for his presence. I request Shri Harsh Malhotra ji to honor him with a shawl. I request Dr. Ram Kumar to come on the stage and receive a token of gratitude and appreciation from us. Dr. Ram Kumar from Seva Bharti. I request Shri Harsh Malhotra ji to give the token of gratitude to Dr. Ram Kumar. I request today's guest of honor, Major General K.K. Sinha, to come on this stage and receive a token of appreciation. Major General K.K. Sinha. I request Shri Harsh Malhotra ji to Thank you everyone for being here. Such a patient audience. Thank you for your presence. I request all our dignitaries to pose for the one last photograph. Today's last group picture. Thank you. Thank you all the dignitaries, all the speakers, all the awardees, all the attendees, our medalists, our champions from Borussia. Thank you everyone for being here. Thank you so much. Have a good day.